younger age groups, even 0 to 9 and 10 through 17, has largely increased since late April, early May, and has increased to almost a quarter of the population. And we definitely see the 18 to 29-year-olds and the 30 to 39-year-olds increasing pretty significantly over this time frame too. So again, different ways to paint the picture. We see different trends in the city of Milwaukee as we do the suburbs. I'll flag very uniquely that week 5 here in the suburban communities is the week where we tested all of the residents of the House of Correction. So that kind of skewed the data for that particular week. But again, looking at the data, we've seen some pretty significant trends over the last 4 months. Disease is still there. The disease burden is changing amongst our subpopulations. And there's lots of measures that we can and do need to take to keep ourselves safe throughout the community. So with that said, I will end and I'll turn it back to Catherine and we can move on with our briefing. Thank you.
Thank you, Director Roush, and you teed it up well. So we'll hear first from our guest, Tiangelo. Thank you for joining us today. And you are on mute. There we go.
I am. I am off mute now. Thank you all for having me on today to talk about the pandemic that we're all living through. As a 28-year-old married man, I recognize that this pandemic has halted some real life experiences. I had a musical festival anniversary trip planned, and I had a brotherhood trip out of the country planned. I had to cancel them because we are living in a pandemic where folks are dying. I say that bluntly because that is what we have to think about. Are the safety asks in front of us truly that life-altering? Wearing a mask, we know doesn't hurt or damage our lungs, yet we fight wearing them. This is a time to truly be selfless and think of those who are at a greater risk of COVID-19. When we factor that in, the small things we have to postpone or give up are greatly insignificant. Let's be safe over this barbecue holiday weekend. Let's wear our masks and keep our elders and parents safe from harm. Let's also share this message with our peers who are stepping out of the lines of safety. Let's say to our friends, if you go outside frequently without a mask, then we can't see each other in person. Let's make it plain to our friends where we stand. Safety first, and COVID-19 corona will end. If we don't, then we will be in this pandemic longer than what any of us want, and more lives will be lost. Let's stay safe. Thank you.
Awesome. Thank you, Tiangelo. And we'll hear from our final guest, Francisco Sanchez.
Hi, everybody. My name is Francisco Sanchez. I'd just like to start off by letting everybody know that I appreciate the opportunity to talk with all of you today. I'm not saying anything new to state that this pandemic has altered all of our lives. Although we might not have been physically affected by it, the emotional, social, and mental toll that it has taken on us has been clearly evident by a response to everything reopening, right? As more places open, we're quick to jump to the fact that now we can go out again and we're not confined to our homes anymore. The reality is that our response has not been a very positive one as displayed by the numbers. We have to continue to take these precautions. If we do not take these precautions, we're simply going to keep spiking these numbers, affecting all of those around us. And as Tiangelo mentioned, we need to stop thinking selfishly. We have to be a little bit more selfless. We have to start thinking about the ways that we can help prevent this from spreading. As I said, the pandemic is not over. Just because we're tired of COVID does not mean that we do not have to take the safety precautions. Just because we're tired of COVID doesn't mean that it's gone. As the numbers show, it's still very much present. Nobody is saying that our lives need to come to a halt. What we're saying is that we need to take a couple of steps towards being more preventative and preventing any of that from having to happen again. Please wear your mask. Please respect social distancing recommendations, and please go get tested. Just because you don't feel that you have it does not mean you do not have it. Please be sure that you're getting tested. This is not only about you, it's about all of us. As County Executive David Crowley mentioned, we're not invincible. This might be a minor inconvenience to all of us, wearing a mask, having to sanitize our hands, having to stay away from each other, having to hang out outside might be an inconvenience to some of us, but it's really going a long way in helping us prevent this virus from spreading. I encourage all of you to stay safe. I encourage you to have these conversations with your friends. I encourage you to do the right thing and take as many precautions as you can to prevent from spreading this virus. Whether you're at a cookout with family and friends, Whether you're outside enjoying some fresh air at the park or at Bradford Beach, or whether you're out on the streets protesting your right to protest, I encourage all of us to stay safe, to make sure that we're doing what's best for us and for all of those around us. This is not just about us. It's not just about you. It's about Milwaukee. It's about our city. It's about all of those that we can affect. So that being said, I'll give it back to you, Catherine.
Thank you so much. We appreciate you both joining us. And now we'll move into the Q&A portion. So our first question comes from TMJ4, and it's for Mayor Barrett. They ask or state that Milwaukee police say that 177 safer at home violations issued between March 25th and May 12th went to African Americans. Do you have any takeaway from this data, and can you comment on it?
Yes, I certainly do. As you may recall, the safer at home resolutions or edicts that came from the city and the county, from the city and the state, were designed to make sure that people did not get infected and didn't spread the disease. Of course, when I looked at the racial makeup of those who got tickets, I am concerned because I think at this time in particular, racial equity has to be one of the major concerns that we're dealing with. And I'm going to look much more in depth at those tickets to see if there were other charges that were occurring at the same time. But as I have said repeatedly, and I'll say it again now, our laws need to be enforced in an equitable way. And I want to make sure that even with this order, that we're doing everything we can, that we have a fair distribution of justice in our city. That doesn't mean quotas or anything like that. What it means is I want to make sure that the law is being applied the same way to everyone. And so I will look at that. Again, the numbers jumped out at me just as they did, I think, to a number of people who looked at those numbers. And I want to make sure that we're fair.
Thank you, Mayor Barrett. Our next question is from Olivia Richardson with WUWM, and she has a listener who wants to know if the county and city encourage people to do their own form of contact tracing by keeping a contact calendar if they're wondering if this could help slow the spread of coronavirus.
I'll take a stab at that.
Please.
Any record of who you've been with over time and where you've been certainly isn't a bad idea. We know that doing disease investigation and contact tracing historically for other diseases, just people's recall and remembering what they might have eaten or where they might have been or who they might have been with in cases of other types of diseases is very difficult. But I don't think that's the end all be all. So keeping that list is important, but I think even more important than keeping a list of people you are around is just trying to remember to keep that circle of people that you've been in close contact with small. We've talked here today about continuing to wear masks, stay physically distant. All of those things are probably way more important in stopping disease spread than keeping a list of who you've been with and where you've been. But all are good solutions, but certainly don't do one without doing all of them.
And the second portion was, are we looking into any other methods for contact tracing, such as apps or anything else that you're aware of?
There are some solutions that the state health department has been looking at to make contact tracing more efficient and to bring some more technology into it, but I don't know exactly where we are in deploying those. I know there are some apps and some smart technologies that have been deployed in other states. I'm not exactly savvy enough in my technology to know how those can be used or how they even work. But certainly the best tool we have available to us in public health is contact tracing. And the best thing that all of you who are listening to this briefing can do is answer the phone when we call, return messages when we call, tell us where you've been, who you've been with, the things that we need to control this disease. And with that information, we can work very diligently to try to mitigate this disease as best we can.
Thank you, Director Rausch. Our next question is from Rebecca Clough with TMJ4, and it's for County Executive. She asks, why do park bathrooms continue to remain closed? families and people with disabilities have to use porta potties at places like Veterans Park and McKinley Marina. Will more facilities be opening during the holiday weekend so that families can access them?
It's a really good question. So we are doing everything that we can to allow as much access to the parks, but we also understand that those small areas could also be a potential area where we can spread COVID-19. But because of the impacts that we have received as well as a result of COVID-19, we don't have as many park staff right now. So we don't have as many folks cleaning. We don't have the maintenance workers that we usually have because we just, the budgeting issues that we're facing right now is becoming really a problem. And so we want to continue to encourage folks to utilize our parks, but it is an issue. We definitely understand it, and we're doing everything that we can to rectify the issue.
Thank you, County Executive. Our next question is from Nick Williams with the Milwaukee Business Journal. And he asks Director Roush if you can comment or give an update if the suburban communities will be moving into Phase D.
Yeah, I don't have the dashboard in front of me right now, but and maybe Dr. Weston can fill in because we were on the same call looking at the metrics this morning. The metrics in the county did not improve, so we will not be moving to Phase D. That's the long and short of it at this point. And until those metrics improve, we'll be staying at the same phase that we're at.
Thank you for the update. Our next question is from Mary Spacuzza with the Milwaukee Journal-Sentinel, and she asks, have any Milwaukee bars and or restaurants been linked to recent coronavirus outbreaks? If so, which ones? We don't have the commissioner on the call, but I don't know, Mayor Barrett, if you have any comments for that.
I've seen several news reports of various bars that have had employees test both within the city of Milwaukee and in some of the suburban and outlying areas. But I don't have the list in front of me either. It's something that the health department, we can get you that information if you want, but I simply don't have that information with me right now.
All righty, thank you. Our next question is also for Mayor Barrett, and it's the mandate will put the onus on the enforcement of the business owners, and that could create strife between owners and customers. What would you say to them? I'm assuming the mandate is related to the masking policy?
Right. Obviously, nothing has been passed by the Common Council or promulgated by the Health Commissioner, and we continue to have conversations. We have had a significant number of restaurants that have reached out to us that would very much like to see a mask mandate. And I would say that question has in it, implicit in that are the two major questions. One, the enforcement, and second, what should the penalty be? And this goes back to the earlier question about the number of tickets that were given out for the safer at home order. I don't want to have a huge racial disparity in tickets being issued for people not wearing masks. And so we have to be mindful of that. I also think that there is an appropriate role for businesses to play in this. And not to sound flippant, but I think that many businesses have a no shirt, no shoes, no service type mandate to them. And I would say that as we develop something, that's similar to what we're talking about here, is that if you want to be served in a restaurant or if you want to go into a retail establishment, that part of that is that you have a mask, not just for your own benefit, but for the benefit of the others in the establishment. But again, nothing has been passed. So this is all part of the conversation that we're having with the Common Council and with community members and business interests that are very interested in the mask issue as well. So stay tuned on the mask issue.
All right. And another question for you, Mayor Barrett, from Nick Bohr with WISN. He's asking if you can comment on using Pfizer Forum as a polling location to help spread out people and provide more space for social distancing.
Well, I love the fact that LeBron James and other players in the NBA have become very, very active in trying to advance safe voting. They're obviously interested in health concerns, but they're interested in people being involved in our democratic process. We have been very, very active after what we went through in April to make sure that for both the August primary and the November general election, that notwithstanding all of the curveballs, and there were so many curveballs that were thrown our way in that April election, that we're doing everything we can to have first a safe election, obviously a fair election, an impartial election. And To that end, what we did just in the last couple of weeks is we have had our Common Council approve a file that I had worked with them on to have 15 additional early polling sites that would be near every single aldermanic district. Wouldn't necessarily mean there would be one in every aldermanic district, but there certainly would be one near every aldermanic district. What we did in April and what we will do in August and November is we'll also have what I call a marriage between our health department and our election commission. Because these are no longer ordinary elections. We have to make sure that the social distancing is part of that. So to answer the question, I need more information. Obviously, I saw the newspaper report of it. I haven't seen any of the particulars, but we're obviously trying to do what we can to make sure that we have a safe, impartial, fair election.
All right. Our next question is from Shepherd Express, and it's for Dr. Weston. They ask, or they state that the Wisconsin DHS report for today has 391 deaths in the county, while the county dashboard
The National
is
Institute of
reporting
Mental Health, nearly 1 in 5 adults lives with a mental illness. Ensuring proper supports are in place for families to manage and treat these illnesses should be a priority. So there are 22 bills before us today, and many of these bills have a bipartisan consensus. I appreciate that you have included the bills that I mentioned in my letter, specifically H.R. 3539, the Behavioral Interventions Guidelines Act, which I worked on with Dr. Drew Ferguson of Georgia. We had successful behavioral intervention programs in schools in our states, and that inspired us to work together. For me, it was hearing from the leadership at Texas Tech University Health Science Centers and their program to provide training for behavioral health intervention and telebehavioral health services at schools in rural West Texas. School-aged children are a prime age to identify and treat behavioral health issues before they worsen. I believe this bill is even more important now. Students have been away from school and friends during a difficult time, and some may be dealing with the loss of loved ones or being home with family, a difficult family situation. I hope that we will advance this bill toward markup. Other bills cover a wide range of important issues, from improving the National Suicide Prevention Hotline to extending the authorization for community services block grants. These bills will ensure stable, high-quality resources for those in need. One issue not addressed today is the mental health of the frontline healthcare worker. And this is especially important now. And I believe this has long been a serious issue in our healthcare system, but has taken on added importance with the additional stress that caring for the seriously ill coronavirus patient entails. I do have concerns about the Medicare bills. I do oppose opening Medicare's definition of what is a physician. I do support telemedicine. It's been critical during the coronavirus for many services, but we must make sure that appropriate guardrails are in place because we don't want it to be used inappropriately, as been noted by MedPAC and the Government Accountability Office and the Inspector General. We must also seriously evaluate if resources are better focused on getting psychologists and psychiatrists into underserved areas. I unfortunately need to devote some time to process. There is a strong bipartisan commitment to improve our nation's mental health. So I'm frustrated by the majority's willingness to make even small changes to some of the bills to accommodate some concerns prior to this hearing. And you know, when compromise was clearly possible, we didn't. Majority staff acknowledged that changes would make some of these bills easier to enact. Still, what were introduced were very partisan bills instead of what we'd been working on to secure Republican support. Unfortunately, this has become all too predictable in the public health space in this Congress, which is sad because historically it is the public health space where this subcommittee comes together to legislate the most. It also concerns me that we are considering bills as introduced rather than the language negotiated as part of the bipartisan efforts. And this is not the first time that the majority and minority have had an agreement only to have the majority move the goalposts. It makes it difficult for members on this side of the dais to trust you and the agreements that are made. Ignoring our requests, our reasonable requests, actively harms the legacy of this committee. And it did not need to happen. I'm puzzled why it did. You should fully expect members to file amendments should bills be brought up to markup that you were unwilling to engage with us or our staff and then refused to acknowledge our proactive outreach and ignored our flagged concerns. My expectation for a supposedly non-controversial markup is that you will not notice these bills, but the ones where the general agreement had occurred. Many issues, but especially mental health, should rise above partisan politics. We should come together to change the landscape and provide the much needed resources to individuals who are struggling with mental health issues. And I'll yield back.
Gentleman yields back. Everyone was not on when I said this earlier, but we expect votes between 11:15 and 11:30. We're not going to recess since we'll be voting in shifts. So the full committee chairman, Mr. Pallone, has agreed to chair the hearing when I go over to the Capitol to vote. So thank you for that. The chair now recognizes the chairman of the full committee, Mr. Pallone, for 5 minutes for his opening statement. And remember to unmute, please.
Thank you, Chairwoman Escher, for convening the hearing today, the legislative hearing on 22 bills to improve both quality and access to mental health care in our country. And of course, I want to welcome back our former colleague, Patrick Kennedy, who everyone knows now is, if you don't, I'll tell you, is a New Jersey resident, actually a resident at the Jersey Shore, which I'm particularly fond of. I understand, coming from the ocean state to the Jersey Shore, so you've been there for a few years now, so I really shouldn't be welcoming you, but thank you. Good to see you, Patrick. This hearing is particularly timely as our nation is simultaneously confronting a global health crisis, a severe economic downturn, and centuries of systematic racism. All three of these crises are understandably triggering distress for millions of people, and it is compounded by the fact that many people are isolated from family and friends. It's no wonder that nearly half of Americans are reporting that their mental health has been negatively impacted due to worry and stress in recent months. And mental health is an essential part of our overall health and well-being. Thanks to this committee's work, we've made progress to better incorporate comprehensive mental health care into our healthcare system. We've improved insurance coverage for mental health services through the Mental Health Parity Act of 1996, which I think Patrick was involved with, and the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act of 2008. And thanks to the Affordable Care Act, which we voted to enhance yesterday, millions of Americans now have access to comprehensive health insurance plans that include mental health services. The ACA dramatically improved access to mental health and substance use disorder benefits by requiring individual and small group insurance plans to cover these benefits. As a result, millions of Americans can now access mental health services and substance use disorder treatment without fear of exorbitant out-of-pocket costs that all too often deter people from seeking treatment. And the ACA also applied mental health parity requirements to individual market plans. Now, we continue to build on this progress in 2016 when President Obama signed the 21st Century Cures Act into law. It expanded access to mental health services for children through Medicaid, improved coordination between primary care and behavioral health services, and reauthorized important programs, including those focused on suicide prevention. Again, thank you, Congresswoman DeGette and Upton for their role in that. And taken together, all these legislative changes have made a true difference in American lives, but there's a lot that has to be done to help people in need. In 2018, more than 47 million Americans said they suffered from a mental illness over the past year, including more than 11 million who had a serious mental illness. Research estimates that more than 7 million American children have a mental health disorder. And tragically, far too many of these conditions in children go unidentified and untreated. And research has found large disparities in access to mental health services amongst Black and Latino children. And we also know that people experiencing mental illness are at a higher risk of developing substance use disorder. According to surveys, roughly half of individuals experiencing mental illness will also experience a co-occurring substance use disorder. And this underscores the importance of expanding access to both mental health and substance use disorder treatment. This is particularly important as we continue to respond to the opioid epidemic that claims 130 lives every day as well as emerging epidemics involving cocaine and methamphetamine. Unfortunately, suicide has also been on the rise. In 2018, more than 10 million Americans seriously contemplated suicide, and 1.4 million people made non-fatal attempts. Suicide is now one of the top 10 leading causes of death in the U.S. and is the second leading cause of death among young people ages 10 to 34. Today, less than half of those with mental health conditions get treatment, with many citing the inability to pay for services as their primary reason for not seeking treatment. And individuals in need of care also often cite stigma and fear of discrimination as reasons for not seeking treatment, and many others report difficulty gaining access to providers due to workforce shortages. And all of this speaks to the urgent need for additional action to help those in need. That's why we're considering a variety of policies, including proposals to improve mental health parity, mental health services for students and in the emergency room, and suicide prevention programs. And taken together, these proposals are focused on improving our nation's well-being. So I want to thank our witnesses, thank everyone. You know, this has always been, as has been mentioned, a bipartisan issue for our committee. Many people have spoken out. Many people have told their individual stories, which is often difficult, but I admire those who do that. And again, thank you, Chairwoman Escher. This is a really important legislative hearing. And as you mentioned, we do intend to move bills. Thank you again.
We thank the chairman of the committee, and he yields back. It's now a pleasure to recognize the ranking member of the full committee, Mr. Walden of Oregon, for his 5 minutes for opening statement.
Good morning, Madam Chair. Thank you very much. Good morning, Madam Chair, and I thank you for holding this hearing. I think it's a really important hearing, and one that we have a lot of work to do on. I would share some frustration at the outset about the bills and the lineup. I'm hopeful that we can work through, as Dr. Burgess said, some of these legislative initiatives where we'd already found some agreement, but we're hearing the underlying bill, not what had been agreed to. So, as Chairman Pallone said, this has always been bipartisan work. Mental health issues do not pick us by our voter registration, and there's a lot of bipartisan work done here. I also must express a little frustration. I had trouble getting on, so maybe that's where my frustration starts this morning, but that we're going to roll through with the votes, because the way we're voting and the elongated voting and all, I know some of our members are a little concerned about missing out on some of the presentation and the Q&A with the hearing going on. I think for a future period, we should have a discussion about how we do that. Too many of us have lost loved ones because of suicide, like my friend, former Oregon U.S. Senator Gordon Smith, who tragically lost his son, Garrett Lee Smith, one day before his 22nd birthday. I worked with Senator Smith on the original Garrett Lee Smith Memorial Act, which provides information and training for suicide prevention, surveillance, and intervention strategies for all ages. I was proud to see this important program reauthorized and expanded in cures. Many of the bills before us today will further improve crisis intervention and suicide prevention. I'm looking forward to working with our colleagues in the majority to move these bills through the legislative process. Consideration of these bills could not come at a more pressing time. As we all know, COVID-19 and resulting economic downturn have impacted the mental health and well-being of all Americans. A recently released report by Wellbeing Trust and the American Academy of Family Physicians predicted that an additional 150,000 Americans could die because of suicide or drug and alcohol misuse as a result of the pandemic. These deaths from despair, as they're called, will likely increase as continued lockdowns further isolation and deepen the economic downturn. States will need resources to help prevent them. However, I'm concerned that one of the bills would make states ineligible for mental health and substance use disorder grants if they cannot meet the bill's mandates. Under this bill, certain states would be stripped of all SAMHSA funding, including substance abuse prevention, treatment, and community mental health services block grants. My friends in the majority may not have considered that these mandates are logistically impossible to meet, as many states do not have year-round legislatures. Furthermore, cutting states' critical funding at a time when they're needing it the most is simply not acceptable. So I wish the majority would take the time to work with us on consensus language on some of the bills today, but we've covered that, and we'll look forward to working with you as we go forward. And so with that, Madam Chair, I will yield back, knowing that we have votes coming up.
We thank the gentleman, and he yields back. I now would like to introduce our witnesses for today. First, the Honorable Patrick Kennedy. He's the founder of the Kennedy Forum, as well as we all know, a beloved former colleague of the House of Representatives and a representative where he represented Rhode Island's first congressional district. Welcome to you, dear Patrick. Thank you for being with us. It means everything to us to have you here with us. Dr. Arthur Evans Jr. is the Chief Executive Officer of the American Psychological Association. Welcome to you and thank you for being with us. Dr. Jeffrey Geller is the President of the American Psychiatric Association and the Director of Public Sector Psychiatry at the University of Massachusetts Medical Center, School, I should say. Thank you, Dr. Geller. Ms. Ariana Gross is the National Youth Advisory Board member of the Sandy Hook Promise Students Against Violence Everywhere. It's called SAVE, a Promise Club. Welcome to you, and thank you for being with us. We're so pleased. We really are. It's an honor. Former Congressman Patrick Kennedy, you are recognized for 5 minutes, and please remember to unmute. We don't want to lose one word you have to offer to us. Thank you.
Thank you, Madam Chairwoman. Anna, it's so great to see you always, your family. And I just want to say, in addition to your being family, it was nice that you shared your opening remarks with family, my cousin Joe, who does everything I tell him to do on mental health. And I'm so honored that he's a member of this committee, which has such important jurisdiction over this critical issue to our nation's health. And I want to thank Chairman Pallone for his leadership, Chairman Burgess and Chairman Walden for the opportunity to address all of you. And of course, as I look in the screen, I see so many of my former colleagues, and I'm so grateful for the opportunity to see your faces, some of whom are covered by face masks. Kudos to you for setting a standard and a model. So, you know, I get acknowledged for having some great courage on this, and it often was the case with my great colleague and co-author of the Mental Health Parity and Addiction Equity Act, Republican Jim Ramstad, and I appreciate this is a bipartisan process, especially on mental health, which affects every family. We can go around saying it's 1 in 4 or it's 50%, but we all know in our own lives, it's every family. And Jim always used to say, you know, Patrick's got the same kind of profile and courage as his uncle, President Kennedy. And I always would stop him and I'd say, I didn't have any courage about coming forward because what happened to me was the guy that I was in drug rehab with at 17 wrote about being in drug rehab with me in the National Enquirer, and he sold his story to the National Enquirer. So basically, I had no out. It was, I wanted to keep the fact that I had suffered from addiction from an early age private. I didn't want anyone to know. And what ended up happening was I had no choice in the matter. I came from a public family, and unfortunately, like everything else, it all was made public. I would say that was probably the best thing that ever happened to me in my life, in the sense that, for one thing, as a congressman, I didn't have any fear for being an outspoken proponent for mental health. And it was because I didn't have to worry about the press reporting about why I was a supporter of mental health, because they somehow had the goods on me, you know, that they could hold it against me that I would disclose this private factor in my life. And it also helped address the main point, and that is that we keep these illnesses secret. And these illnesses being secret are the reason why they are exacerbated. So let me just say, in recovery, we say we're only as sick as our secrets. And I would say, even though we've made great progress on mental health, we're still very sick as a nation because we keep these things secret. I also think in recovery, we have these phrases like, you know, it's you got to walk the walk, not talk the talk. And in our country, we have really just talked the talk. We've never walked the walk on including mental health and addiction treatment in our country on par as we would cancer, cardiovascular disease, or any form of treatment that we would expect from our medical system. And then finally, I would say that denial is the big issue here. And we all know growing up in families where there's alcoholism and addiction and or mental illness that we don't like to talk about these things. And I frankly think the reason we as a nation have not addressed this issue is because we're still in deep denial about these illnesses and their pervasiveness. And the evidence in Exhibit A of that is the fact that Congress and the country has really never appropriated the necessary resources for this crisis, to Chairwoman Eshu's point earlier. And they've never enforced the Parity Act, which, as I said, was a bipartisan bill that simply says treat these illnesses like other chronic illnesses. And until there's that same urgency towards enforcing, and until there's that same money backing up our words that these are really equal illnesses, we're really still in denial as a nation. And I look forward to hearing my other counterparts testify and to answering any of your questions. And my time is up. Thank you for letting me share.
Thank you. And we need to heed your words, Patrick. Thank you very much. Now I'd like to recognize Dr. Evans. You're recognized for 5 minutes, and please remember to unmute, Doctor. And thank you again for being with us. We so appreciate it.
Thank you. Chairwoman Eshu, Ranking Member Burgess, and members of the Subcommittee on Health, thank you for this opportunity to testify today. The American Psychological Association is a leading scientific and professional organization representing psychology in the United States with more than 121,000 researchers, educators, clinicians, consultants, and students as its members. Even before COVID, our mental health system was facing severe challenges. Less than half of the individuals with a mental health disorder receive treatment, and only about 1 in 9 individuals with a substance use disorder receive treatment. The tragic result is that we have multiple crises happening simultaneously. We have a pandemic that is creating a number of psychological challenges for individuals. We have, on top of that, an economic crisis that is also contributing to the psychological distress of Americans. And then on top of that, more recently, we have been dealing with systemic racism and the impact that that has on many of our fellow Americans. All of this results in data that show consistently across a number of different sources that we are seeing increases in anxiety, depression, post-traumatic stress disorder, and eating disorders. This is having a disproportionate impact on marginalized communities. The public health term for this is syndemic, a disease that is spreading more rapidly as a result of social inequality and injustice, impacting those already at higher risk for poorer health. To address this syndemic, we need a population-based approach that targets appropriate interventions across a population, including addressing social determinants of health. An example of the power of addressing social determinants like housing is when I worked as Commissioner for Behavioral Health in the city of Philadelphia. My agency, working with the housing agency, leveraged Section 8 housing funding with Medicaid funding for mental health services to address homelessness. As a result of this, we were able to improve mental health outcomes. We were able to get over 800 people off of the streets of Philadelphia, and we saved literally hundreds of thousands of dollars. A win-win-win. We need improvements on a number of fronts. as would be addressed by the array of bills before you today. This includes stronger parity enforcement, enactment of the Mental Health Parity and Addiction Equality Act of 2008 was a major step forward, and my fellow panelists and good friend, Congressman Kennedy, will forever deserve our thanks and our gratitude for leading this fight, which APA was proud to be a part of, along with our colleagues at the American Psychiatric Association and many other groups. Unfortunately, parity has not reached its full potential, and we need support for the parity bills before the committee to strengthen existing law. We also need to give patients better access to mental health and substance use providers. One of the bills before you, HR 884, the Medicare Mental Health Access Act, would incentivize mental health service delivery in rural and underserved areas by making psychologists eligible for mental health shortage area bonus payments. I want to thank the bill's longtime champion, Congresswoman Schakowsky, co-lead Congressman Mullen, and co-sponsors Congressman Gianforte, Congressman Lee Hahn, and Congressman Long for their support. I'd also like to highlight Congresswoman Matsui's Telemental Health Expansion Act, or Telehealth Expansion Act. CMS has taken some great strides in expanding telehealth across mental health treatment, which has been critically important in helping patients get the help that they need during COVID. Ultimately, CMS and Congress should make most of these telehealth provisions permanent. In addition to the bills I've already mentioned, we support many others before you today, including the Behavioral Health Coverage Transparency Act and the Mental Health Parity Compliance Act, the Mental Health Services for Students Act, the Pursuing Equity and Mental Health Act, and HR 6645 to provide additional funds to the National Institute of Mental Health for research related to the mental health effects of COVID. Finally, I commend the leadership on the range of suicide prevention bills before you today, notably by the co-chairs of the Suicide Prevention Task Force, Congressman Katko and Congressman Beyer, as well as Congresswoman Bustos, sorry for that, and members of the committee. I'm grateful for this opportunity to testify today, and I look forward to working with you to advance these important pieces of mental health legislation, and I am happy to address any of the questions that you might have for us today.
Thank you very much, Dr. Evans, for your important testimony. The chair is now pleased to recognize Dr. Geller. You're recognized for 5 minutes for your statement, and please unmute. Welcome to you.
Thank you very much. Chairwoman Eshoo, Ranking Member Burgess, and distinguished members of the Energy and Commerce Health Subcommittee, thank you for allowing me the opportunity to testify before you today. My name is Dr. Jeffrey Geller. I am professor of psychiatry at the University of Massachusetts Medical School and staff psychiatrist at Worcester Recovery Center and Hospital. I testify today as president of the American Psychiatric Association. Throughout the COVID pandemic, I work on-site daily to treat severely mentally ill patients, and I see outpatients through telepsychiatry. I'm also a parent. One of my sons, who has intellectual disabilities, goes to work daily at Brigham and Women's Hospital, where he delivers medical supplies throughout the hospital. I have been much more concerned about his well-being than I have about my own. The COVID-19 crisis is exacerbating anxiety, depression, and other mental health and substance use conditions. It has unmasked clear racial disparities and inequities, and we are pleased to see these are part of today's focus. I'm going to highlight a few areas from my written testimony. First, the COVID crisis has made the value of your actions to facilitate telehealth clear. Access to video and audio-only telehealth has enabled large numbers of patients, including vulnerable urban and rural residents, to receive care while also minimizing their risks of contracting or spreading COVID-19. Telehealth is popular with patients and our members, has reduced no-show rates dramatically, and it has been quite effective. It is essential that current telehealth authorization not end prematurely. The APA has actively been working with psychology and others to ensure continued access to telehealth for our patients beyond the current emergency. We strongly encourage HR 5201, introduced by Representatives Matsui and Johnson, which would permanently exempt mental health services from Medicare's geographic and site of service restrictions. Second, the only bill before the committee APA opposes is HR 884, which would define psychologists as physicians under Medicare. Psychiatrists, psychologists, and other team members like nurses, physician's assistants, social workers, and care managers help patients by each contributing in our own area of expertise. The goal of HR 884 is unclear, since Medicare already recognizes and allows psychologists to provide services they are trained to perform and to practice independently in Medicare in appropriate settings. But psychologists are not physicians. Psychologists do not have medical training. A psychiatrist treats patients with mental illness and comorbid medical illnesses in inpatient and partial hospital settings. The psychiatrist has to recognize medical disorders masquerading as psychiatric disorders. You cannot be equipped to do this without a medical school background. CMS emphasizes that Medicare patients in partial hospitalization programs require comprehensive, structured, multimodal treatment requiring medical supervision and coordination. We know high-quality care is best provided by a team working together to provide coordinated services. But this legislation would do the opposite, further fragment and create unnecessary and dangerous silos. Existing guardrails are there for a reason. Administrative hurdles can be addressed without going to the extreme, like inappropriately defining psychologists as physicians under Medicare. We suggest the subcommittee focus its attention on the oppressive array of proposals before you, on which there is broad agreement and little controversy. Finally, there's mental health parity. Both APAs, my fellow panelist Patrick Kennedy, and a unified mental health and substance use disorder community championed the parity law in 2008, but it has failed to end discriminatory health insurance practices. Numerous investigations by state regulators and the Department of Labor have revealed systematic parity violations again and again. The parity proposal introduced by Representative Kennedy and the bill proposed by Representative Porter and Bilirakis can each help improve reporting of health plans, medical management practices, and thereby enhance compliance. We support both bills, but recommend the reporting language in the Porter-Bilirakis bill because it mirrors the language many states have applied to state-regulated plans. I appreciate the opportunity to testify today on behalf of the American Psychiatric Association. We look forward to working with you to improve the availability, accessibility, and affordability of quality mental health care across our nation. Thank you.
Thank you very much, Dr. Geller. We've learned a lot from your testimony and look forward to asking you questions, and so appreciate the role that you play in today's hearing. I now have the pleasure of recognizing Ms. Ariana Gras. You're recognized for 5 minutes, and please unmute. Welcome to you.
Thank you. Good morning, and thank you to the subcommittee chairwoman, ranking member, and all the members of the Subcommittee on Health for having me here today. My name is Ariana Gross, and I'm a 15-year-old rising junior at Newton High School in Covington, Georgia. I'm in my second year serving as one of the only 10 youth advisory board members on Sandy Hook Promises Students Against Violence Everywhere, also known as SAVE, Promise Clubs. SAVE Promise Clubs were formed in 1989 after the death of a 17-year-old named Alex Orange who died from gun violence. Today, there are over 3,500 clubs across the nation in all 50 states. The Save Promise Club in my community is called Jared's Heart of Success, and they mentor youth and empower us to protect our friends, schools, and communities from all forms of violence, including suicide. We do this by promoting student mental health and wellness, including training students to recognize warning signs of violence and how to seek help. For example, in response to fighting at our school, we created an anti-bullying project where we had students write positive messages about themselves and each other and put them on the walls around the school. It provided an opportunity to reframe students' thinking about themselves and their peers. Because of COVID, our SAVE Club is now holding weekly calls with the primary focus of supporting the mental health of our students. We have opened this up to the community at large because everyone needs help. As a student, I know that mental health and well-being are more important now than ever before. Suicide is the second leading cause of death for students, and for Black boys, the rates are on the rise. However, unlike other tragedies that are accidents, this one is preventable. 70% of students who die by suicide will show a warning sign or tell a friend. COVID is only making this worse. For some students, home isn't the safest place, and with no place to go and no one to go to from our schools, it has become very stressful, lonely, and even dangerous for some students. I have seen firsthand the need for support for student mental health. In our school, a year doesn't go by without a student dying by suicide. I've even known of elementary kids who died by suicide. I'm concerned that youth suicide has become so common that my school community and our nation is stuck in a pattern of mourning and accepting these deaths as something that is normal instead of seeing them as preventable and tragic. As students, we see everything, in class, in the neighborhood, and on social media. We're on social media sites that you probably haven't even heard of. We see way more than our parents, teachers, and other adults, but we aren't given the tools to help our friends struggling with mental health or thinking about suicide. We just need those tools to know how to help in order to save lives. Trust me, we've seen and been through way more than you realize, and we can and want to help. Our Safe Promise Club teaches us how to spot a friend who might be struggling, reach out and help, and talk to a trusted adult. I recently had a friend who was struggling and didn't feel comfortable talking to her parents or a teacher. However, she was only comfortable talking to me. Through my experience with SAVE, I knew how to have the conversation with her and make sure she was supported. The pandemic has shown that mental health challenges go beyond school walls. As part of the Black community in the South, there's a lot of stigma to saying you have mental health issues. Once you do say it, finding and affording that care can be challenging. When I needed to see a therapist, I had to travel 2 hours from my home to talk to someone. This shouldn't be the case, and all youth should be able to get help at school. Unfortunately, where I go to school, the counselors are only there to support someone with academics and are not qualified mental health professionals. Because of that, many students don't have someone they can talk to about how they're feeling or what they're struggling with emotionally. We need counselors for both our minds and our academics. We need your help in creating a system of support in our schools. Allow us to be the eyes and ears of our peers. Give us the tools and trainings we need to know when our friends or ourselves may be struggling so that we can speak up and prevent suicide. And once we do speak up, give us mental health professionals in our schools to go to when we are struggling. I ask the committee to vote in favor of the Bipartisan Stand-Up Act of 2020 and the Mental Health Services Act for students. These bills will help support mental health and wellness by encouraging more schools to adopt policies to train students on suicide prevention and provide more mental health professionals in schools. The effects of COVID on our mental health are happening in our homes now, whether we talk about it or not. You have the power to help, and I ask that you act now to prevent another one of my friends from dying by suicide. Thank you.
Very much. Thank you very much for your excellent testimony. We've completed the testimony of our witnesses, and we'll move to member questions, and I recognize myself for 5 minutes for questions. First, to Patrick. Patrick, you wrote the Mental Health Parity and Addiction Equality Act. You have referenced it, others have. It's not working. That's what you essentially have said. So as we move forward, we have 22 bills. What I'm interested in mostly, as we weave different bills together, what are the major pillars of reform to our entire mental health system in the country? As your cousin Joe said, we have a lot of broken pieces. So what are the major pillars that you would advise us that need to be reformed, including getting your legislation to finally have teeth in it? Is it because it's missing money, or did we miss something in the legislation? So that's been my question to you.
Thank you, Anna. I would say it all revolves around the money. And, you know, as we know, you see what's important based upon what you spend your money on. And clearly, when mental health gets 0.04% of the CARES Act funding, it says a lot about where mental health is in this country. And when you see how many routine violations by insurance companies there are of, I should say, discriminatory practices against people who live in your districts and are family members and friends, just because their illnesses happened or originated in their brain as opposed to another organ in their body. And that's just widely accepted. And unfortunately, as we're learning with Black Lives Matter, so many things that we have come to take for granted are just routinely accepted. And I think we are in denial as a nation about mental health. I mean, we've been at it for a long time, accepting it as a moral failing and not a medical failing. And so that kind of grows on you, gets to make you think that, you know, someone's to blame, as if they get up in a given day and think that, you know, trying to lose their job if they have one, or sacrifice their housing because they jeopardize the rules of their housing, or that they piss off or alienate all their friends or family members, is all part of what someone voluntarily chooses to do in any given day, which of course we know is not the case. So why can't our country get over the fact that these are biologically based disorders and behavior is but a symptom of them? That's what the neuroscientists at NIH tell us. So I would say, if we can understand that as the premise, then why wouldn't the payment models, which, by the way, reimburse for all kinds of health benefits rather than sick benefits for, you know, cardiovascular disease. I mean, I've been on Lipitor for 20 years, right? Apparently, our healthcare system thinks that it's best if I don't die from a stroke or a heart attack in 10 more years. And they've invested that much in me. But when it comes to mental health, they're just missing in action. And yet we allow that as a society. We don't enforce parity laws, both at the state or federal level. There are now some states that are doing a terrific job at stepping towards that. But as far as you're concerned, our Department of Labor, I know, which is regulated by one of your colleagues' committees, needs to step up and pass an enforcement action so that we hold these insurers accountable. But that's what I would say in a long-winded way to your question. Sorry for taking up too much time.
No, I hang on every word that you say. Just very quickly, Dr. Evans and Dr. Geller, I only have a minute left, but would either one of you like to weigh in about major pillars and how you would reform the system?
So I could respond to that. I think that Patrick Kennedy is exactly right. In the entire history of our country, we have always tied together any reform in mental health care with saving money. Dorothea Dix, who traveled around this country and testified before the House and Senate, said two things in every one of her messages. We can save money and we can do what's right. If we're going to actually address this problem, we have to say we need to do what's right, and it's going to cost us some money. If you go in for surgery for cancer, no one asks, how much money is that going to save?
I think my time, thank you very much, Doctor. I think my time has expired. And so I now will recognize Dr. Burgess, the ranking member of our subcommittee, for his 5 minutes to ask questions.
Sure. I thank the chair. Dr. Geller, I want to thank you for raising the concerns you did about HR 884. Seems like too often in this subcommittee we dismiss or ignore or devalue the benefit that a medical curriculum can actually bring to a person's background, and I appreciate you for highlighting that. One of the other things that I mentioned in my opening statement is my concern about And I don't think we have a bill in front of us today that is specifically looking at helping our frontline healthcare providers. We knew that suicide was a problem amongst our colleagues prior to the onset of this coronavirus epidemic, and I know it is more pronounced now. So do you have any recommendations for us on this subcommittee? We're going to be working through these things. We'll have a full committee markup at some point, perhaps the CATCO legislation, perhaps some other legislation where you would see it, where we could modify it to more properly account for and perhaps impact positively our frontline healthcare personnel?
I can tell you that besides prejudice and discrimination in relationship to presenting with a mental illness, a major problem for physicians and nurses and other licensed personnel is the fear that they will lose their license to practice if they report that they've had treatment for a mental illness. When I apply for a license and renewal every 3 years, generally I'm asked a question in almost every state: have I sought psychiatric treatment, and am I mentally impaired, or do I believe I'm mentally impaired? If Congress could address that problem, I think that it would make frontline healthcare workers more willing to seek treatment. The second is we need to do a massive campaign to educate the population about what mental illness is. We are familiar with a very ineffective massive campaign currently in terms of how to protect oneself from COVID, but we've also experienced a very successful campaign to remove the prejudice and discrimination against homosexuals in the time of the AIDS crisis. We dramatically turned that around. In the 1940s and 1950s, we actually did the same thing with breast cancer. Nobody would even say the word cancer. So we know how to do it, and that's what we need to do.
Well, I thank you for those observations. Mr. Kennedy, I wanted to ask you, Representative Ferguson and I have introduced a bill 3539, and I think I see in your written testimony, you talk about schools shall embed social and emotional learning. And as our last witness testified, oftentimes amongst the student population, they can quickly identify for you who perhaps is having trouble. So do you have any thoughts? Have you had an opportunity to look at 3539? Is there any advice you would give us for perfecting that? Oh, Patrick, you need to unmute. I have the trouble all the time.
Sorry. I'm sorry. Thank you, Dr. Burgess, for prioritizing that. You know, it's shocking, literally as shocking as it is that we don't address mental health in our healthcare system, is that we don't address mental health in our education system. Because how are children supposed to learn when their amygdalas are on fire, when they can't have their prefrontal cortex operate because there's no adequate coping mechanism skills developed. There's no problem solving skills developed. There's no social emotional learning skills developed. So I think that you are absolutely on point that this needs to be a priority, and it will be an enormous protective factor for kids, especially since we're seeing suicide rates skyrocket. This will help kids learn how to mediate their impulses, which of course, this is the key factor in helping to do that. So thank you very much for that. I'm happy to follow up with your office.
Our time is always limited here, and boy, it's been a long time since my amygdala was on fire. I do want to ask you, though, because you referenced in your testimony that probably the largest mental health treatment facility in all of our districts is our county jail. And we're looking now at people who are asking for reduction in funding for law enforcement. Do you see a problem developing here?
No, you know, I'm familiar. You should also ask Judge Leithman, who has successfully turned around a major bond for an additional jail in down in Florida, and he took that money and he put it into supportive housing for those with severe mental illness, predominantly schizophrenia diagnoses, bipolar 1. And what he ended up doing is reducing the total docket in his jurisdiction dramatically, such that they didn't have to build a new jail to house all of the people, because a good 30% of them were people who were being arrested for routine and charges, loitering, all kinds of what they call nonviolent offenses that could be better picked up by a mental health system that, frankly, as we are all talking about today, is non-existent. So our criminal justice system has become the default mode for the fact we don't have a mental health system. So all I would say to you is that it's not necessarily the case that less is less. If it can be redirected towards what we know is more, which is reducing the total number of people in our criminal justice system by providing those services which Arthur Evans and others have spent their lives providing, that supportive housing that he talked about in his opening statement. That's the solution we need.
Well, I thank you for that. Redirecting is of course, a part of that process, not just eliminating, but I thank you for your input. I'm going to follow up with you offline because you've raised some interesting points that I want to discuss with you.
Look forward to that,
Madam Chair.
The gentleman's time has expired. I can't help, Patrick, but think of our good friend and his wife, Norm and Judy Ornstein, who have done extraordinary work in this area. And the example that you used from Florida relative to the criminal justice system and bringing justice to those that have the mental health issues and using the dollars in a very, very smart and effective way. Now, Mr. Pallone is voting. Mr. Butterfield is not there. I believe Ms. Matsui is to be recognized now for her 5 minutes of questions.
Thank you very much, Madam Chair, and I really do appreciate your calling this hearing today. It is such an important subject because it's such a subject that has impacted so many of our own lives. Before I get to my questions, I do want to acknowledge that tremendous pressure our community behavioral health centers are facing to meet the demands of this crisis. Given the vital role of these providers, it's completely unacceptable they have been largely excluded from COVID-19 relief funds made available by HHS. I urge the committee today to commit to working on finding a solution that will guarantee adequate aid for those providers to avoid permanent losses to our behavioral health infrastructure. Prior to this pandemic, my ENC colleague, Representative Johnson, and I introduced the Telemental Health Expansion Act, legislation that expands access by removing Medicare site restrictions for telemental health services delivered in urban areas and the patient's home. In Sacramento, our community health centers have been using telehealth to help their patients get regular mental health treatments. WellSpace Health, a local FQHC, has seen overall encounters and patient visits increase by almost 50%. WellSpace is now conducting 80% of behavioral health visits via telehealth. Remarkably, these telehealth visits have a no-show rate of just 10% compared to 40% for face-to-face visits. With that in mind, I want to ask about this new reality of widespread virtual care. Dr. Geller, can you expand on how lifting certain restrictions on mental health services via telehealth has changed patient access during the pandemic?
It has had a remarkable effect. First of all, we have shifted providers. The previously psychiatrists in a poll responded that approximately 65% had not previously used telehealth, and now about 85% are using telehealth for about 3/4 of their patients. Many patients have difficulties getting to appointments, particularly in the period of social distancing. They actually have no way to get to appointments. There's either no public transportation or no public transportation that anybody with intelligence would use because of infection rates.
Sure.
So they can't physically get to an appointment. There are people across the country that are in rural areas that had difficulty before COVID, and now it's close to impossible. Telehealth actually makes psychiatric services available to a huge percentage of the population that didn't previously have available services.
Right.
So the combination of allowing for visual as well as telephone only services is very important, as we have many patients who have no idea how to use any electronic equipment whatsoever.
Exactly.
So the inclusion of that is very important.
Mr. Kennedy, my former colleague, at the outset of the pandemic, CMS made certain that all connected health services will be reimbursed at the same rate as in-person service. Why is payment parity critical to sustaining the use of telehealth?
Well, it's obviously the key driver in terms of the ability to provide the services necessary, because while there is a suspension now and people are using it, that's not going to continue unless the biggest payer of all, CMS, steps up and starts paying for it. And by parity, meaning it is deemed equally effective, especially in addiction medicine.
Exactly.
To in-person. Why we wouldn't pay the same is beyond me. And you guys need to really sit on CMS to do that. And you also, to your point, Congresswoman Matsui, you have to do, like you said, make sure the money you already appropriated for healthcare relief goes to mental health providers. They're the ones who are getting the shortest of the short end of the stick in terms of the money, because it went through Medicare as a mechanism, not through Medicaid as a mechanism for payment. Just as a highlight for your colleagues who don't know why their behavioral health providers are barely hanging on, if at all, right now in their districts.
Well, thank you very much. I really want to thank you, Patrick, for your advocacy. It's been unbelievable. Medicare beneficiaries now more than ever access to telehealth treatment for mental health services, regardless of where they're located. I encourage my colleagues to support access and parity for telemental health as we look ahead to support similar proposals for even a broader set of telehealth services. And I see that my time has already gone, so I yield back. Thank you.
The gentlewoman yields back, and we're all very grateful to you, Congresswoman Matsui, for your special leadership. This is not only a public health issue for Congresswoman Matsui, it's highly personal. As Patrick said in his opening statement, we have family members. We have family members, and so we carry those experiences and those wounds with us, and you certainly have. And that's why your advocacy and your work is so important. The chair would now like to recognize with pleasure the ranking member of the full committee, Mr. Walden, for his 5 minutes of questions. Mr. Walden with us? Then we'll go to Mr. Upton.
Well, thank you, Madam Chair. I really appreciate this hearing. It's really terrific to see my, I'll say, old friend. Patrick and I go back a long way. I was one of the team with Rammer and him. Looked at mental health parity a long time ago, but obviously we still need to step up. We need to do more. And his friendship, his advocacy with other key players, certainly on our committee, really makes a difference. And I think the point that he made early on, where 1 in 4 families directly, but let's face it, every family, mine too, directly impacted by suicide, and things that we know we can do to really make a difference, to begin to turn that around, the startling statistics and everything else. I've got a couple of questions, and I want to follow up with what I guess what Doris was talking a little bit about earlier, and that is the impact of telehealth. You know, we hear so many cases of folks, patients not showing up at doctors' offices. Telehealth is a real key. And of course, we know that there are so many areas around the country that are underserved, that don't have access to broadband. I know that Mr. Clyburn and I have been very active in introducing some legislation. I think you'll see some additional legislation that we're going to introduce literally in the next couple of days. It would require the actually to auction off some of that spectrum. And for states like mine, underserved, Michigan is going to get about $1 billion in the next 10 years, $108 million each year for the next 10 years. And I've got areas in my district without a 4-lane road and without broadband. And, you know, as kids go back to school this fall, their access with e-learning is obviously extremely limited without that access. But as we look at the benefits of what we can do, not only working with CMS, but also working to make sure that patients have access to that. I look at what we might be doing with 21st Century Cures 2.0. Diana DeGette and I have had good conversations on how we might be able to expand telehealth, and also look at CMS to make sure that they, in fact, are reaching for those services. But I might ask both Dr. Geller and Evans, what additional things can we do as it relates to telehealth for mental health services?
Well, Congressman, I would say a couple of things. One is that in addition to supporting the principle of telehealth, and as you noted, it helps with access for a variety of people, not only in rural areas, but in urban areas. When I was a commissioner for mental health, we had immigrant communities in our city that had fairly large immigrant populations that didn't have mental health professionals who spoke their language in the city. And so telehealth was a mechanism that we could use to reach those communities that even in urban areas can be a challenge in serving. There are a couple of things. One of them is to understand that for many people who don't have broadband, having telephonic access for telehealth is extremely important. We fought very hard for that provision with CMS, and fortunately we were able to get that. But it's not just having video conferencing ability, which many communities don't have, but it's also being able to do telephonic care as well, which is very important. So I think making a long-term commitment to this is going to be very important for continued access.
Yeah, I might just add this. You know, a 2019 NIH-funded study found that patients who were admitted emergency departments due to deliberate self-harm had a high suicide rate in the year following their discharge. How important is it to screen for suicide risk in emergency departments and follow-up care?
It's extremely important. One of the things we know is that for people who die by suicide, most of them, the majority, have visited a healthcare practitioner within the last year. And there is a high percentage of people who die by suicide who've had an emergency department visit within a relatively short time in relation to their suicide. So doing universal screenings in emergency departments is very important, having surveillance mechanisms. But I can tell you, as someone who's overseen mental health systems, one of the most important aspects of this is to have connections between emergency departments and the local mental health system. Too often people are evaluated. If they're not meeting criteria for involuntary commitment, they're discharged without a good connection. And that's where you see a lot of the problems with people who die by suicide who've had recent visits to emergency departments.
Thank you. My time has expired. Clock goes way too fast.
It really does. We all have, I have 27 questions I want to ask, but I can't. With the gentleman yields back and thank him for his questions. The chair would now like to recognize the gentleman from North Carolina. And a gentleman, he is Mr. Butterfield. And Mr. Butterfield, I want to ask you to, I have to vacate the chair to go over to vote. So I ask you to fill the chair and be recognized for your 5 minutes of questions. And thank you.
Thank you to the chair. I just left the floor a few moments ago, and they are indeed waiting for you. And so thank you for allowing me to sit in your chair for just a few minutes. The chair will now recognize himself for 5 minutes. Let me just start with our dear friend, Patrick Kennedy. Patrick, all the members on both sides of the aisle have said such nice things about you, and I just want you to know that they are all deserving We appreciate you. We miss your service here in the Congress, but thank you for the incredible work you're doing all across the country. Patrick, while we have made progress in normalizing conversations and reducing stigma about mental illness, it is clear, it is so clear, and you made that abundantly clear in your opening statement. We have such a long way to go. You note in your testimony that the promise of the Mental Health Parity and Addiction Equity Act has not been realized, and that many Americans are encountering barriers when seeking professional help. I'm sure that many individuals give up. They just absolutely give up after receiving denials or only limited benefits. Barriers to care can close a window of opportunity for the individual to get the help that they need, resulting in harm, serious harm to the individual. And as you point out in your testimony, societal and economic losses to our communities. Our country, as we all know, is experiencing crises on so many different fronts, from COVID to the epidemic of police violence against African Americans. Now more than ever, the process to seek help should not be a barrier to receiving help. Question, what should we do? What should we do to enforce behavioral health standards and regulations to ensure that beneficiaries are not encountering needless roadblocks to receiving the care that they need when they need it?
Thank you so much, GK. Obviously, you've got before your committee a couple of different bills, both of which are very, very important to help bring greater transparency to really what insurance companies deliberately obfuscate, which is basically they hide behind this seeming confusion as to how they determine someone's medical necessity. Well, we have in the federal law very clear guidelines that are now being adopted by all of your respective states to bring absolute clarity based upon the administrative rule to enforce the Federal Parity Act. And so I would basically encourage you to pass those parity bills that you have before you, because as you said, GK, what it's really about is insurance companies know that it's going to take forever for you to appeal their denial.
Sure.
They're counting on it as a cost of doing business. So many people just who are in a mental health crisis, families in a mental health crisis, they have nowhere near the wherewithal to challenge a major payer, a major insurance company, so they give up.
Sure.
That's what the insurance industry counts on. And as a result, the insurance industry reduces its total liability to provide care because they basically deny care. And yet, if you looked as a comparable between the percentage of care they denied that's mental health and addiction related versus the amount of care that they deny that's medical and surgical related, you would see a huge disparity. And what your bills before your committee do is they will require that to be opened up for the light of day so that there's transparency. And I think if there's transparency, insurance industry will be loath to put together any plan that when evaluated will clearly illustrate that they're discriminating. Because as you know, GK, through your long work on behalf of civil rights, you know, the more you bring transparency and open it up, the less people have the opportunity to discriminate, because ultimately people don't want to be caught discriminating, or they shouldn't want to be caught discriminating, I should say. So thank you for that question. Thanks for your service and your friendship.
Well, thank you. Thank you as well. I have one other question for Dr. Evans, but looks like the gentleman is running out of time. And so I'm going to yield back the balance of my time and recognize the next Republican. I'm being told who that is right now. Looks like it's our friend John Shipkins. Mr. Shipkins, you're recognized, sir, for 5 minutes.
Yeah, thank you, Congressman Butterfield and Patrick. It's great to see you. I was interested in the exchange between Fred Upton and Dr. Evans, and that was kind of on my line. There's 102 counties in Illinois. I represent 33 of them. And so what COVID has caused to happen, which is, I mean, kind of a side benefit is it really has forced us to ease some of the regulatory burdens on the telehealth stuff. And so I know, Dr. Geller, in your testimony, you talk about telepsychiatry, and then we go into this. I think a lot of our concern is if something's working when this COVID crisis fails. I mean, when it ends, we don't want some of these reforms that were kind of created for emergency purposes. We'd like to see them continue because I just think that's helpful. Everybody understands there's unserved, underserved areas. Money's going in, whether it's for us, it's USDA rural development, the FCC, even some individual states are now starting to put more money to broadband deployment and laying fiber. So first of all, let me go to Dr. Geller. I think I've heard requests from 22-month extension and or more. And I guess what will be asked is to why, not just because my perception that there's a huge benefit, but do we need time to extend this program now to gather data, and how long should that be, and what kind of data are we looking at? Dr. Geller.
Yes, so yes, we do. An extension should allow for study, and we can look at various outcomes in terms of access. And we can also look at something I mentioned before, but it's unfortunately of incredible importance, and that is cost. Because while it's going to cost more upfront if people have more services available and they actually access more services, there's a high likelihood that there's going to be significant downstream savings, not having people go to emergency rooms, not having people need inpatient admissions. So we need to look at clinical variables and economic variables to see how this is working. We also need to include the capacity for physicians to work with each other through telehealth so that we have a coordinated care across the board, and that should address lots of the problems in rural counties like you're talking about.
Yeah, what would you think would be a time frame that we would need to gather this data?
Well, that's an excellent question because we expect that even after the infectious aspect of this pandemic is over, that we're going to have a mental health pandemic that could go on for quite some time. And we don't really know how long that's going to be. The APA doesn't have any official position on how long that should be. If you were asking me, I don't think we could know the answer in less than 5 years.
Yeah, I think that's important for us to hear because again, this has been such a great opportunity to exercise and show the benefit of telehealth in your world, and also just in the medical practice field for underserved, unserved communities in rural areas. Dr. Evans, you want to add anything to this debate on period of time and our push to keep this when they ease the regulatory burdens? We want to make sure that we don't re-place them once there is someone thinks this thing's over.
Sure. I think that it's important to keep it and to recognize that telehealth is only a means to an end. It is a mechanism to provide services that we know work for people. And as Dr. Geller referenced in his point, one of the things we know is that there are significant cost offsets on the physical health side when people have access to mental health care. So I would expect that not only will people be able to address their mental health challenges, but we're going to see savings on the physical health care side. I think this is really critical. Our organization has been working on getting access to members of the rural communities. We have relationships with Farm Aid and the Farm Bureau, and we're currently working with SAMHSA on a program to train individuals to work with people in rural communities. And one of the things that is really clear, we can do our part as an association to train people and to encourage people, but we need to have the infrastructure available so that people can get those services delivered. So I appreciate your question.
Yeah, my time's expired. Thank you, GK, and I'll yield back.
Thank you. Thank you, Mr. Shimkus. The chair now recognizes the chairman of the full committee, Mr. Pallone, for 5 minutes. Please remember to unmute, Frank.
Thank you, GK. Patrick, I wanted to go back. I know everyone keeps asking you about the promise of the federal parity law, which you sponsored, and what more needs to be done. And you certainly talked a lot about it, but I want to kind of drill down again. We have these two important bills introduced by your cousin, Representative Joe Kennedy and Representative Porter, that would strengthen the enforcement of mental health parity laws and increase transparency regarding how the health insurance plans are complying with the laws. So I wanted to ask you about both of those things. Looking back at the implementation of the federal parity law over the past decade, can you discuss the challenges associated with the enforcement and oversight, basically transparency? I know you don't think it's been fully realized, but what remains to be done to achieve parity, looking at the enforcement and the transparency, if you would, in a little more detail.
Well, for one thing, having one inspector for over 1,500 plants obviously lets the whole process go to pieces, because how are we going to have any accountability if there's no oversight? Two, what we need to do is really strengthen the requirements that there's kind of a forensic audit of the way insurers make these medical necessity determinations. And they need to now, under the bills that are proposed before the committee, really demonstrate how that all works. And that's a process of evaluating what's known as these non-quantitative treatment limits, a medical necessity criteria, all of which are very crucial to people's ability to get the care that they need in a timely manner. And I know that Dr. Evans, as well as Dr. Geller, their professions know full well how they get micromanaged well beyond what they'd ever would expect if they were any other area of healthcare delivery.
And I mean, from an enforcement perspective, obviously, you just need more staff. That's what you're.
There isn't a call by the whole community for $20 million would dramatically improve Department of Labor's. I mean, we have nearly 80% of all people in our country are covered under ERISA plans, so that their oversight is by, obviously, Department of Labor. Most people don't know that, but so I would encourage all of you in your jobs as federal members, this is in exactly your purview. You need to have your Department of Labor step up its game. It's absolutely unbelievable in the time where we're losing more people to suicide and overdose and alcoholic death than we are COVID. More than COVID. And what do we spend? We can't even get $20 million to even, and by the way, for my Republican friends, that enforcing parity means making sure that insurance companies don't give the Heisman to mental health and addiction, such that our taxpayers have to pay the difference here, because that's ultimately what happens is, because payers never really fully adhere to this federal parity law, what they end up doing is pushing the cases down, out the door, while they don't assume any accountability. And then who pays? The taxpayer pays through our corrections system, through our policing system, through our firefighters and all of their disproportionate time gobbled up by trying to pick up people who are homeless, who are on the streets, all because early on, payers tried to save money and they pushed it onto the taxpayers. And really, in essence, this is corporate welfare of the first order. We are allowing the richest companies in our country, the healthcare insurance companies, who, by the way, are sitting on a boatload of cash because they've never had to pay any bills for the last 5 months. And they're denying mental health still. And you can't even make this up. And who's paying for this? the hard-strapped taxpayer is paying for it in innumerable ways, including through Medicaid and also through their local property tax base. So if I were both a liberal or a conservative, parity would be a big issue for me.
Thank you, Patrick, and thanks for all your work over the years.
Thank you.
GK.
Thank you.
Or Anna, I see Anna's back as well.
Anna is back.
I went as fast as I could. And I want to thank Mr. Butterfield for stepping into the chair. I believe that Mr. Walden is the next to question. Is he there? Gone. Not so. We'll return to him. It's a pleasure to recognize the gentleman from Virginia, Mr. Griffith, for your 5 minutes of questions.
Thank you, Madam Chair. Can you hear me?
Yes.
All right, I appreciate it. I have submitted for the record a letter from Jennifer Feist. Many of you likely heard about Jennifer's sister, Dr. Lorna Breen, head of the emergency department at Columbia Presbyterian's Allen Hospital in New York City. Dr. Breen endured weeks of extreme stress as she worked around the clock to help COVID-19 patients and also battled the virus herself. Eventually, the responsibility for human life, lack of sleep, and unknowns of this virus became so burdensome that Dr. Breen became physically unable to continue and sought help for a weakened mental state. She told her family that as a result, she believed her license to practice medicine was at risk and her career could be over. Approximately 2 weeks later, she took her own life. The bills before us today address many important issues, but none would have alleviated Dr. Breen's concerns. We must consider the mental health of the providers on the front lines of a pandemic. I dare say very few individuals could have endured the struggles Dr. Breen faced without help. Now, I know somebody talked about it earlier, but I was on my way over to vote. I was listening, even though I was going over to vote. But for Dr. Evans and or Dr. Geller, do you believe doctors should be able to seek help from mental health professionals without fear of losing licensure?
So I spoke about that earlier, and I'm quite familiar with the Dr. Breen case. And the answer to that question is absolutely. One of the questions is, should states even be able to ask the question on your license application? And most states, in fact, ask the question. We have got to start a major campaign to address prejudice and discrimination. You know, we use the word stigma, but I think it's actually an unfortunate word. If we use the word prejudice and discrimination, we would understand that it's the same prejudice and discrimination against minorities. It is prejudice and discrimination to think that if a person has a mental illness, they're not capable of functioning. You have a panel member right here, Patrick Kennedy, who addresses that throughout his life. And he is actually one of millions of examples. We have clubhouses that help people go back to work. We have all sorts of interventions. And I mentioned in my introductory remarks, I have a son with pretty significant intellectual disabilities who keeps people alive every day in his job by delivering medical supplies that are necessary to the functioning of that hospital. So yes, emphatically, we need help from Congress to remove prejudice and discrimination and treat it just like all other forms of prejudice and discrimination.
As ours.
Congressman, if I could add something?
Absolutely, yes, sir.
Your point is a really good one. And one of the big challenges of the way we deal with mental health in this country, and Patrick references, it is almost entirely reactive. And we wait for people to have a diagnosis before we intervene. One of the things that we have to start doing is start working upstream, start providing services to people before they need, before they're in crisis, before they have a diagnosis. One of the things that the American Psychological Association is doing is developing information, and in fact, for healthcare workers is one of the groups that's based on psychological science that tells people how they can help to manage and mitigate their stress, and to do self-care that will reduce the likelihood that their psychological distress is going to lead to the
One more quick question before I run out of time. I represent a large rural district where access to every kind of care is often limited, and as much as we might like to have psychiatrists everywhere, we just don't have them. Do you believe HR 945 would help rural communities?
Absolutely. Absolutely. I can tell you that I spent a good amount of time last year in a southern state, and the major reason that people miss their follow-up appointments is they don't have money to put gas in the car. And the other is one of the reasons that we have affected attendance at follow-up visits is that it's the doctor who initiates the contact. So I can tell you my own experience. I've had lots of telepsychiatry contacts where the person said, "Oh, I forgot about my appointment." Well, lo and behold, we had the appointment anyway because I contacted them. So yes, it can make a huge difference in rural areas.
Well, the telemedicine certainly can, but I'm also talking about expanding the ability of a number of people to be able to provide some help who aren't currently licensed to do so.
I think that that's important. One of the things that's happening in global mental health is the notion of task shifting. Not all of the functions that mental health professionals do necessarily need to be done by a highly trained mental health professional, and many of those things can be other people can be trained to do. In addition to that, peer support is extremely important, and both in terms of engaging people who would otherwise not be engaged, keeping people retained in treatment, and otherwise supporting people in long-term recovery. So it absolutely is something that's important, another important element to a well-rounded mental health system.
Thank you very much. I yield back.
The gentleman yields back. It's a pleasure to recognize our colleague from Maryland, Mr. Sarbanes, for his 5 minutes of questions.
Thank you very much, Madam Chair. Can you hear me okay?
Yes, very well. Thank you.
Thanks for this hearing. To Patrick, it's great to see you, and to all of the other panelists. Thanks for your testimony today. The New York Times recently ran a piece written by an emergency physician in Arizona titled, "I am a healthcare worker. You need to know how close I am to breaking." Arizona is among the states experiencing some spikes in the COVID-19 cases right now. This physician makes clear the impacts of responding and treating high numbers of COVID patients are obviously more than physical. This was true in New York City, other hard-hit medical communities that lacked the adequate personal protective equipment and testing and respirators and so forth. So we know the stress of this is like nothing we've seen before. It's taking a huge toll on our healthcare workforce. There are bills under consideration. Katie Porter, our colleague, has a bill that would provide support to states and communities for frontline healthcare workers, for workforce training. Paul Tonko has a bill to study the impact of COVID-19 on the mental health of Americans, including healthcare workers. And I think both of these have been included in a modified fashion in the HEROES Act. I want to speak a little bit, it's been touched on, I think, in response to some questions from Congressman Burgess, but maybe Dr. Geller and Dr. Evans, you could share your perspective on the best way to deploy the support, the mental health support and counseling for healthcare workers, because obviously one avenue for this is through the institutions, the hospitals, the community health clinics where they work. But is there also a role to play for sort of a separate resource to be brought to bear that comes from outside the four walls of a hospital, for example? So if you could speak to, if you could design the best program through, employee assistance program and other measures to help those healthcare workers that are on the front line, what would that look like? And I'll start with Dr. Geller and then Dr. Evans, if you have any thoughts as well.
Three components. The first is that you have to have these services on site and immediately available. Those of us in healthcare are terrible at saying no. We're not going to leave at the end of their shift because it's the end of their shift when they have people that are dying. So you have to have services immediately available. Second is the advantages, again, of telehealth. you are much more likely to have a healthcare worker who has gotten home and can call in to somebody than somebody after working 16 hours and asking them to go to somebody's office. And the third, which Dr. Evans alluded to previously, is proactive wellness programs that are available right on site. So if I'm in the emergency room, I can take a half an hour and go to a yoga class.
Right, Dr. Evans.
Sure. What I would add to that is peer support is extremely important. As Dr. Geller mentioned earlier in his testimony, that often people in the medical and nursing professions don't want to reach out for help. And so what we found in working with over 65 nursing associations, how important it was to have peer support groups on floors that people can have access to immediately. In addition to that, the kind of self-care information that we've provided for healthcare workers is really important, because what we do is we talk about, here's an exercise that you can do when you're extremely stressed, and then we give people the science behind why that works and why that's an effective strategy. So I think it really is a combination of making sure that people have access to care, that there is peer support, that there are options to help people understand things that they can do themselves, and ultimately ensuring that people can have access to care when they need it.
Thanks very much. And
There are examples of this already in place. As you know, for oncologists, particularly pediatric oncologists and others, they have these support systems. Mayo Clinic, where I went to drug rehab, that I learned all about this because they incorporated, frankly, a lot of the same recovery they had for people with addiction were for people with doctors who were experiencing enormous stress in their jobs and needed ways to learn how to manage their own stress and feelings.
Thanks very much, Patrick. And as I close, thank you for your leadership and advocacy in this area. Two things that I'm coming away with from this call that you've emphasized. We've got to address the stigma, and we've got to put the resources behind these efforts. Thank you, Madam Chair. I yield back.
We thank the gentleman for his excellent questions, and he yields back. Has Mr. Walden come back? I can recognize him. If not, then the chair will recognize Mr. Bilirakis for his 5 minutes of questions. Is he on board? Not now. Then the chair will recognize Mr. Long for his 5 minutes of questions.
Thank you, Madam Chairwoman.
Yes, nice to see you.
I am here. Dr. Geller, could you describe to me the benefits you've seen from patients receiving care for mental health services via telehealth during COVID-19? And in your opinion, have the flexibilities provided by Congress and the Trump administration facilitated access to needed mental health and substance use disorder services during this pandemic?
The greater flexibility and access to telehealth, I think, has made a tremendous difference. The inclusion of the ability to have telephone appointments has made a tremendous difference. People have referred several times to people who actually don't have broadband access, but the population is much greater. I have a gentleman who hasn't bought a new electronic piece of equipment since the Johnson administration. His favorite activity is to sit at home listening to his records on his record player. He and I, before COVID, met every month for 25 years. He only talks to his brother and to me, the only two people he talks to in his adult lifetime. And he and I have a telephone contact every week, every month. And if we didn't have that ability, he would be without services and probably be hospitalized. So it has made huge differences. And also, as I indicated previously, particularly for people who have trouble keeping track of appointments or have some disorganization, I initiate the contact, often by phone, so that I can actually track them down and they actually have an appointment. I think it's making a world of difference, and Congress should be taking movements to extend this far beyond the infectious pandemic.
Okay, I'll stay with you, Dr. Geller. Borough Mental Health in Springfield, Missouri, I toured it, about year and a half ago. I've also toured it more recently during the pandemic, but I know that they take advantage of the mental health, telehealth thing a lot, and it's very, very vital, very, very important. They also were just issued a large grant, which we were happy to see, but I know how important telehealth is, and I appreciate your comments. The U.S. is facing a serious shortfall of mental health, behavioral health professionals, as you know, and what will it take to attract more students into this field?
There are several things. One is we need a program, a much expanded program on loan forgiveness. People can get out of the end of their training with $500,000 in debt. That's going to direct them to high-paying specialties, not to low-paying specialties. So we need people in primary care. We need people in psychiatry. Those are low-paying, and pediatrics, low-paying specialties. So loan forgiveness would make a big difference. Increase in GME slots, that is Medicare-funded residency slots, directing those slots to underserved areas. Third is minority fellowships, and those should all be directed to specialties that are underrepresented, like psychiatry. Those are all efforts that are within the purview of some of the bills that you face that will make a big difference to the workforce.
Okay, thank you. And I'm going to go to Ms. Gross next, if I can. Thank you for being here, Ms. Gross, and speaking to us about what you're doing in your community to promote student health and wellness. You say that students, you see that as students, you see way more parents, teachers, and other adults, but you aren't given the tools to help your friends struggling with mental health. Can you talk about your experiences in the Save Promise Club and what tools would be beneficial for you to help a friend struggling with mental health and for creating a system of supports for students in your school?
Yes, thank you for that question. So one thing that Save has taught me is definitely being able, first you have to learn how to communicate with people. That's one thing that we focus on, is reaching out and getting into community. And so one thing that my club does is we go out and we talk to different schools and we build communities where people feel comfortable expressing themselves with each other, where somebody feels safe enough to speak about those kinds of things. We have trusted adult training, so we train people to bring their communities together by being there for students, because students, we go through a lot, and I think that, at least in my perspective, that's why we need our peers as well as mental health professionals to be able to help us within our schools, because we don't have a lot of that around us. And so Save has allowed me to learn how to do that so that I can help my peers, that I know how to explain how I can help them, because that's one reason why I'm here today. I'm here today to get this message out and let people know that there is help beyond just being in a state where you don't feel comfortable. So just offering that. They taught me how to communicate and how to build community so that people feel comfortable.
Very good. Well, thank you again very much for being here today, and thank you for all our witnesses here today for participating. And Madam Chairwoman, I yield back. Thank you.
The gentleman yields back, and I thank him especially for the question that he asked of the witness, because the student population is just so important, and we really need to address that and make sure that they get exactly what they need. The chair would like to recognize the gentleman from Oregon, Mr. Schrader. Is he available? Not seeing or hearing him. The chair recognizes Mr. Kennedy. Mr. Kennedy available? Not in his chair. Then the chair will recognize the gentlewoman from New Hampshire, Ms. Custer, for her 5 minutes of questions. You need to unmute.
Thank you. Thank you very much. Thank you, Madam Chair. I appreciate this hearing, and I appreciate the opportunity to address you on this important issue. Here in New Hampshire, we've had a dramatic increase of depression, anxiety, trauma, and grief as a result of COVID. And we are struggling as well with changes to the economic impact on our healthcare providers, particularly mental health providers. 83% of small and large group substance use disorder providers have experienced what they would describe as a significant financial hardship as a result of COVID. And 48% of those providers surveyed have had to cancel income generating events, while 74% have incurred unanticipated expenses, including PPE. Across the board, we've seen an experience of lost billing revenue of $23,000 per organization in just the first 3 months. So I wanted to focus my questions on some of the conversations that we've been having today, including the impact on substance use disorder. The opioid epidemic has taken a big toll here in New Hampshire. We have a dramatic increase in deaths from opioid overdose, as well as focusing in on trauma. We had some conversation, I think it was Mr. Burgess, talking about mental health and substance use disorder treatment in prisons and jails. And I wanted to direct my questions to Dr. Geller. You had mentioned this in your written testimony. I have legislation, the Humane Correctional Healthcare Act, which would repeal the Medicaid inmate exclusion and allow healthcare to follow an individual through the justice system so that they could access mental health and substance use disorder treatment while incarcerated. Could you comment on that, Dr. Geller, and how that could make a difference in terms of the outcomes? And I think there was also comment about how people are being incarcerated for their mental health challenges. I think Representative Kennedy talked about that.
So I think that your state motto, live free or die, now has another meaning. It means that I'm going to live free of services and I'm going to die. So it is extremely important. I'm personally delighted by that notion about removing the Medicaid exemption. I have thought for a very long time that we will never solve this problem if people can't get the funded services because they happen to get incarcerated, when many times they get incarcerated because they had a psychiatric problem. So I think that that can make a huge difference. In terms of, you also mentioned small providers, and that is something that Congress needs to attend to because they are really the bedrock. The public sector substance abuse programs, community mental health centers are really taking care of the disenfranchised population, and they're having tremendous problems currently because they are not beneficiaries of most of the COVID funding that's been coming from the federal government.
I wanted to also ask, I recently was visiting with our oh, excuse me, my time is getting short. I also was visiting with our state prison recently, and I was told that 100% of the women in the state prison are survivors of trauma, sexual assault, domestic violence, abuse and neglect as children. I'm very concerned during COVID. I chair a task force to end sexual violence. It's a bipartisan task force. We recently had a roundtable about the increased incidence of sexual assault, and during the stay-at-home order, children that are at home with their perpetrator, predator. Do you have any concerns, or how could we go about this as we reopen? And again, my time is short.
Well, just really quickly, one of the problems we have is circular. I've had patients who, when they get released from jail and they fall into that serious trauma category, commit crimes to go back to jail because it's the only place they have where they can feel any safety or comfort. That's a huge problem in our society. The new problem with domestic abuse is a significant problem. We have people staying at home together. People are afraid to report. People are afraid to leave home to report. We have to be cognizant of that phenomenon and specifically address it. It has not been talked about a great deal.
Well, I thank you, Madam Chair. I yield back, but I very much appreciate this hearing, and I think these are critically important issues for us to address, especially now during COVID. Thank you. I yield back.
The gentlewoman yields back, and we thank her for her excellent questions. I see the ranking member of the full committee has returned, just took his mask off. The chair recognizes my good friend from Oregon, Mr. Walden, for his 5 minutes of questions.
Well, thank you, Madam Chair. I appreciate it. And I appreciate this hearing and the courage of our witnesses and the work they do in the communities or in their schools. Thank you for what you do. And it's good to see our former colleague here on the screen as well. And sure appreciate your continued speaking out on these so important issues. We're getting there, but not fast enough. And there's more to be done. And that's part of the question I want to direct to you, Patrick. What is it when you look at these bills, and there are obviously some we're all in agreement on, some we're going to work some things out on and all, but what are the gaps? What are we missing here, especially as it relates to data that could better inform us in terms of what else we need to do? I know money's always an issue. Mental health resources always an issue. We've tried to increase funding into our communities like we did through the opioid legislation, but as you look at these and you know the realities of Washington, what are we missing?
Thank you. I would say that if I had a magic wand, I'd fully fund the nurse-family partnership in this country, which would ensure that every at-risk mom would be able to get the wraparound services. The payoff of that, Greg, is so well established, but the problem in our health insurance system, as in our society, is that we don't often measure the long-term payoff. If it's not a quarterly payoff or an annual payoff, we really don't see the real value of investing in mental health early. To the previous question about trauma, and really doing the kind of systemic things in society that could mitigate the impact of trauma. So in terms of, obviously the parity laws that you've tried to enhance, I could answer more to there, but let me go to you. Yeah, I don't know what particularly it could be helpful with in addition to that. I mean, I would do first instance of schizophrenia. If I had a magic wand, I'd do not only nurse-family partnership, I'd say that every first instance of schizophrenia in this country, we provide coordinated rapid response. If you did that, you would permanently change the trajectory of long-term comorbidities and illnesses due to mental illness in a dramatic way. And I see this every day. And for the life of me, I don't know why as a nation we do not make that a done deal on a bipartisan basis. You would automatically reduce the number of people in jail, in prison in our country overnight. I don't know why our general accounting office, if I were you, Chairman, I would find a way to have GAO or OMB come up with some kind of accounting, because you all know you don't spend anything that you can't find offsets for. And that's part of the big problem here. We all know this stuff works, but you have to find a way of justifying to spend money on those things, because invariably it'll come out of other programs that you think are equally worthwhile, but frankly may not have the pounds per square inch of a solution that these do.
Yeah, it's really good counsel. I did a town meeting several years ago in one part of my district. I remember we were doing some of the opioids issues and some of the mental health issues. And I remember one of the law enforcement people kind of made that case. He said, look, we get somebody in, we pick them up because they're off their meds. We get them into, in this case, a county jail setting. We get them back on their meds. They're stable. And we know once they're released, we're going to pick them up again. And this seems to be a huge gap still in the country, trying to get that help to people. We're part of a pilot, and it may be going on in New Hampshire as well, where we have mental health people that intercede before the arrest occurs. They're there 24/7 on site, and they've been able to do diversions and keep people out of jail, get them the help that really they need. And I think that's a focus that seems to work. Ms. Gross, thank you for speaking up. Thank you for the leadership that you've provided. When it comes to kids, what are we, quote unquote, old people missing here? What can we do more? I mean, we know we're missing a lot, so I'll just stipulate that. But From your perspective.
I think a lot of what we need is just people to listen. I think a lot of times what we think and feel are downplayed because, you know, they're just kids. They don't know what they're feeling. But I think that's why, at least in my perspective, coming around and allowing our peers to be able to be there for us through the Stand Up Act, or having mental health professionals who, like, you know exactly what we're going through and, you know that kids can go through these kinds of things is really important. And getting to have that voice and be listened to because, you know, we all said, we have concerns and we go through a lot. And so just being able to have people who listen and care is really important.
I appreciate that. And thanks for your work. Madam Chair, thanks again for this hearing, and I yield back.
The gentleman yields back and thanks him for his excellent questions. It's a pleasure to recognize the gentleman from Massachusetts, Mr. Joseph Kennedy, for 5 minutes.
Oh, excuse me, Madam Chair, thank you. Thank you for calling this incredibly important hearing. Patrick, we'll start with you, my friend. So you mentioned in your opening statement in the written part, but I want to have you have the opportunity to remind us how long ago that you were able to get the Mental Health Parity and Addiction Treatment Act enacted.
10 years, over 10 years.
Yeah, of 11 and change, I think. Time flies.
That's why you're in Congress, I'm not.
4 months later, time flies. There you go. So almost 12 years later, though, there are still insurers that are not compliant with the federal law, right?
Exactly.
And so to highlight that, excuse me, the Department of Labor conducted 187 investigations in fiscal year 2017 and found that 92, almost 50% of those surveyed were not compliant. In December, GAO came out with a report saying that the Department of Labor and Health and Human Services commonly found violations of parity requirements and recommended evaluating whether or not targeted auditing is an effective method for mental behavioral health care parity. So you're familiar with those reports? Yes. So one of the things that the Mental Health Parity and Addiction Treatment Act, along with subsequent parity laws, did was ensure that plans provide information on how they're making mental behavioral health parity decisions. Meaning that for almost 12 years, all plans should be doing this and have that information already readily available. For this one, I want to turn to Dr. Geller. Doctor, because insurers should be collecting and reporting this information already, should it be difficult for them to make that information available immediately?
It should not. They should be required to do so.
So knowing that you're not an insurer, but are a provider, would it surprise you if an insurance company were to make alterations and to give a false impression that of compliance with those parity laws?
I'm sorry to say it would not surprise me.
Yeah. And so, doctor, if a health plan is not compliant in providing parity coverage for mental behavioral health services, do you think that should be public knowledge?
Absolutely.
Do you think that it should be proactively publicized in some capacity to protect current and future enrollees?
Absolutely, because the enrollees have no capacity to do this on their own.
Do you know how many health plans are in the Department of Labor alone, Dr. Geller?
Sorry, I do not.
2.2 million, roughly. So 2.2 million different plans covered by DWEL alone. So I believe that because of the wide number of plans and the fact that these plans have not yet come close to earning our trust or their patients' trust, we not only need to have random, robust, and immediate audits, but also public disclosures of parity compliance to hold them responsible for parity violations. And the point on this is to force, as Patrick has articulated before this committee before, to actually have teeth behind those requirements to allow for that investment to be made up front. As he was just talking about the partnership with nurses, one of the challenges we have is we don't actually have those incentives put in place to require or incentivize that investment upfront to provide access to patients and care for patients, which is why the largest providers of mental behavioral health in this country are the jails in LA and Chicago. You talk to the sheriffs in my home state in Massachusetts, 98% of people that have access to healthcare, well, I should say 98% of people that have healthcare coverage. You talk to the sheriffs, those are the folks that in Massachusetts run our jails, they will tell you that between 80 and 90% of the incarcerated individuals on any given night are suffering from substance use disorder, mental illness, or both. In a state with 98% coverage, we are so failing people with mental and behavioral illness. And so I just want to come back to the fact that, Patrick's obviously worked on this for a long time, and many of us have on this committee, but Behavioral Health Coverage Transparency Acts that would improve enforcement authority, increase transparency of parity disclosures, and have it made available to the public. And that public piece, I think, is so critical because, as you said, Doctor, there's no way that patients would possibly be able to get access to this, particularly if plans aren't making that information available. And so how do we possibly hold people accountable if there's no remedy for it?
Joe, I think you're, if I can say so, right on. And I think if Congress responds by actually saying you're not allowed to sell your health insurance product anywhere else in our market if you don't adhere to our laws. I mean, imagine a health insurer coming in saying, oh, I want to sell into your market. It's a very lucrative thing for an insurer to be able to sell their insurance product in a given state. Why doesn't the state put up a big barrier and say, you're not allowed to sell in our state if you discriminate against the most important set of illnesses affecting our people? What your bill is calling for is the ability for that to be transparent, to get out so that state legislatures can start to enact similar laws like that to help provide some accountability. And to your point on the numbers, it's hard to believe, but in your colleagues' committee overseeing DOL appropriations, that it's only one inspector. I should correct myself from earlier, 2,500 plans. That one inspector has to oversee 2,500 plans for one inspector. So you need to pass your bill. You need to have greater money to support enforcement overall. And you need to give these states more authority to invoke their own accountability measures by making this more public, like your legislation calls for.
Thank you, Cousin. Grateful, Madam Chair. Thank you for your flexibility. Dr. Evans, good to see you again. Ms. Gross, thank you for joining us. I yield back.
The gentleman yields back, and we look forward to your legislation becoming law, Mr. Kennedy. And thank you, Patrick, for your for all of your responses. We're just learning so much from you about what we actually need to do. The chair would now like to recognize the gentleman from Florida, Mr. Bilirakis, for his 5 minutes of questions.
Thank you, Madam Chair. I appreciate it very much. Again, let's see, I'm especially appreciative of the committee's consideration of a few of my priorities. HR 4861, HR 7293, HR 3165. I also want to flag a bill I introduced with Congressman Soto, HR 5473, the Enhanced Access to Support Essential Behavioral Health Services Act, which builds upon the Support for Patients and Communities Act to allow Medicare and Medicaid to reimburse for behavioral health services delivered through telehealth. I hope we can consider this great bill in the future, Madam Chair. And I also want to say hello to my former colleague, Patrick Kennedy, who always did a great job on these issues. Thanks for being here, Patrick, and giving us all your great advice. Dr. Geller, this question is for you. Our nation is in the midst of hospital emergency departments and improving their ability to identify and treat those who may be suicidal. What is the potential impact of COVID-19 on the risk for suicides, and what role can hospitals, especially emergency departments, play in identifying and treating individuals who are at risk for suicide? Dr. Geller, please. Thank you.
The effect of COVID on suicide is substantial and actually multifactorial. One is the response to an individual in the stress of the potential for infection. Another is grief, loss, and significant depression from people who are losing family members to COVID-19. And the third, which is probably the newest information, is that we are seeing in some recent data from the United Kingdom that there's a direct neurocognitive effect on some patients from the COVID. That is, it affects their brain. There's an increased risk of strokes, and there's all sorts of other psychiatric presentations. So we have three rather distinct ways that COVID is significantly affecting suicide. We're not doing something right in this country. Of all the developed countries in the world, we are the only one, the United States, who is seeing an increased rate of suicide. All the other countries are seeing a decreased rate of suicide. I think your bill is extremely important. Not only should we be doing suicide screening for people who show up for psychiatric problems, we should have a high index of suspicion of people who show up for other reasons. Just like we have a high suspicion when a kid shows up with a bunch of broken bones that maybe there's parental abuse, we need people who, when they're doing the evaluation for whatever reason, are paying attention to a suicide risk. We also need then continuous follow-up, as is covered in some of the other bills, so that people don't get lost the day or minute they walk out of the emergency room.
Thank you very much. Ms. Gross, thank you for your testimony again today. I've seen firsthand the power of Cindy Hood Promises work and Save Promise clubs at Palm Harbor University High School, where my kids go, in my district last fall. And I agree with you that students are equipped and able to prevent all forms of violence. Congressman Peters and I led the recent introduction of H.R. 7293, the Suicide Training and Awareness Nationally Developed for Universal Prevention, the Stand Up Act, which encourages states, tribes, and schools to create policies for student suicide prevention training utilizing the SAMHSA provided best practices training and technical assistance. You mentioned that the Save Promise Club trained you on how to notice the signs and talk to your classmates who may be struggling. And you've done that, and we appreciate it so much. If students like you weren't trained in your school and there weren't Save Promise clubs, what do you think you and your classmates would do if they were struggling with mental health? If you could answer that question, I'd appreciate it.
Yes. First of all, I'd like to thank you for that question. Thank you for supporting the Stand Up Act. I think it's so important. And in my mind, or in my perspective, kids would begin to start showing signs. Kids would show signs that they are going through something, but they wouldn't be able to express it because a lot of kids don't feel comfortable doing that. So you might see a lot of kids getting into fights because that might be the only way that they can get out this aggravation or self-harm, because they wouldn't have anyone who is like them, like another peer or student that's going through the same thing to talk to. They wouldn't have someone to relay that on. So you would see kids, maybe their grades would be dropping, which could ruin their future, really, because, colleges and all that stress really put on you, it just will lead them closer to losing their lives. So that's why I think, in my perspective, the SAVE Act is so important, because it allows us to save lives by being there for people who are like us, and allow students to step in and help and give another hand to something that is so important.
Thank you so very much, Madam Chair. I guess I don't have much time left.
We all wish we had more time, but the gentleman yields back, and thank him for his excellent questions.
Thank you so
The
much.
chair is pleased to recognize the gentleman from New York, Mr. Engel, for his 5 minutes of questions.
Thank you, Madam Chair, and thank you, Chairman Pallone, Chairwoman Eshoo, for holding today's important hearing on legislation to address ongoing mental health crises in the United States. My district in New York, which includes the Bronx and Westchester, has been at the epicenter of the nation's coronavirus outbreak. This pandemic has taken an untold physical and emotional toll on my constituents. Health officials have reported a surge in COVID-19 related mental and behavioral health problems. As Dr. Evans noted in his written testimony, text messages to the federal government's disaster distress hotline are up 1,000% for the month of April. There is also a growing concern about a rise in suicides, as we heard before, which before the pandemic had increased by nearly 30% in New York State since 2000, and nationally with the 10th leading cause of death. Dr. Geller, I'd like to ask you, can you please explain why the coronavirus pandemic has exacerbated the suicide epidemic?
There are several reasons, Congressman. First is a reaction to a pandemic where people are required to quarantine. People are spending much more time without social supports. And for people with depression, that increases depressive symptoms. Second, we have a generalized feeling of helplessness, and the feeling of helplessness is already a key component of depression, so we increase depressive symptoms. People don't have contact with family that they have used for supports. People are losing family members, and they can't even attend a ceremony like a funeral, and that is exacerbating depression. So we have people who have depression whose symptoms are much worse, and we have people who are developing symptoms who didn't previously have it. And as I mentioned in my testimony before, the newest information is we're actually getting direct effects of the COVID-19 on the brain itself, which is affecting people's functioning and also increasing rates of suicide.
Well, to help reduce rates of suicide in the United States, I authored the Effective Suicide Screening and Assessment in the Emergency Department Act with Congressman Gus Billaracca, so it's bipartisan. Studies show that as many as 11% of all patients visiting the hospital emergency department are at risk for suicide, but only a fraction of these at-risk patients are ever identified. This bipartisan legislation would provide $100 million over 5 years to help emergency departments improve the identification, assessment, and treatment of patients at risk of suicide. Madam Chairwoman, I ask for unanimous consent to submit into the record a letter of support from 48 advocacy groups in support of our legislation.
I thank the gentleman for his request. We will take up all of the unanimous consent requests en bloc at the end of today's hearing.
Thank you. Dr. Evans, in your written testimony, you called the nation's rising rate of suicides the fourth pandemic. Since the nation's emergency departments account for close to 50% of all patient healthcare visits each year, do you support a more focused approach on identifying and treating patients at risk for suicide while they are still in the emergency department, such as the approach provided in HR 4861?
I do. I think it's very important. We know that a high percentage of people who die by suicide have had an emergency room visit within the last year. And when we don't screen people for suicide, we're missing an opportunity to intervene. I do think, though, it's really important to look at this issue as a systemic issue. When we design our interventions for suicide, we have to do the kind of clinical interventions that you're talking about that are one-on-one, but we also have to think about the network of resources that are available to people. I mentioned earlier the importance of having a connection between the mental health system and emergency departments, but it's also important to have crisis intervention services that don't require people to actually need to be hospitalized or need to be admitted to a service before they can intervene. Those are the things that help people have the level of support when they leave an emergency department. They don't meet criteria for being admitted, but they can be followed in the community, reducing the likelihood that they're going to get into crisis without having a connection to a mental health professional.
Thank you. Thank you, Madam Chairwoman. Thank you.
The gentleman yields back. The chair would now like to recognize Dr. Bouchon from Indiana. Is he available? If he's not, then we will go to Mr. Carter of Georgia. You're recognized for 5 minutes for your questions. Are you there? No? Okay.
Mics don't work.
Yeah, are you unmuted?
I am unmuted now, thanks to the ranking member who is here holding my hand, making sure I do everything correctly, and I appreciate him very much. Thank you, Madam Chair, and thank all of the panelists here. This is certainly a very extremely important subject, but and I certainly support the legislation that we're discussing today, but I do feel like we need more time to work on some outstanding issues and to come to a mutually agreeable place. This, you know, I've been a practicing pharmacist for many years, and I know firsthand and through personal experience as well, but also through professional experience that mental health is not a partisan issue. Mental health is a very personal issue and a very serious issue that we need to, and not only mental health, but addiction, and extremely important. And we have to address this in a partisan fashion, in a bipartisan fashion, excuse me, and make sure that we are getting everything right. You know, I really do. I'm one who feels like the administration's done a fantastic job during the pandemic, especially of expanding telehealth. It's been said that telehealth has had 10 years of expansion in 1 week, and I think that's true. You know, before this started, there were almost 11,000 telehealth visits a week. Now it's over 1 million per week, and telehealth is here to stay, and it's something we've got to work on. I wanted to ask Dr. Evans and Dr. Geller, if I could. Both of you wrote in your testimony that Congress and the administration can do more to build upon the rapid success of telehealth. What can specifically we do to expand telehealth and the patient usage of this service as well? And I'll start with Dr. Geller.
One is that we can ensure that telehealth includes telephonic services, that is the use of the telephone, as I've described before. The second is that we can ensure, that, as I believe has been mentioned previously, parity and reimbursement, that there should be no difference if a person comes to an appointment or if a person is seen through telehealth. Third, we should be putting in components to allow for collaborative care through telephonic and other electronic means. That is, for example, the psychiatrist is coordinating care with the primary physician, and that's a billable service. All those things would make quite significant differences as compared to what we had before COVID-19.
Dr. Evans, if I could ask you, you know, one of the things about that we have come to notice during this and come to realize is the lack of health services in our rural and minority communities. How can telehealth help us in that respect?
Well, it can provide services to people who would otherwise not receive them. I think one of the other issues when you talk about telehealth, one of the things that we have to fix or to work on is the issue of providing those services across state lines. Right now, telehealth is limited and regulated by the license laws within the state. There are a few exceptions to that. And when you think about areas of the country where there are not enough practitioners and other areas of the country where you have an abundance of practitioners, one of the ways to solving the problem in rural and frontier parts of the country is to allow providers who are licensed to work across those state lines, something that we're working on at the American Psychological Association, and it's really essential for this to address some of the disparities that we see.
Thank you, Dr. Evans. Congressman Kennedy, I wanted to ask you, as I said earlier, as a practicing pharmacist and also as a pharmacist legislator in the Georgia State Senate in 2009, I sponsored legislation that created our prescription drug monitoring program. So I'm very concerned about opioid use, and I think that we've done a good job of managing our opioid prescriptions for patients, but the lasting effects are still there. And what we've seen is that just recently in the last year, we've had overdose deaths have gone up 11%. Still, they've gone up 11% with everything that we've done in the way of addiction. And that's something that is very concerning to me. And I wanted to ask you, how do you think we can utilize telehealth to help us with to treat this and to treat addiction? And how can we encourage providers and patients to seek out treatment through telehealth?
Thank you so much for your question, Congressman. As you know, as a pharmacist, addiction is addiction is addiction. It could be opioids today, but it could be benzodiazepines tomorrow. And as you know, one of the real impacts of, we've never talked about in this hearing so far, is benzodiazepine scripts have gone up over 30% since COVID hit. 30%. So not only has alcohol consumption far surpassed even very high rates, but now we have this. So as a pharmacist, you're seeing the full scope of what people are prescribed. That's crucial data. And so we narrowed it to opioid because it was the quote opioid crisis. But as we know, it's really an addiction crisis where opioids are one thing, but it could also include any number of other drugs that could also get people in trouble. So thank you so much, Congressman. It's great you're serving as someone with the experience that you're bringing to this effort, and keep asking these important questions. Telehealth can definitely help in a number of ways, and
Great.
Thank you.
Okay, thank you, and thank all the panelists, and thank you, Madam Chair, and I yield back.
The gentleman yields back. It's a pleasure to recognize our colleague from California, Mr. Cardenas, for his 5 minutes of questions.
Thank you very much, Chair Eshoo, and also Ranking Member Burgess, and to all the witnesses. Thank you for your testimony, your expertise, and your practical knowledge that you're sharing with us. We're going through a pandemic, and let's pray for all of those families who've been affected and for all the loved ones who've lost family members. I'm glad to see us discussing legislative solutions to improve mental health today. I've expressed concerns in previous hearings about our disjointed mental health system and the historic wave of mental health problems that experts warn are approaching. As Mr. Kennedy mentioned, there is no health without mental health. Support for schools is very important. All of our witnesses identified schools as an important piece of the puzzle, as I was especially glad to hear a student perspective from Ms. Gross. Thank you so much for being with us today, and thank you for sharing your experiences with us. Mr. Kennedy, in your testimony, you mentioned goals around social and emotional learning and addressing the student trauma. How could the federal government best support schools with these goals and prevention overall?
Thank you, Congressman. Well, at first, I would overhaul the way we think of education so that we understand that there is no education without mental health, just like we say there's no health without mental health, because how can the body learn numeracy, literacy, when the mind can't absorb information because of what we understand neurobiologically, that their prefrontal cortex is inhibited by their amygdala. And now I'm getting into the domain of Dr. Geller, but I'll let him talk about that. The bottom line is we need to give our kids the ability to modulate their emotions, and just like they work out and learn other skills, they have to practice these skills. And those are problem-solving skills, coping mechanism skills. And if they learn these, they build resilience. And frankly, unfortunately, for too many of us, we learn all these skills after the fact. It would be so much better for all of us if our kids have these skills as early in life as possible, and that would be able to stick with them throughout their education career.
Thank you. Dr. Evans, in your written testimony, you mentioned some challenges schools are facing. Some of my colleagues and I are working on a bill to strengthen technical assistance and training supports from the Substance Abuse and Mental Health Administration, SAMHSA. What type of support from SAMHSA would be most beneficial for schools and school systems right now?
Well, I think it's important to look at schools in a comprehensive way. In my role as a commissioner, I work very closely with the school superintendent and the system that I was commissioner for. One of the things is to help teachers have the skill set to recognize when children and youth are having mental health problems and challenges. It's a big issue. I also think that implementing evidence-based approaches like school climate programs, which have been shown to reduce not only violence, but to improve school climate, is really important. The kind of services that you heard Ms. Gross talk about, and by the way, I'm, as a former Connecticut person, really proud of her being able to articulate some of the needs of students. But you know, not every child needs to see a mental health counselor or to get into a mental health program. And having people, whether they are youth and peers, or even counselors who are simply giving an opportunity for children to talk to them, is also very important. And then finally, having connections to mental health services. In my system, we actually embedded those services within schools so that children got high-level mental health services there. So it really is a range of things, ranging from educating teachers all the way to having services that meet the needs of children who have more high-end needs.
Yeah, thank you. And we don't have time on this discussion to discuss the lack of diversity when it comes to service providers in the field in general, whether it's mental health or physical health. And hopefully we can figure out ways in which in this country we can actually encourage and get young people to get into the mental and physical health space so that they can be more of the doctors that look like the people and the patients that they're serving. Ms. Groth, when it comes to education, don't you think it's just as important that students identify within each other, not just the not just the teachers that identify when a student is having a crisis, but that students would probably, if we gave them the knowledge and experience to identify peer-to-peer, don't you think that would be a good way for us to reduce the incidents on school campuses?
Yes, thanks for the question. That's definitely important because think about it. Teachers spend about 45 minutes to an hour with a student every day in class. We get that time, plus the time out of school working on projects and being with our friends, just spending that kind of time. So we follow them on social media. These are people that we have constant contact with. So what we see, I feel, is really important to fighting this cause.
Thank you very much. My time's expired. I yield back. Thank you, Madam Chair.
The gentleman has completed his questions. Is Dr. Bouchon available? I don't see him.
Yes, I'm coming.
Okay.
I'm starting my video, Madam Chairwoman, as we speak.
Okay.
Thank you. Well,
The
if I'm up,
gentleman is recognized for his 5 minutes of questions. So glad you're there.
thank you. I had just another brief thing that I had to deal with. But first of all, I want to thank you for holding this important hearing. This is the work we need to be focused on, I think, during challenging times in this pandemic. And I think mental health sometimes gets overlooked. During the midst of COVID-19, I have spoken directly to mental health facilities across my district. And the increase in challenges and honestly, the increase in calls to their helplines has been dramatic during the pandemic. You'd be surprised. One center I talked to went from receiving 2 to 3 calls a week on their suicide hotline to upwards of 20 and more calls every week. And one part of my district, talking to first responders that normally go out on a suicide call once or twice every 2 or 3 months, it's once or twice every 2 or 3 weeks during the pandemic. I mean, it's created a pretty substantial toll on the mental health of our society. I've also spoken to universities who are now left trying to figure out how to provide continuing therapy for their out-of-state students. I wasn't aware of this until I talked to one of my presidents of one of my universities. And, you know, there's a lot more college students that are getting therapy on campus, I think, than people understand. They have shared with me the difference this therapy has on their students, and it's troubling they can't continue to provide that continued care to their students in many cases just because now the students are all over the country. This particular university as many do, has people in 50 states and foreign countries. I mean, the issues, of course, are reimbursement, liability, and sometimes technology. As was pointed out in the testimony today, continued care past the first visit is really important. Therefore, as we continue to look to improving mental health and mental health through telehealth, this is an issue I hope we can work to address. Dr. Evans, do you have any comments maybe on what is happening at universities and the counseling services that universities provide to their students and the challenges that we might be facing during this pandemic?
Sure. We've been seeing a growing trend on college campuses around the country of increased mental health needs and increased students in crisis on campuses. And I think the good news is that I think a lot of college campuses around the country are starting to pay more attention to this. They're building in services. They're building in peer services, which actually is a really effective way to reach students. I think it's also important for us to not only make sure that there are services on campuses, but there are active efforts to reduce stigma so that people will reach out for help. One of the things that we do a survey each year looking at some of these issues. And one of the things that we've noticed is that the younger generation is much more likely to reach out for and be open to receiving mental health services. So that's a good thing, but we still know that we still have more work to do there in terms of continuing to reduce that stigma so people will reach out for help.
Yeah, what can we do in Congress to help facilitate this type of activity?
Well, I think it's continuing to support efforts to embed mental health services on college campuses. It's also encouraging innovative strategies. For example, in Philadelphia, where I was at, we started to do mental health screenings and make them available in the community, but then took those same screening tools and put them in a kiosk in which students could walk up in the student center, take a 10-minute screening, which would not do a diagnosis, but it would tell the student whether or not they were exhibiting symptoms that were consistent with depression or anxiety. And then it gave them information on how to connect to those mental health services. So for a millennial population that is really accustomed to using technology, using these kinds of innovative strategies is an effective way of reaching students who would otherwise not get that help.
Excellent, thank you. And Dr. Geller, can you talk briefly, because my time's running out, about the complexity of managing both mental and physical health of patients and what the challenges are there? Because it's usually more complex than we think.
It's generally much more complex than we think. As I mentioned briefly before, lots of medical illnesses present with the psychiatric presentation, and we have to have the ability to do a workup to differentiate. We have a clear example of that now, as I indicated, with central nervous system presentations. So somebody shows up with psychosis and they're COVID positive. The mistake is to send them home for 14 days and tell them to come back, because the psychosis may be a direct effect of the COVID infection. And there are literally hundreds of examples of medical presentations that look like psychiatric disorders. So we have a component.
Well, thank you. Just briefly, Madam Chairwoman, I was a physician.
Hi, everyone. It's Alex.
Before I was in Congress for the witnesses, and the complexity of dealing with both physical and mental health problems at one time is becoming more and more, I think, prominent in the medical community, realizing that you have to deal with the medical issues and with these patients that have mental illness, or you're not going to really get them through their mental illness and support them. So thank you with that, and I yield back.
The gentleman yields back, and I would just say that you're a doctor for life, Dr. Bichon, and we're blessed to have you as part of the committee. The chair now will recognize the gentleman from Vermont, Mr. Welch, for his 5 minutes of questions.
Thank you very much. I want to start with the telehealth, or as my friend Mr. Carter would say, telehealth. It's been terrific in Vermont, and I do think the Congress and the president have done a good job in taking advantage of it. But Dr. Geller, you've talked a lot about it. We have I've had a lot of feedback from practitioners that, contrary to what I expected, the interactions are oftentimes not only easier, but more intimate. One practitioner told me about being able to go on a virtual walk with a client who was in a very rural part of Vermont, and also how at times it'd be relevant for other members of the family to be able to participate in the call. Can you comment on that, the effectiveness from establishing that intimate relationship and trusting relationship that's so essential for a person seeking help and the provider giving help?
Sure, and it works in both directions. There's something to be said for being in the same room. But I've had lots of experiences with patients in telepsychiatry where not only are they more willing to speak, but you have opportunities for in-the-moment experiences that you can then bring into therapy. So I have a woman who's a single mom with 4 kids, and sometimes the kids run in and interactions take place, and then we can actually talk about what just took place. So you are in the moment with patients, and that can make a huge difference.
Thank you. Another question I have about mental health is this. I'll probably get this wrong, but there's some conditions like bipolar, schizophrenia that are chronic with acute episodes, require medication, constant treatment. But so much of mental health seems to be an outgrowth of loneliness, depression, erosion of community stability, lack of jobs, communities getting hollowed out. And one of the challenges we face in Congress, even with our bipartisan commitment to addressing opioids, is that it really doesn't, it's after the fact. It's really not providing that underpinning of some security that folks need in a community, stability in relationships, stability in their social networks. How much of the explosion in mental health situations that we have here do you see as having a connection to the erosion of those communities, jobs, support structures, and so on? Because so much that you indicated that the suicide level in Europe was significantly below us here. Maybe I'll start with you, Dr. Evans.
Sure. Well, what you're referring to, we call in the field social determinants of health. And we know that there are certain things that we experience that can lead to challenges for us both physically and mentally. And as you noted, things like losing your job, being under a lot of stress, being homeless, all of those things are stressors that can lead to mental health challenges. Our field has not done a good job of understanding or at least incorporating into our clinical approaches an understanding of those social determinants and using that information to actually help people. I mentioned in my testimony, my oral testimony, the importance of addressing issues like homelessness as a way of actually improving people's mental health.
Let me interrupt you there, just because I only have a minute. But with respect to that, and all of the activity we're seeing, the activism around Black Lives Matter, are we, in many cases, focusing too much on police as the responders of first resort, rather than the kind of rapid response team that Patrick Kennedy said we need when there's a mental health issue? Patrick, maybe you could address that.
Well, thank you so much, Peter. I think obviously when you look at the fact that so many of our jails are filled with people with mental illnesses and addictions, that clearly a better response than occupying police time would be to make sure that proper first responder teams are in place who are mental health first aid responders and of the like. So obviously, I hope that's in your number of things that you can consider today, and it'd certainly be a terrific allocation of resources, or if you will, reallocation, because I think any firefighter will tell you these days, especially, they spend more of their time trying to do first response to overdoses and mental health crises than they do putting out fires. And the same with police officers. Most of the cases they get called to may present as a criminal justice issue, but clearly have a mental health at the root cause.
Thank you very much. I'll yield back, but I do want to say thank you to Ariana Gross for her excellent testimony and the work she does. Thank you, Madam Chair.
The gentleman yields back and thank him for his excellent questions. The chair is pleased to now recognize the gentleman from Oklahoma, Mr. Mullen, for his 5 minutes of questions.
Thank you, Madam Chair. I appreciate you holding this hearing because it is an important issue, something that obviously I have been working on for quite some time, starting with the 42 CFR Part 2, which I was glad to see was aligned and put in with the CARES Act. And so, Mr. Kennedy, this is a question for you. I know our offices had spoke multiple times about this. Appreciate your insight and your feedback while we were taking this fight on for 42 CFR Part 2. Your feedback was instrumental, and you provided some influence in there that I think really helped with the colleagues on the other side of the aisle, which this was a bipartisan approach. in this committee. How does this important measure with aligning Part 2 with HIPAA help in the times that we find ourselves in, especially when we see an increasing mental health crisis going on because of the pandemic?
Thank you, Mr. Mullen, and thank you for your leadership on this. I appreciate it very much. And I think, as we just heard Dr. Geller talk about the co-occurring of, psychiatric symptoms with physical symptoms and conditions. And the bottom line is, when I go into the ER, if I'm going in with COVID or something else, and they don't understand about my underlying psychiatric issues, or in the case of addiction, they do not know that I am someone who suffered from the chronic disease of addiction, which has a better chance of killing me than any other illness that I face. And I face a couple of them, but nothing as critical as the life or death issue of having to fight addiction as a disease, which, by the way, when I go to my doctor doesn't ask me about my addiction because it's not in my electronic medical record. Right. And my doctor has a pen, electronic pen these days, to prescribe anything that they want. And if they do not know that I have the disease of addiction, they are practicing medicine without a license. And that's why I thank you for that 42 CFR, because there are hundreds of thousands of my fellows in America who are dying because their medical system does not know they have an underlying addiction because it doesn't show in the EMR that they've been treated for addiction. So I just assume if you're protecting my privacy with respect to anything else that's super sensitive, and if sexually transmitted diseases are protected by HIPAA, then I should think mental health could be protected by, and addiction could be protected by HIPAA as well. So I think that this is about protecting patients' health. That's why it's so important to have 42 CFR fixed. Thanks.
Well, Patrick, you have been very passionate about this, and it was something that affects all of us. In your opening statement, you said this, every family is affected by this. Mine is no different. In Oklahoma, we've been devastated by mental illness and the opioid and meth issue, which a lot of times mental illness runs hand in hand with that too, because they're trying to self-medicate. And all of our families, you're right, have been devastated by this. And so I just want to tell you again, I really appreciate it. And thanks for your insight and your input on that too. Dr. Evans, real quick, there's been an increase of almost 900% of mental health crisis hotlines, calls to the hotline this year. Now more than ever, do you think it's more appropriate to remove some of the barriers that are prohibiting some of the treatments that could take place for people that are suffering from mental illness?
Well, absolutely, and I appreciate that question, Congressman, because as you know, you're a supporter of 884, which removes barriers in the Medicare program for psychologists. It is a real travesty that in 2020, we have administrative barriers that prevent people from getting the care that they need. That legislation would allow two things. One is to ensure that seniors who right now are experiencing one of the worst mental health crises of our lifetime have access to psychological care. And then the second thing is to make sure that psychologists are eligible for reimbursement for the incentive payment to work in some of the rural areas and underserved areas that we've talked a lot about in this hearing. Our seniors have significant mental health needs normally. They have exorbitant mental health needs under this current crisis. And it is just not right. It is not right to deny them that care when there are ways to remove these administrative barriers. And let me just say that the barriers that we're talking about have been removed for podiatrists, they've been removed for optometrists, for chiropractors, for a lot of other doctorally trained professionals. And the administrative barriers that we're talking about are only in the Medicare program. They're not in the VA. They're not in TRICARE. They're not in any private insurance. It is only the Medicare program where we have the most vulnerable people in our society. And I really appreciate your support and other members of Congress so that we can remove that barrier and really focus on making sure that everyone gets the care that they need.
Thank you, Dr. Evans. And Madam Chair, sorry about going over there, but I appreciate the indulgence there and we'll yield back. Thank you.
Well, thank you for your good work, Mr. Mullen. The gentleman yields back. Pleasure to recognize Dr. Ruiz from California for his 5 minutes of questions.
Thank you. Thank you very much. We are very happy to have this hearing today on such a critical issue. This is especially important at this very time as we are seeing anxiety, stress levels go up during this pandemic. This March, for example, the Disaster Distress Helpline, supported by the Substance Abuse and Mental Health Service Administration, saw an 891% increase in calls compared to March of last year. The mental health system in our country was already strained prior to the public health crisis, which is why it is more important now than ever to look at ways to expand access to mental health for all Americans. It is worth noting that if the ACA were to be overturned, health insurance plan would no longer have to cover mental health and substance use disorder services, including behavioral health treatment, as an essential health benefit. Having spent my career prior to coming to Congress as an emergency department physician, I can tell you from firsthand experience some of the access issues that individuals face. Oftentimes, individuals with an acute mental health episode end up in the emergency department, sometimes because there is literally nowhere else to go. Then the emergency physician needs to make a decision. Either they hold them for a psychiatric evaluation for suicidal ideation, or they hold them because they cannot find any transfer beds, any mental health hospital beds, or they discharge them and are unable to start treatment or get them the care that they need because there's not enough primary care practicing psychiatrists out in the community or other mental health professionals. The biggest concern is lost to follow-up. That's a term that we use when you discharge somebody knowing that they need follow-on care, but unfortunately, because of the systematic problems, they're lost to follow-up. The emergency physicians or providers want to find the appropriate care for their patients before releasing them. They want to have them hand them off directly to the next provider, knowing full well that once that patient walks out the door, the chances of them taking the next step drops dramatically. So emergency departments across the country have implemented innovative approaches to securing follow-on care for their patients, like putting in place transportation systems to get their patients from the hospital to the rehab facility, or tracking regional inpatient bed capacities, or coordinating with area mental health providers in a team community-like approach. But they don't always have the resources or capacity to do as much as they want to do. That is why I introduced HR 2519, the Improving Mental Health Access from the Emergency Department Act of 2019, which would create a grant program for emergency departments to transition their patients into more appropriate care for longer-term treatment. Dr. Geller, can you talk a little bit about the specific barriers that emergency departments have to be able to give their patients a warm handoff to their follow-on care?
Sure. As you've indicated, most emergency departments operate like silos. They have no relationship whatsoever to the services that follow, unless those services happen to be within the same hospital as the emergency department. So your bill is making huge steps forward in that regard. The second piece of this is we don't have enough beds, and that's so people sit in emergency rooms where they don't belong. For lengths of time. We've had people sit in emergency rooms for up to 30 days looking for a bed. Why can't we find a bed from the emergency room? Because we have people in general hospitals where we don't have enough beds. Why do we have some people in general hospitals? People in general hospitals can wait 6 months to get transferred in some states to the public sector hospitals. We also have jails and prisons filled with individuals because we don't have enough beds. So we need coordinated services and we need funding for that. And your bill does an excellent job with that, but it needs to be coordinated with an adequate number of psychiatric beds.
And what are some of the barriers that the patients face when they're discharged for follow-on care that go beyond the lack of beds or locations? And how could the grant help?
So the grant can help because we're asking people who are in distress and may have, depending upon their diagnoses, problems with social skills, problems with organization, and we're saying, here's a phone number, you follow up. They call that phone number and they get a recording. So that this bill would actually create steps that are going to be facilitated by people in the emergency room to make sure there's a warm handoff. And as you well know as a physician, there's nothing more important than a warm handoff.
Thank you very much.
Gentleman's time has expired. It's a pleasure to recognize the gentleman from Montana, Mr. Gianforte, for his 5 minutes of questions.
Thank you, Chairwoman. I appreciate the committee hearing today to discuss legislation to improve our mental health care system. I appreciate that legislation I introduced with my friend from Virginia, Mr. Beyer, was included in this hearing. Our bill, H.R. 4585, the Campaign to Prevent Suicide Act. Our legislation would direct the CDC and SAMHSA to conduct a national suicide prevention education program. This includes advertising for the new 988 number for the National Suicide Prevention Lifeline. It would also encourage individuals to engage with people showing signs of suicidal behavior instead of ignoring them. We introduced this legislation to complement the efforts of Mr. Stewart's legislation to designate 988 as the suicide hotline and Mr. Katko's legislation to ensure funding to implement the designation. To better respond to those in crisis, we need to have.
All right, everybody, here on coronavirusnow.com, we're getting ready for you 30 seconds away. Live coverage from around the country. We got you covered right here today. And welcome everyone here on Fox 10 Extra and coronavirusnow.com. It's setting up to be a very different kind of 4th of July weekend. We got 2 hours of nonstop coverage for you from around the country. Let's just pop in to one of the many Florida beaches right now that are unfortunately going to be shut down this holiday weekend as Florida is seeing surging coronavirus numbers. Of course, Texas is, and right here in Arizona, we are too seeing more than 4,000 cases just today. So we'll have those numbers for you and so much more. But let's get right into it, everybody. We have this Friday edition. It is me and Ron Hoon back together again for some of your top stories here of the day regarding the COVID-19 pandemic. Ron, how you doing today?
Doing great, Mike. Hope you had a nice week off last week. Did you go back to the Chicagoland? Where'd you go?
Well, I was supposed to. If this whole coronavirus thing wasn't happening, that was the agenda.
Yeah, of course.
But then I just had to say, you know what? It's just not worth it right now. So.
Right. Yeah, I know.
And now
I got
some
time off in.
Oh, I was just going to say.
I got some time off in July, and my plan right now is hop in the car and go somewhere.
There you go.
I don't know. We'll all get back to flying eventually. We're just a lot of folks aren't there quite yet.
I know. And did you see what the Chicago is doing now with the if you land there, you got to quarantine for 14 days if you're coming from Arizona. So couldn't.
Are you kidding me? When did that go into effect?
They just started that last night.
Oh, for goodness sake.
Yeah, so that would be much of a...
I don't know. You know what's really interesting, Mike, is when New York they really were the epicenter of the virus, and people kept asking out here in Arizona, these flights keep landing from New York, and there's nobody there to talk to these people as they come in? Are we going to implement any kind of a plan? Eventually, a certain number of states, I believe it actually started with Florida, said, okay, we are actually going to implement some sort of quarantining. It's sort of antithetical to the United States way of doing business. I mean, we are one big country.
Right.
And it's interesting because I don't know. I mean, does that also mean that if you drive to Chicago and you have an Arizona plate, they'll pull you over and tell you to go get into a quarantine situation?
Yeah, it is. It's really bizarre. You would think that would be the case too. I don't know, but geez.
Yeah, right. Yeah. Well.
Yeah. It's setting
up.
Yeah,
I mean, I saw Florida, they reported today almost 10,000 new cases, about 9,500. I was actually impressed that here on the holiday, but then our state also reported about 4,400 new cases. So the hope, I don't know what your experience has been, Mike, but the more I go out to, say, the grocery store, to me it looks like we're getting pretty close to 100% of people, I'd say a good 90% plus, who are wearing the masks, whether you like it or not, and plenty of folks don't like wearing the mask, but we got to get these numbers down, and that's the goal, and that sounds like the plan for how to move forward.
Yeah, that does seem the plan, and that's what I'm seeing too when you go to the grocery store. You're right there, 95%, I would say. But when we heard Governor Doug Ducey earlier this week saying that this coming week, next week, could be even worse. Think about that, what those numbers would be then.
I know. Well, I will just say they had 20,272 tests reported in the last 24 hours. And we have a lot of locations that people are getting in their cars and they're waiting in long lines. But the problem is the cases per 100,000 here in Arizona are now well over 1,200 per 100,000. And you go back, and I'm just looking at mid-June, and at that point, the cases were in the 600 per 100,000. Now we're at 1,200 per 100,000. So if you just break it out, because it's really not fair to do apples to oranges, you've got a state like California that's got such greater population than, say, the state of Arizona. But if you just look at it in terms of our population, basically, based on our population overall per capita, our numbers have actually doubled in about a 2 to 2.5 week time frame.
Yeah, that is not what we want to hear, though, there at all.
Well, I think a lot of folks took a look at it, Mike, early on. Shortly after the governor had lifted the stay-at-home order on May 15th, we actually flew over the top of a rooftop bar that was so jam-packed with people right here in the valley. Almost immediately, I think it raised the question on a lot of people's minds, like, so are there any rules right now? Or are you just nicely asking people to do social distancing? Because it wasn't working. And then there was the delay. There were cities that were saying to the state, look, we've got to do something. Eventually, the governor did. A lot of folks wondered why it took so long. And then the new controversy was that health clubs were included when a lot of folks thought primarily it was going to be the bars. Now, that'll be interesting because from what I read on social media last night, there's supposed to be a court hearing on Monday for this suit that has come from the health club industry aimed at the state government, and we'll see what happens just in the next few days.
Yeah, really. And even before that, Ron, less than 2 hours away, some of the health clubs here in Arizona have until noon today to cease operations for a while, but we'll see if that'll happen. So that'll be interesting, too. I know Lifetime is in the mix. Mountainside is also there, so we'll see what they do.
I wondered what was up with that new deadline, because they had already given the original deadline was the governor spoke Monday afternoon at, I think, around 4.
Right.
And said it all has to go into effect at 8 o'clock tonight. So that seemed like the real deadline. You know, my understanding is a lot of the health clubs felt like they were not given any form of due process. Some legal analysts have looked at it and said they feel like these businesses actually have a pretty good case, that they want to be given some sort of due process, at least in the state of Arizona, before the government can shut them down a second time.
Yeah, we'll see just how it all shakes out, and if people will be still working out or if they won't even be allowed in the doors. We'll know in the next couple of days there for sure. But right now, Ron, I'm showing what would be the main event for any 4th of July celebration tomorrow. It is, of course, the fireworks. The fireworks shows that so many towns and communities would put on. You know, there was a number out there, according to this Fox News article, Ron, that over 16,000 fireworks shows across the country happen every July 3rd and July 4th weekend. And now they are saying that less than 5% of those will actually happen. And that's really hurting the business for these firework operators that put on these magnificent shows.
Yeah, you can understand. Now, particularly here in Arizona, we just always have concerns around the 4th of July. We do put on some great shows here in the Metro Phoenix area, but there are always concerns up in the forest lands, and we've had some pretty bad fires this particular summer already. We just count on the summer rains, which usually, by the way, start around the 4th of July. But it's understandable that you just do not want to attract a large crowd right now, so you have cities, in some cases, still trying to figure out ways to do it, but social distance. You know, they had been talking, for example, in Mesa about having people watch from their cars, that kind of thing. A lot of cities have canceled it. And it's just so interesting, Mike, on an almost everyday basis, because we've never seen anything like this in our lifetime. What's been happening from one industry to the next, up until a week ago, who even stopped to think that the people who put on these fireworks shows, which is part of Americana, that they would be on the verge of financial collapse. Now, of course, we think about it because here's the 4th of July and the vast majority of shows are canceled. We just had a story this morning that over 1,000, in fact, I think around 1,500 of the biggest names in music wrote a letter to the government in London. I'm talking about Paul McCartney, the Rolling Stones were on this thing, Eric Clapton, Ed Sheeran, saying save live music. They're just trying to call attention to the fact that in the UK alone, there are over 200,000 people that rely on the business of live music to make their living. And so they're reaching out to their government now saying, look, something needs to be done. Something's got to be done. Because there's another industry that you, up until a few weeks ago, you might not have even thought about. We all thought right away about the airlines, the hotels, the car rental businesses, the restaurants. We thought about all of that, but just the domino effect of worldwide economies shutting down, it's like something none of us have seen in our lifetime. I mean, the hope for a vaccine just grows by the day. All the reports, by the way, are very positive that we hopefully will be getting there, and potentially around the end of the year or first part of next year. But President Trump, we talk politics, by the way, folks, a lot on this show, and he has said that he views 2021 as almost like a rocket ship that could go straight up as once they get the vaccines rolled out, to really get the economy going. I think Joe Biden probably needs to address that because there is the one thing in all the polling that shows the most positively for President Trump's hoped-for re-election is people do definitely give him the credit for being amongst the two candidates who would do the best job of getting the economy restarted. He doesn't do nearly as well in so many other categories. But that might be one vulnerability that Joe Biden needs to look at as well. The economy, Mike, let's face it. Nobody wants to get this. Nobody wants to get this disease. And as the numbers roll on and the numbers grow every day, the big question mark that's out there is, where will we be in the economy? I mean, you take a look at the V shape of the stock market's recovery. It's been pretty remarkable.
Yes.
And the market operates 6 to 9 months in advance. The market is assuming that the great scientific minds of the United States and other nations will be able to come up with a vaccine so that we can get things going again. That's a really positive sign. But ultimately, when we're living in the middle of it, nobody really knows.
No, they don't know. And well, I think at this moment, though, Ron, people do know that they won't see normal again until this vaccine happens. I mean, think about it. We tried to get back going here in Arizona. And for a couple of weeks, for a month, we were trying to, the restaurants were back. We were trying to get some sort of normalcy going, and then they just dial us back in because, well, some people just were out and about too much. And now we're dealing with this the second time of a shutdown.
Yeah, I know. It's really frustrating. And the thing that is frustrating about the timing on this one is you have virtually every school district, K through 12 around the country trying to figure out how are we going to get schools started once again. It wasn't that long ago that it looked like the plans were moving along, at least here in Arizona, pretty efficiently. But then when you see this huge spike, then you see at the University of Arizona, their president saying, hold on, if these numbers continue the way we're seeing them, or if this trend line continues and it gets even worse, I can't see reopening the campus. Well, if you don't reopen the campus at one of the major universities here on the West Coast, then how does that impact the sports world? Because, you take a look at the Pac-12, which is the big football conference out here on the West Coast. They've all said, all the university presidents and the commissioner, we are not going to play football if the campuses aren't reopened. So there's just this domino effect. We had people who were out naively over the course of a few weeks thinking, hey, this virus, maybe it sort of kind of went away, which was never the message. It was go out there, but be very careful and be considerate of others and do your social distancing. Keep those masks handy. And it just all went south. And so now we're not quite sure how things are going to go with the school year out here in Arizona. We usually start in early August. We're a few weeks away. We're a month away. What do you do now? What do you do when universities normally would be opening later in the month of August? The timing of this surge it's really disappointing because it's just creating so much more uncertainty, and not just in the world of education.
That's true. And Ron, did you ever think that during a presidential election time, an election year, that really the election year is second fiddle to all this COVID coverage? I mean, it's really like, and then in November there will be an election, but first, I mean, it's something.
Yeah. You know what's really, really interesting, Mike, and you're a student of history just like I am. To me, this is one of the most fascinating parts of the entire political world that we exist in right now. In 2016, President Trump, Donald Trump at the time, obviously loved doing these huge rallies and getting the crowd chanting and packing people into the arenas, and the lines were long of thousands who couldn't get inside. And, we have just seen over the course of many, many, many election cycles, candidates rolling up their sleeves and getting out there right in the thick of the crowds and doing what they could to really generate excitement. Now, 100 years ago, or 125 years ago in our country, that's not how presidential campaigns were run. In fact, it was considered almost bad taste for the presidential candidates to actually get out there and campaign themselves. They would let surrogates do it.
Wow.
So I am not going to be shocked, Mike, and I have not made this prediction yet.
Okay.
This is the first time I've done it, and we like to talk politics on this show, everybody. I am not going to be shocked if we go back to the future here in 2020, and Joe Biden in particular, who has been doing just fine in the polls, staying at his house, I'm not going to be shocked if that is most of his entire presidential campaign, is a digital campaign, is a virtual campaign, whether he does it from the basement or he does it somewhere else in the house. It's interesting because we might be headed toward that kind of election, and the president might still go out and have some of his rallies and say things like, come on, Joe, come on out of your house, that kind of a thing.
Right.
But what is the incentive for Joe Biden to do so if he continues to ride so high in the polls?
Yeah, if you see these poll numbers that continue to be in his favor, I mean, why leave the House then? But on the same token, you got to bring back 2016 when they talk about those poll numbers, though, because a lot of people are saying, but wait a minute, if you guys did the poll numbers back in 2016, isn't Hillary the president by now?
Right.
So there's going to be a lot. There's going to be a lot of that talk too.
No, that's a good point. Yeah, I mean, people were the polling organizations. They had some real egg on their face in 2016, and we can only hope, because every organization is different. None of them are controlled by the government. They're all, independent private businesses, and or else they're run by a university, et cetera. But let's just hope that they are tweaking their election models with a mea culpa built into the fact that they got it so wrong in 2016. What do you have to do to make sure this time around your polls are more accurate? Because, Mike, you raise a great point. They really missed in 2016.
Yeah, that was a miss, and if it's a miss again, that would really put some egg on their face there as well. But we will see on November 4th, the day after, Ron. Yeah. I'm sure that will be a show like none other then.
Yeah, and then, Mike, remember 4 years ago, Mike and I, you guys, and our other digital journalists, we would sit around and we'd say, gosh, what are we even going to talk about once the election's over?
Yeah,
we've just been through 4 of the most unbelievable years you would ever want to see.
Yeah,
and the interest in politics is, if you ask me, is pretty close to an all-time high. Oh, and by the way, the year 2020 has been pretty incredible. Did you see there was a meme that was going around the other day, Mike? It was Doc Brown sitting in the DeLorean with Michael J. Fox, and he, and the flux capacitor's right behind him, and he says, "Whatever you do, don't put it on 2020."
Yeah, you don't want to go there. Yeah.
Don't go to 2020. Pick some other year. Oh man,
that's good. That was a good one.
Hopefully, at least we're to the point now that we, can have a little bit of fun, because frankly, this year, Mike, with what the virus has done, and consider it was really right at the start of the year, right in January, that we started to see it spreading in China, and it started to pop up in Italy, and it has come to the United States, and it hasn't let go. And one of the disappointing things, I do think, Mike, is this. A lot of us hoped that just like most viruses, it would die out in the summertime. It's just not happening.
No, it's ramped up.
Yes, no, it's gone exactly that way, and that's just a reflection of how transmittable it really is, how contagious this particular virus is. By the way, Mike, there was a story, it was such a touching and emotional and heartbreaking story coming out of California. There was a fellow, 51 years old, in Lake Elsinore, California, who his family says he was doing such a good job. He took it so seriously with the social distancing and just making sure he was very thoughtful in how he protected others in his family and his circle of friends to make sure that there were masks or social distancing, that kind of thing. So he did decide to go to one party. He thought, there was a group of friends getting together, I'm going to go to this party. And this, by the way, this story comes from our friends at Fox 11 in LA. And he did go to the party, and then a few days later, he gets a phone call from somebody who had been at that party. I want to say the man's name was Tommy Macias.
Mm-hmm.
And he gets a phone call from somebody else who'd been to the party saying, I'm so sorry, but I have tested positive for COVID-19, so I recommend that you and everybody who was at the party. Well, he goes and gets tested, and sure enough, he got the virus. He posted a few days on social media about how sorry he was because he'd had it for a while without knowing, and he had then spread it to other members of his family. He particularly mentioned his mom and some of his sisters, and he just felt so bad, and he said, with God's help, hopefully I'm going to get through this okay. He died the very next day after posting all of that online. 81 years old. We're not talking about somebody who was 85 here. We're talking about a man who was in his young 50s. So it just serves as a good warning for all of us. We still need to take this thing seriously.
Yeah, very serious at that, Ron, and it really just shows you I mean, you know what's going to happen, Ron? At the end of 2020, at the end of this year, people are going to be at New Year's Eve parties, and they're not even going to want the countdown. They're just going to want to speed it up and say, get this year over with. Let's go. Let's go right into 2020. We don't need a ball drop. There's no big celebration. It wasn't a great year. Let's go.
Right. I mean, what about that? What about the tradition of people coming to Times Square? Is that even going to happen?
No.
You know what's interesting, Mike? We're in July. When we were dealing with this in March and April, I think most of us assumed that we were going to flatten the curve and life was going to be back to pretty close, hopefully, to normal by the month of July.
Right.
Well, that's just not what's happening right now. We are definitely in the middle of a second surge, and you just wonder, if everybody does their part here over the next week or two, can we flatten the curve a second time?
Yeah, you know it's going to be different this weekend when if people go to a 4th of July get together with a family. Now it's not going to be, oh, did you remember to bring the potato salad? It's now, did you remember to bring the potato salad and your mask? Bet you never thought you'd have that combo ever, and now that is what we're dealing with, but that's the state of the facts.
Yeah, Mike, it's exactly right. Matter of fact, one of the experts that we had heard from earlier today on the show, over on Fox 10, right next door, had said it wouldn't be a bad idea for you to just jot down, for whoever comes over for 4th of July, for you to jot down everybody who was, if it's at your house or if you're at somebody else's house, just jot down the names of everybody who was there. Because over the course of this great big country of ours, as people to get together over 4th of July, and people will wear masks, but there are going to be some instances of the virus spreading. And he said, look, just jot down every name so that if the worst happens, you can then reach out to people right away and say, sorry, but I tested positive, or somebody else who was at the party tested positive. Make sure you get yourself checked out ASAP.
Yeah, that's a good idea there, right there. No doubt about it, Ron. Well, it's always great talking with you, Ron. We started this show up on this Friday, bringing everyone the news of the day, and on this 4th of July weekend, Ron, it's always great to talk with you, and enjoy the weekend.
Mike, same to you. Happy 4th of July. Happy Independence Day. Nice to see you working on what officially is a company holiday. Let's all be safe this weekend, and we'll see you all next week.
Yes, absolutely. And I should point this out, Ron. I think this is our record for a segment. We're at 25 minutes. I don't think we ever pushed it that way, Ron.
Wow, man. That's how you squeeze 15 minutes into a 25-minute show.
Yeah, the fastest 15 just have to be extended just a little bit more. It's a pandemic. We have to.
There you go.
All right, Ron.
Yeah,
Thanks so much for talking. We appreciate it.
Sure.
And coming up next here on News Now, everybody, we got Dr. Mike on deck. He's going to give us the very latest, what he is seeing across the country regarding this pandemic. Don't go anywhere. We're back in just 2 minutes. And everybody here on coronavirusnow.com, I should point out, everybody, let me just get that going here for you. There we go. I should point out, what will the next coronavirus relief bill look like? Well, as a recent coronavirus resurgence threatens to derail the U.S. economy one more time, there could be another stimulus bill in the works, but the question is the timeline, because you got to figure there's going to be a break in Congress coming up, and when can they get something together again? Recess again is going to be happening really until July 20th, and then you got the whole August recess as well. Can they push out a second stimulus check in that short amount of time? That remains to be unseen right now, but we'll wait on that. And on coronavirusnow.com, everybody, we're just a minute away coming back live with you. Welcome back, everyone, here on Fox 10 Extra and worldwide on coronavirusnow.com, taking a live look at the Capitol here on this July 3rd, as we are a day away from July 4th. Hope everyone is having a great day so far. We appreciate everyone joining us worldwide, as always, right here as we provide you the updates as they are coming in right here on News Now, everybody. I'm your host, Mike Bache. Always great to be here with you. Let's go out now to Fox 29, Philadelphia, our sister station. We try to do this segment every day. Dr. Mike is on deck here with us, giving us the very latest of what to expect in the future here with this pandemic and what we are seeing really across the states right here, right now on News Now.
Dr. Mike Strigliano with Penn Medicine joining us out of Philadelphia. Great to see you on this Friday, Dr. Mike.
Always a pleasure, Thomas. Happy 4th of July, my friend.
Thank you. I appreciate that. Same to you. And here we are in July, cases reaching record numbers. Dr. Mike, there's still some confusion, so I want to go over a review, if you will, over some key points. The first one being, how is this virus spread?
We feel, Thomas, the virus is mainly spread through aerosolized virus. So if I speak loudly, if I cough, if I sneeze, the virus is in little droplets of moisture and it goes through the air. And that's why we use the guidance of, hey, we need to socially distance, we need to stay 6 feet away. Now, that is the major highway way of getting this virus. The country roads, if you will, way of getting this virus is by touching inanimate objects. And so the risk is lower, but not zero. So if someone touches a doorknob and they just coughed into their hand and they have COVID-19, you could then touch the doorknob, touch your eye or lips, and end up getting the virus.
Let's talk about the symptoms. I know there were 3 symptoms recently added to the list. What are they?
So basically, Thomas, runny nose, congestion, changes in bowels, loose stools, diarrhea, and you can have all of the other classic things. You can have fever, chills, loss of taste, loss of smell. You can have muscle aches. You can have conjunctivitis. The list goes on and on. My strong advice to everyone, at least in my practice and my family, if you don't feel well in any way, shape, or form, or you just think something is unusual, you need to check in with your healthcare provider. I don't care what it is, because this virus can mimic a lot of things. And you need to get tested if you are in any way suspicious. And that's what we're doing.
We just mentioned these symptoms, a long list. They mimic so many other conditions. How do you navigate through all that? How do you diagnose what a person is going through?
Well, early on, Thomas, we looked at travel history, but now you can just go 1 block and get COVID-19. So it's not like you have to go to Spain and come back and get the virus. So travel history is one thing, exposure is another. But again, symptoms. And in this era, the way I'm handling it as a primary care provider, if someone has any of those symptoms, and remember, it can be even fatigue, I check them first for COVID-19 because this is public enemy number 1. And so that's how I handle it. If they are negative for COVID-19, then we are able to look further. Perhaps they have seasonal allergies, but seasonal allergies don't tend to kill people like COVID-19. Now, in the fall, we are hopeful that we will have a panel, a respiratory panel that will include COVID-19, so that when you come in, if you have all of those symptoms, I will swab you and or get saliva, and I'll be able to test you for a variety of upper respiratory infection items, whether that be COVID-19 or other viruses. And so it will be something that will be very helpful for people like me.
Well, it certainly could be a challenge. When we talk about the incubation period, Dr. Mike, what are we talking about?
Usually, Thomas, people develop symptoms in about 4.5 days, and that can go up to about 11 days. The big bugaboo here is the fact that many people are asymptomatic. And so, Thomas, there might be someone that might just have sniffles or sneezing or runny nose and nasal congestion. And that might be all they have. They might not have much more than that at all, and they actually have COVID-19. That is a real problem because that person could be spreading the virus, and we don't even know that they are spreading it, and they don't know that they have it.
The early stages of this virus, we talked about the at-risk groups. Who is most at risk now?
As we've said before, Thomas, as you get older, and the experts have taken away that age 65 measurement, it's as you get older, you're at risk. If you have underlying immune conditions, you're on medicines that suppress your immune system, you've had organ transplants, if you have cancer and you're being treated for cancer, those are the high risk category people that really make me nervous, that I want to be really hunkered down at this point. But as we have seen, there are healthy people who can still get very sick and end up on a ventilator. And there are elderly people who do have health problems who look like they just have a cold. It's very variable. But again, those folks who have underlying obesity, diabetes, folks with underlying cardiovascular disease, those are the folks that we worry about.
Yeah, obesity just added to the list. As we head into the holiday weekend, Dr. Mike, what's the proper guidelines for wearing a mask?
Well, right now, Thomas, even President Trump is saying that masks, I believe in it. So masks are important. And at least in Pennsylvania, you have to wear a mask when you go outside of the house. Wherever you go, whatever you're doing, you need to wear a mask. We all need to wear a mask. I don't care. It's not something to debate unless you have an underlying medical condition that wearing a mask puts your life in harm's way. But that is a very low number. If you're outside, you need to wear a mask. Any kind of mask, no matter what.
What about when it comes to our young, our children? Is there a certain age where they shouldn't wear a mask?
Well, guidelines have suggested that over the age of 2, we should have people wear a mask. Now, I have young children at home. It's a real challenge to get them to do much of anything, but wearing a mask, I think, is going to be critical, especially when we go back to school. I think it is mandatory and the right thing that kids wear masks when they are in class. And that goes from age 2 all the way up. If they have an underlying medical condition or a emotional condition or a condition that doesn't allow them to be able to do that, that's another story. But for the rank and file, they have to wear a mask.
More news from the CDC shows that pregnant women, Dr. Mike, with COVID-19, 5 times more likely to be hospitalized. Is there any data yet on how a COVID-19 infection affects a woman's pregnancy?
Well, the good news about that is that it does not seem to increase the mortality and long-lasting effects. We have seen a couple of case reports of possible vertical transmission. That's where mom has given it to their child. This is an idea and a concept that is under great study right now, as you can imagine. But for the most part, we have not seen mass casualties when it comes to mom and baby. So that's good news. But if you're pregnant, you need to be very, very careful in your social distancing, wearing a mask, and being aware not to go to where large crowds are. You just don't want to put yourself in that position. In some cases, newborn infants who have become positive, it turned out, got infected from healthcare workers. So it's a sticky wicket, but the bottom line is that there's no red flags right now looking at newborns and moms.
What about prenatal care appointments? I know some women are skipping those appointments out of fear.
Not a great idea, Thomas. With telemedicine and all of the options available to us, it is very important that women get prenatal care. And we have to realize that there are racial disparities, especially when it comes to things like prenatal care. African Americans, Hispanic women must get the same level of care that everyone does. But all of that said, lots of people, regardless of race, are not getting the proper prenatal care for fear of getting COVID-19. Call your healthcare provider, make sure that there is at least telemedicine visits going on.
Question I see a lot, Dr. Mike. Will a vaccine eventually wipe out this virus?
I think a vaccine, Thomas, is critical to us getting out from under this nightmare. I think that based on my own personal humble opinion, I would say that this virus is probably going to circulate the planet and will not go away. Our best hopes are that we get so many people immunized in addition to the people that have been naturally infected, and we will have herd immunity, and then we will be able to isolate those people that are positive, make sure we isolate them, and do what's called contact tracing that everybody knows now, where we find out who they were with so that they can be tested and kind of sequestered as well.
Once approved here, this vaccine, would it be safe for everyone to take, or are there certain groups who may be at risk, exempt from receiving the vaccine?
Thomas, some people are not able to get some vaccinations, whether it be conditions like Guillain-Barré, which is an autoimmune problem with some vaccines. Some people are allergic to some of the components of vaccines. And so for those reasons, there are people that we don't give a flu shot to. But they're rare and not the majority of people. And I want to make sure that people realize how important it is to get vaccinated, not only with the COVID-19 vaccine when it's available, but also flu shots, pneumonia shots, and that way you protect not only yourself, but others around you.
At this point, with the, in some states, record high infections, who should be testing for antibodies?
Well, antibody testing, Thomas, is a bit of a complex issue. We know for a fact that many of the antibody tests are not all that accurate. And the FDA is really coming down on manufacturers to make sure that these antibody tests are accurate. So that's number one. Number two, we still don't know how long one is protected if they had the virus and developed antibodies. We don't know. So my concern when I order antibody tests on folks is that they get a false sense of security. If they have antibodies, one, is it accurate that they have antibodies? And two, if they have antibodies, are they protected? They cannot go out into the world without a mask and cast caution to the wind. What they need to do is realize that it's helpful, it's epidemiologically helpful, but it may not be a panacea, and it certainly does not change my opinion on people wearing masks and socially distancing, even if they have antibodies.
Do you recommend multiple testing moving forward?
I think, Thomas, there is a role for people who initially may have not tested positive at first. I have done this in my own practice. Perhaps they were tested early on, then they developed symptoms, and then there's a need for another test if that first one was negative. Because remember, it takes a period of time for that virus to be able to be picked up. Now, these are very sensitive tests. These are polymerase chain reaction tests, PCR tests, and they pick up a virus a mile away. But it does still take a little period of time between inoculation and the time that test can be positive.
I know some colleges, universities are recommending their students and staff get tested in the fall at least once a week. Do you agree with that?
I think that that is a brilliant idea, and we need to do testing, especially in our young people who are going off to college, and do it on a frequent basis. I also want to say that if you have any kind of elective procedure, the rules are for most hospitals and states, you will be tested 24 to 48 hours before you have that procedure done, no matter what it is.
Yeah, and some require you to self-isolate as well. As we head into the holiday weekend, Dr. Mike, your daily advice, a reminder on staying safe.
Well, Thomas, we really are seeing huge numbers. And we need to realize, Thomas, that the bottom line is that even though it's a 4th of July holiday weekend, we can't let our guard down. We cannot gather in large groups. We should not do that. We need to wear masks and we need to socially distance ourselves. Those are the critical things.
Thank you for shining a light on that, literally. Dr. Mike Sorigliano with Penn Medicine out of Philadelphia. Great to see you, Dr. Mike. Have a great weekend.
You too, Thomas. Happy 4th of July.
Thank you. Stay well.
All right, everybody, now we will go out to our sister station KTVU as they are talking to a doctor as well.
Hi, everyone. It's Alex Savage from KTVU, Fox 2 News here in the San Francisco Bay Area. And really just in a matter of a few weeks, a lot of school-age children all across the country will potentially be returning to their classrooms, their physical school buildings here, despite the ongoing coronavirus pandemic. Districts all over putting plans in place to get kids back in class. And joining us now to talk more about how this is all going to play out is Dr. Hansa Bhargava, who is a pediatrician and the senior medical director with WebMD. Dr. Bhargava, really good to have you on here to talk about what I know is such an important topic for so many parents here. You talk to a lot of parents. What are the biggest concerns that parents have about how this is all going to look when their kids do return to school?
Well, first of all, thanks for having me here. Yeah, I've been hearing a lot, Alex, about parents' concerns about this, and they are concerned about their kids getting the infection, bringing it home, whether the teachers could be exposed or whether teachers could expose the kids. There are a lot of concerns, especially with the rising numbers of COVID in certain parts of the country.
Okay, so I know that different school districts, and we've heard a lot of school districts here in the Bay Area, rolling out their safety plans to put kids back onto campus, but do it in as safe a way as possible. Some of the keys are obviously going to be trying to have as many students as possible wear masks and trying to have students be as spaced out as you possibly can.
Welcome back, everyone, here on Fox 10 Extra. Now we are taking a listen at, we're listening to a doctor talking all about, what's the future going to hold living in a pandemic world, talking about reopening schools and what a potential school year can even look like. Let's listen right here on News Now.
The American Academy of Pediatrics came out with a statement recently, a couple of days ago, about the need for children to go back to school. And I, as a pediatrician and as a parent, strongly support that. And that is because the kids actually need to learn. And what they've found with online school is that it just didn't work. I mean, kids are not learning for, various reasons. They may not have the computer, or if they had it, the parent needed to work, or, they just were distracted, or, it was really hard for the schools to deliver the education. So kids are behind, and we can't have American children get further and further behind in their education. So that's one of the big reasons. A couple of other reasons is, mental health. Kids, who aren't socializing or in other groups of kids, or even with the teachers in a structured environment, don't have the ability to socialize. And so we're seeing anxiety and depression as well, Alex. And, the third reason I think you probably know is, as a parent, as I do, when you're a parent and you're working, even if you have the privilege of working from home, you don't necessarily have the capacity to also take on teaching when the kids are online. So that's just for people who can work from home. But imagine the parents who actually have to go to work or have essential jobs where they have to be there and live paycheck to paycheck. So for all of those reasons, it really makes sense for the kids to go back to school.
One of the things, and I don't know if you've heard this, but one of the plans that's sort of on the table, it sounds like for some school districts, is to offer an array of options for parents, and it's sort of dependent on the students. So maybe some students are going to come and be back in the classroom 3, 4, maybe even 5 days out of the week. Other students, maybe not as much, sort of depending. And then, of course, you could have the alternating days. How important is it, you think, and you just referred to, again, some of the students whose parents have to be at work, and those students really need to be in that school setting. So you sort of have an array of needs here. And how do you think that school districts are going to balance all of that?
And that's a great question. And I think it's a very difficult task. Look, it's really difficult. A lot of the schools are suffering from not getting enough resources, or they might not, they have different parents' needs to serve, as you're outlining. But I think the schools have been working really hard. And, I myself as a parent got surveys on what I wanted. I know other parents who did as well. Some schools are offering both options, so parents are comfortable. I think the bottom line is that there needs to be a physical option where kids show up in a structured setting. And so I think that most parents, and I would advocate, and I am sending my kids back to school as well, that parents should try to go there. And a couple of the concerns that we talked about earlier, Alex, was that parents are concerned about infection. I just want to point to a couple of studies, actually, that I was really relieved to read about. And that is, like, there's small studies, one's out of Geneva, Switzerland, and the other is from out of China. But essentially, the one out of Geneva, Switzerland showed that, in fact, when kids went to school in Switzerland, the households that got infected, less than 8% were due to the child bringing home the infection. So what does that mean? That means over 90% of those households did not get infected from the child who went to school. And that gives me some confidence. I know it's a small study and we need more research, but that's great in that that's one of our biggest fears, that is this child going to bring home an infection? Is this child going to, and the answer is that kids don't necessarily spread the infection, and when they get it, it's very, very mild. So if that alleviates some concerns, then that would be great for the kids to go and get the benefits when they're not as much as at risk as you and I.
Yeah, and we've certainly heard that across the board, kids have not been impacted in the same way by coronavirus. Obviously, kids tend to not get as seriously ill as adults if they do contract the virus. But does the research show that they're less likely to transmit it to other kids or adults?
Yeah, and that's the good news. Like, these initial small studies, and we'll have more studies, of course, are showing that they're less likely to transmit it, as opposed to what we thought before a few months ago, where we thought that they're going to be asymptomatic and they will spread it. The other area I would point to is also that the CDC reported on, and there was an article recently about childcare centers that remained open for essential healthcare workers.
Right.
And this was over March, April, May in New York. Did you hear about that one, Alex?
I didn't know, but I know that many of them had obviously it stayed open for folks who had to be at work. Yeah. No, I didn't hear what were the results?
Yeah, and so those centers actually were really smart. They did all the precautions, which basically they talked about airplane arms for the 4 and 5-year-olds. They told them to be airplane arms away from other children. They did pods where they had a small group of kids with one teacher, and they only stayed with that one teacher. And of course, hand washing and masks. And what they found was, again, very little risk of infection, very little spread of infection. So that should give us some confidence as parents as well.
Yeah, I think that's probably going to put a lot of parents a little bit more at ease. All right, so you talked about the airplane arms, and that's interesting because it sort of leads me into my next question, which is, it seems like such an incredible challenge to ask, especially the kids on the younger end of the spectrum. The elementary school age kids, asking them to distance from each other and asking them to wear masks. This seems like it's going to be tough to do. How important is it for parents to sort of reinforce that training and create those good habits before we send our kids back into the school setting?
I totally agree that it's hard, but it's not impossible. So here's what I'm doing for myself. And that is, in the lead up to school time, in the next few weeks or the next month and a half, wherever you are in the country, I would suggest that you start the habits now. because parents actually have control over summertime, right? You can teach kids things over the summer that you don't during the school year. So the rules that I have in my house are, you open the front door, the mask goes on. So masks on, and then when you come in, hands washed. The first thing you do is you go to the bathroom and wash your hands. So, you know, if we could just do those two simple things, and then of course, like, kids basically will learn what parents do. Yeah. So if we do go to the grocery store, we do, you know, go to a small group of people and a barbecue, we stay 6 feet away, and we need to demonstrate that as parents to the children, so that by the time school starts, that's ingrained in their heads. It takes 3 weeks to make a habit. If we have 3 weeks to do it, let's do it.
Yeah, well, that means for a lot of folks, you know, you might need to start right now if you haven't been reinforcing the habits, those good habits already. Because yeah, I mean, summer's gonna be over here pretty soon. I'm, you know, already looking at our calendar here at our house, and it's gonna be over soon. So kids they're gonna be back, you know, back on campus, but it doesn't sound like they're gonna be, you know, it's not gonna be necessarily school as normal as it was before. What sort of activities do you think are going to be out?
There's definitely going to be restrictions. It's COVID life. So of course there will be probably imposition of masks, and that's really important. The studies are pointing to that more than ever, that we need to be wearing masks, and they do make a difference. The pods are really important, where there's only small groups and assigned to each teacher. There could be hybrid. Some schools are doing hybrid days where they're asking certain grades to come in on Monday, Wednesday, Friday, and other grades to come in on Tuesday, Thursday. And of course, there's going to be hand sanitizers, and hopefully a push toward, you know, washing your hands a lot and physical distancing. So it's not going to look like before, and activities will be restricted. I mean,
yeah. What about
activities
like sports and what, you know, band? I'm just trying to think of some of the things that you normally would see on a school campus.
I think that I would, if I was to give advice, I would probably stick more to solo sports. So, you know, you can run and physically distance. You could potentially play tennis and physically distance. I wouldn't suggest basketball just yet, because that's an indoor sport with a lot of clustering. So, this is not a guideline. These are just my thoughts. Sure. In terms of social distancing. But yes, I do think
but students should be prepared for the fact that, you know, maybe some of these sports are probably going to be limited in some way. Yeah, and you know, maybe not the same extracurricular activities that you normally would have, unfortunately. Yeah. But the important thing is getting them back into that classroom setting, because, you know, the other issue here, and I know we've talked about it many times during the pandemic, is that there were so many students, you know, it really came to the forefront, but there were so many students who, you know, just lacked access to computers, access to internet, and they were not getting the same level of education as some of their peers during this pandemic, you know, in the online learning model.
Completely agree. Internet is expensive. People may not have devices. So that's the digital divide, what the pediatricians often talk about. And then unfortunately, some kids are also dependent on school meals, and you can't have children hungry. So those are additional benefits in addition to the learning and the socialization for all kids.
All right, so let's wrap up here and talk, you know, a little bit about kind of the what ifs. I mean, it's not the scenario you want to think about, but you know, obviously you can't control everything, and you can't completely stop the spread of this virus. So you are likely to have outbreaks potentially related to a school campus somewhere. How should school districts respond to those? And how ready do you think families should be to kind of pivot from the in-person learning to the online learning once again? We're going to kind of have to be flexible, right?
Absolutely. We need to adapt. This is not normal times. And if there are outbreaks in the school, which could potentially happen, even though we're hopeful that it won't happen, I think the schools may be forced to do online learning for a while. Also, as parents, we need to take responsibility as well. We've talked about this too, that, you know, if your child is sick, don't send them to school. If they have a fever, they don't need to go to school. And that's a rule even before COVID happened, but now especially since COVID-19's happened. So that's really important. And the third way for parents to prepare, and we've talked about this too, Alex, is We've got to get those vaccinations. What we don't want is an additional crisis on top of COVID-19. And that's really going to handicap our nation. So we need to go out there and get our vaccinations. We don't want measles outbreaks on top of COVID infections.
Yeah, it's such a good point. And you, as you say, it's the responsibility of every family to make sure that you're not sending a kid to school who is sick. I mean, we've all done it in the past. You know, you sort of fudge things a little bit, and oh well, he's got a little bit of a cough. He or she has a little bit of a cough. I'm gonna send them to school anyway. This is not the time to mess around with anything. So if you have a sick kid, keep them at home, right?
Yeah, this is about the we. I mean, united we stand, divided we fall. We need to be united and be a community and take our individual responsibility, but also care about the society. So we absolutely have to do that.
All right, but bottom line, Dr. Bhargava, is that you are in favor of getting kids back into classrooms.
The bottom line is school is great for kids, for learning, for mental health, and even for the family, right, where the parents have to work. But also, I will add what we talked about before, and that is let's prepare in the summer. Masks on when they go outside, hands washed when they come back in, and get those vaccinations.
There you go. And teach the good habits now. All right, good. Well, we're
Welcome, everyone, here on Fox 10 Extra and coronavirusnow.com, taking a live look at the beautiful skyline of Chicago. But come Monday, Arizona residents, if we go there, we're going to have to quarantine for 14 days. That's the order being put down by the mayor. That was happening yesterday, and it's going to be in effect starting Monday, July 6th. Not only Arizona, but 14 other states are in this order. To comply with the order, travelers coming from 15 high-risk states can either stay at a single home or other dwelling for 14 days except to seek medical care. Alternatively, they can get tested for COVID-19. Individuals found in violation of the order are subject to fines of $100 to $500 per day. So that would not be the way to start a vacation. Go to Chicago, have to stay in a home for 14 days, or go and get a test. Yeah, it's definitely not going to be a vacation there anytime soon as they have that order in place. But that is just the way that things are going as we see it during this pandemic. I'm your host, Mike Page. Thank you so much for joining us worldwide here today on News Now, July 3rd. It is a Friday, the day before a holiday, July 4th, and a lot of you have the holiday off right now. So if you're just joining us for the first time, what we'd like to do is take you to the events as they're happening, and then also top stories of the day around the country. And while we have that shot of Chicago for you, we're going to keep you in Chicago, and they're going to give us an update. They're also getting a heat wave going on there as well, so they'll be updating on that and also on the latest during the pandemic.
Response plan will be activated when the National Weather Service forecasts the heat index deployment of cooling buses, well-being checks through 311, and more. The city's extreme heat emergency response plan will be activated when the National Weather Service forecasts the heat index to exceed 105 and 110 Fahrenheit for at least 2 consecutive days. We encourage residents to make a special effort to check on your neighbors during extreme heat, especially if they are seniors, families with young children, people with special needs, or living alone. The Chicago Department of Family and Support Services oversees the city's cooling centers, and they have been reconfigured to accommodate physical distancing that enables visitors to stay at least 6 feet apart. Visitors are also required to wear a face covering while in the cooling centers. DFSS will provide free face coverings for guests who do not have one. Cooling centers are activated when the city's emergency response plan is in place or conditions warrant. When activated, cooling centers operate from 9 a.m. to 5 p.m. Monday through Fridays. The following community service centers will serve as cooling centers: Inglewood Center, at 1140 West 79th Street, Garfield Center at 10 South Kedzie, King Center, 4314 South Cottage Grove, North Area Center, 845 West Wilson, South Chicago Center, 8650 South Commercial, and Trina Davila Center, 4312 West North Avenue. Additionally, during heat emergencies, the city will expand citywide cooling spaces by utilizing other city buildings, such as libraries, parks, and city colleges on an as-needed basis. This weekend, the Chicago Department of Family and Support Services will activate its cooling center at Garfield from 9 a.m. to 5 p.m. at 10 South Kedzie Avenue. And on Sunday, July 5th, 14 Chicago Public Library locations will be open from 1 to 5. We urge anyone needing city assistance to call 311 to locate a cooling center near you. Stay cool, stay connected. Anyone can register for Notify Chicago, the city's extreme weather notification system, to receive alerts and warnings, as well as updates on conditions via text and email. To receive emergency alerts this weekend and throughout the summer, subscribe to notifychicago.org. Again, OEMC will continue to monitor weather conditions and is prepared to activate plans and alert the public should a situation warrant. Thank you. Now I'd like to bring up Superintendent Mike Kelly of the Chicago Park District. Mike.
Thank you, Rich. I'll be quick. Some real quick rules of the road. I want everybody to have a safe and happy 4th of July weekend. Please use your parks. The parks are open. Get out and use them. But if you're going to be out, wear a mask. They work. Don't use our parks this weekend for your personal fireworks show. Keep the fireworks off the artificial turf fields. Keep them out of the parks. And lastly, if you are going to barbecue, do not dump your coals on the base of the trees. The lakefront's open. I want to remind everyone, the lakefront is open. If you're going to be out on the lakefront, keep moving. Again, wear a mask. Stay off the beaches. The beaches are still closed, which also means stay out of the water. Keep yourself safe. Keep our lifeguards safe. I want to give a shout out to all our first responders this weekend, and I actually want to give a shout out to my mom, Kathy Kelly. We love you, Mom. She retired today, 50 years as a nurse. So with that, I will now turn it over to Dr. Arwady.
Thanks, Mike. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. So first, related to taking care when heat is coming. We always want to remind residents to take care of themselves, but also to think of others, particularly if there are people who are older or people who have underlying medical conditions. If it gets hot, it's the time to check on them and make sure that they have a plan for cooling. Similarly, we've already been encouraging people to keep those same folks in mind related to COVID. Don't underestimate the risks of heat and humidity. They are dangerous, and in some cases, they can be deadly. The best way to protect yourself against extreme heat is to drink plenty of water and to stay in air-conditioned buildings, or at least take a break in an air-conditioned building as much as possible. If you do not have access to air conditioning, call 311, and as you heard, there are resources in place for you. Do not rely on a fan for trying to keep cool. Taking a cool bath or shower is a safer and more effective way to stay cool. Drink plenty of fluids, even if you don't feel thirsty, but avoid sugary and alcoholic beverages, as those in fact can lead to further dehydration. Schedule your workouts and your outdoor activities early in the day or late in the day. Wear loose, lightweight colored clothing, wear sunscreen, and again, check on older or otherwise vulnerable neighbors and never leave children or pets in cars. That's true all the time, but especially in warm weather. It can be deadly quickly for both children and pets. While everyone can be at risk of heat-related illness, those who are most vulnerable are the ones we particularly want to check on. If you can't get a hold of someone, you can always call 311 and ask for a well-being check from the city, again, to ensure people at highest risk are safe. I want to tell people quickly about the signs of heat stroke or heat exhaustion. Heat exhaustion is a milder form of heat-related illness. It can develop after several days, typically, of exposure to high temperatures, and when people are not getting enough fluids. Telltale signs of a heat stroke are when someone has a very high temperature, like 103 degrees Fahrenheit or higher. If someone is having dizziness or nausea or confusion, a throbbing headache, a pulse that is rapid and strong, skin that is red, hot, or dry, or just if you're concerned about everyone, that is an emergency and would be a reason to make sure that someone gets urgent medical care. Calling 911 would be appropriate for someone who you're concerned about a heat stroke for. But our goal, of course, is to avoid that. And so please pay attention when it is especially warm, do the things that help keep us all safe, and remember to look out for each other. Working together, we'll be able to stay as safe as possible when we have warm weather this July. I do want to echo again that in the time of COVID, we all have to look out for each other. And I do want to take a quick moment to mention the travel advisory that was put in place yesterday evening. So as people have seen, we issued an emergency travel order that directed travelers who are entering or returning to Chicago from states that were experiencing a surge in new COVID cases to quarantine for a period of 14 days. That means that if you are a Chicago resident and you travel to one of these states, when you return, you need to stay home for 14 days. Or if you have someone visiting from one of those states and they come to visit, they need to stay also in the home or the hotel or the dwelling where they are for 14 days. That, of course, is because they've been in a setting where there is an increased risk for COVID-19 transmission, and we want to limit the exposure here in Chicago. This order does take effect on Monday, and the states that are currently included are Alabama, Arkansas, Arizona, California, Florida, Georgia, Idaho, Louisiana, Mississippi, North Carolina, Nevada, South Carolina, Tennessee, Texas, and Utah. Violators are subject to fines of between $100 and $500 per day, so that would be up to a maximum of $7,000. But we really are asking people primarily to do the right thing here. The limit that we've set for states going onto this list is the equivalent of having 15 new cases per 100,000 population per day. I know that calculation doesn't sound like it means too much when we put it like that, but it means these are states that are seeing new cases of COVID at the rate that we were seeing here in Chicago and Illinois back when we were under our stay-at-home order. They're equivalent to what our numbers look like in late May. These states have concerning and increasing rates of COVID, and they are not under stay-at-home orders. We will be looking at the data every week. We'll be updating the state list starting on Tuesday. We'll update it every Tuesday starting the 14th. And as states are able to get their outbreak under control, they will come off that list. If other states really start to have additional problems with COVID and it is not in good control, they will go on to that list. So we recognize that this is a burden on people who were planning to take a vacation, for example, or people who were expecting to have people come to visit from these affected states. But we have come too far in Chicago at this point not to do the things that are open to us that help prevent the spread of COVID. We're not saying that people are not allowed to travel, but that when they return, they have to quarantine for the 14 days. When I think back to early May, we were seeing more than 1,000 new cases per day just here in Chicago. Consistently now, we're seeing well under 200 new cases per day and declining. Before, we were seeing more than 50 deaths per day in Chicago residents. Today, we're at about 8 Chicago residents per day still dying from COVID. We are not done with COVID here, but where we've seen stabilization and decline in our cases, in our percent positivity, in our hospitalizations, our ICU admissions, and our deaths, We cannot risk going backwards. The most important thing that we do as a city and as a state to safeguard our progress are the individual decisions that every one of you makes every day. The decision of whether to wear a face covering, the decision of whether to keep that 6-foot distance whenever you're able to, the decision to avoid crowds and close contact with people, especially people you do not know, the decision to protect the people who are at the most severe risk of severe outcome. That would be people, again, who are over 60 and with those underlying medical conditions. And finally, the decision to stay home if you are even a little bit sick. These are the things that have gotten us this far. The fact that Chicago has been doing a good job, by and large, of the science-based, evidence-based protections against COVID is why our outbreak looks like it does right now. I do want to wish everyone a happy 4th of July, but I ask you not to go against the science-based guidelines. Celebrate, but celebrate with people in your households or people who are already in close contact. Have those celebrations outside. Keep the face masks in place. Avoid large crowds and large gatherings. The virus does not care why it has had an opportunity to spread. If it has an opportunity to spread because people have come from a state where the virus is not in good control, it will spread here in Chicago. Even if you're gathering for a wonderful family celebration, if you give the virus opportunities to spread, it will. We want to be able to move forward here in Chicago with loosening restrictions, and we will do that as the data allows. But if we don't do everything that we can to help protect the progress that we have already made, we won't be able to do that. So with that, I again wish you a happy 4th of July. Please be safe in all of the ways that you can. Protect yourself from the heat, protect yourself and all of Chicago from further spread of COVID. Thank you. And we'll take questions.
Thank you, Doctor. Any questions? Yeah.
It's for the travel order. I know you mentioned the states, but what about other countries like Mexico or other Latin American countries that are showing high numbers, or any other country that's showing high numbers?
Yes, so the order only applies domestically to states here. It does not include any international travel. We defer to the Centers for Disease Control and Prevention, the CDC, on that. However, I will let you know that, for example, when international travelers are arriving at O'Hare, they are currently being given guidance to self-quarantine for 14 days as well. But the city of Chicago does not control that. That is a federal level decision.
And just to follow up with that, how do you plan on implementing or tracking who it is? Is there a way to track who is coming from those states or not, or how would that be implemented?
Yeah, great question. So we do not have a plan to, for example, look for out-of-state license plates and pull people over. We do not have a plan to create a list of individuals who are traveling and try to track them down. Our goal is, first of all, to get this message out strongly. That's really the most important thing. We want people to be thinking twice about whether now is a good time to travel and to recognize that if they make that decision to travel, there is an expectation for quarantine on this side. We'll be putting out information, for example, over highways for people who are traveling by road. There will be signage at the airports. There will be flyers that will be handed out. And we've been working with the airlines to make sure that when people are booking tickets with a Chicago destination, they actually would receive that information right up front, again, to help discourage unnecessary travel. There are exceptions in this order, a number of exceptions, especially for essential work. And otherwise medical travel or other reasons. But the ask has been that if people need to travel for that essential work, that they limit their activities in Chicago to those work-related activities or things that are directly related to work and otherwise not participate in other activities. So we've tried to balance here the ability to keep the really essential things going, but send a strong message to individuals and to businesses that unless there is an essential need to travel, now is not the time to do it to the states where outbreaks are not in control.
already Kate Covier from ABC7. I've got follow-up questions on that emergency travel order. What about for people who live in the suburbs, people who don't live in the city but work in the city and they have traveled to those locations? Will those same people be subject to the 14-day quarantine?
Yes, so people who regularly work in the city, like on a daily commuting basis, can continue to work as they would. I will say, though, that if the travel, and some of this will be a little bit dependent on whether their travel was for work or for pleasure. If the travel was not work-related and it's not an essential work travel, then they actually would be officially subject to it. But otherwise, the goal is not to stop people from being able to continue their essential work. The requirement would be that their activities in the city would again just be limited to those essential work-related activities.
And questions from my colleagues at NBC. What if you've already left for the holiday weekend and just found out about this emergency travel order?
Yes, so one of the reasons why this order is going in place on Monday is that we recognize that a lot of people do travel for the weekend. So someone who has traveled this weekend and is returning, on Sunday, for example, this would not apply. It goes into place on Monday. I would ask, though, that if there are people from Chicago who have traveled over, over this weekend, for example, to these states of high concern, that they pay special attention. I can't order a quarantine, but really as much as possible to be aware that they've been in places of high concern, to not have close contact, particularly with people who are high risk, and to, for the next 14 days, pay special attention to their health, seek testing if they were to develop any symptoms, and otherwise, wear the face coverings and keep the 6-foot distance.
Another one from Lexi Sear at NBC. People are allowed to gather with larger groups in this phase, given the spikes elsewhere and the current circumstances surrounding the virus. Do you advise people to err on the side of caution and play it safe? What advice do you have?
Yes, so we've thought a lot and really looked at the science when we've made those gathering size recommendations. For example, with the amount of COVID that we still have here in Chicago, a gathering size of 50 people, there's still about a 15% chance, a 1 in 6 chance that someone at that gathering has COVID-19 and does not know it. It's part of why we've set that limit where we have. As we have, hopefully in the future, even less COVID here, that's when we'll be able to expand those numbers and, for example, have gathering sizes of 100 or 250, as we make progress. But my recommendation always would be that if you can avoid a large gathering, particularly if either you or someone in your close circle is over 60, has an underlying medical condition, if you don't need to participate in a large gathering, my preference would be that you don't. And if you do, face coverings, try to keep your distance. Those things work. Those things are how we dropped our risk here by 95% when you look back to where we were at the peak. It's those individual level decisions that make the difference. So think first, am I at risk? Is anyone in my close circle at risk? And then secondly, the activity. What are the risk factors that are associated with activity? And then make the decision for yourself.
And this might be related. This one's from my colleagues at ABC7. Block party permits, those started being issued yesterday for Chicago. What is the thinking about permitting those large gatherings, and are there size limitations?
So outdoor gatherings in Chicago are limited to 100 people at the moment. So indoor is limited to 50, outdoor is limited to 100. Again, that's because we recognize that out of doors is lower risk than indoors, but not entirely without risk. And so I know where we've been looking at permits, there's been a lot of conversation about how to overlay the COVID-19 guidelines with that.
Any concerns issuing those already at all?
I think that, I'm always mindful that COVID-19 is part of the larger ecosystem of issues that we need to address and think about here in Chicago. And so I know, for example, that where there have been goals of bringing together in a positive way groups that are working against violence, for example, that is a very valid reason to be bringing attention and bringing together, neighborhood groups around that. I think as long as we're able to adhere to the COVID-19 violations that help keep us safe, I am in support of those kinds of gatherings.
And I've got one more question from Ben at CBS2. CBS2 continues to get photos from viewers showing people gathering on Northside beaches. This might actually be for Mike. Why is this allowed since they are closed, and how will this be monitored this holiday weekend?
So the question was, why are we allowing gatherings on Northside beaches? We're not. If you went up and down the lakefront just this morning, you would see social distancing ambassadors in blue shirts politely asking people to leave. They're police officers up and down the lakefront. Our lifeguards are out there. And that goes back to what I was saying in the beginning, which is, look, we're all in this together in Chicago, and we need all of us to participate. We certainly don't want to get in a situation where arresting people or writing tickets or any confrontation whatsoever. We're asking people to use their heads, wear their masks. If you're on the lakefront, keep moving, but don't go in the water. Remember, you're putting yourself at risk on these beaches, and you're putting lifeguards, young men and women that are our first responders, at risk if they've got to turn their back from being an ambassador and fish out of the water. So please, I know it's frustrating. It's 4th of July weekend. It's hot. But stay off the beaches. Stay out of the water. If you're going to use the trail, keep moving and wear a mask. I mean, Dr. Arwady and the mayor have been clear on this, and their leadership got us this far. Let's stay above the curve. Let's keep it flat. Let's not get sick. It really is that simple.
Thank you.
Thanks.
All right, have a safe weekend, everybody. Thank you.
Good sport.
Yep. That includes cooling.
Pandemic, our work to reposition our state's economic future to one driven by cutting-edge companies has not wavered. And Sunray is just one of numerous examples of high-tech firms looking to call New Jersey home because of the entrepreneurial ecosystem we are creating here. These are the businesses which we are, as I mentioned, are perfectly located and positioned to attract and keep. And now we're a place where they can find the backup they need to keep capital coming in, so they don't just survive, but in fact, they ultimately thrive. So to you, Tim, and your incredible team at the EDA, from Chairman Kevin Quinn and other members of the board right on down, I thank you for your continued work to support our economy and our small businesses throughout this unprecedented time. And I am confident that the payoff of these investments will come in a state economy that is stronger and more resilient. Next, this morning, the Department of Labor released its weekly unemployment figures. The department received just shy of 28,000 initial claims last week, which is a decrease of roughly 5,000 from the week prior. Overall, more than 1.3 million claims have been filed with the department over the course of the past 3.5 months. It's unfathomable. This is, in a word, unprecedented. However, through the hard work of the department, 96% of all who have been deemed monetarily eligible have received a payment, at least a payment. All in all, the department has been able to put $9.1 billion into the accounts of New Jersey's families, including $612 million in federal relief of self-employed and gig economy New Jerseyans who would have not qualified for unemployment.
Welcome back, everyone, here worldwide on coronavirusnow.com, taking a live listen right here in New Jersey.
Their prior eligibility. The department has also extended benefits by an additional 20 weeks, which is music to the ears of many. As Commissioner Rob Acero-Angelo would want me to note, many of the remaining unresolved cases can be traced to very specific, complex, and individualized issues, including delays in the department receiving federally required records from other states, or because a claimant is waiting a determination on an appeal. But the department continues its work to ensure that every New Jerseyan who is eligible for benefits gets every penny which they deserve. As always, I thank Commissioner Acero-Angelo and his team, especially the women and men on the front lines who have been working hard every day to get answers, for everything they are doing to support our deserving workers and their families in this time of extraordinary need. I did not welcome, but should welcome, Jared Maples, the Director of the Office of Homeland Security and Preparedness. Switching gears yet again, we want to give you a quick update on the work of the Rutgers School of Public Health in leading our efforts to build up our contact tracing program, which we discussed at length last week. I mentioned Judy yesterday. It was Lamont Repillette's last day as the Commissioner of Education. He'll now be president of Keene University, but I should have added that yesterday was the first day of Dr. Jonathan Holloway's tenure as president of Rutgers University. We wish Jonathan nothing but the very best in his years at the helm of an extraordinary American university. So over the past week, the work to onboard more contact tracers for training has continued. Today, the Community Contact Tracing Corps has increased to 357. That's more than 130 additional contact tracers added since we last spoke last week on this. Additionally, Rutgers School of Public Health has invited 859 current local public health workers to be trained on the ComCare reporting system, with more than 600 of those now having completed their training. That 859 is the approximately 900 contact tracers that Judy and I have been referring to that are at the local, county and local levels that have been on the field battling on our behalf, and hats off to them, as well as to the new signees. What this means is we are continually building and training the statewide team of diverse public health workers we will need to help us prevent new cases from becoming flare-ups that can threaten our recovery. As Judy and Ed and Pat and I have spoken many times, the objective with the capacity we now have in testing, as good as any American state per capita, the objective of the contact tracing community core, the objective of the isolation rooms and plans that Judy referred to the other day, is not that we expect that the virus won't come back. We, in fact, expect it will. The question is, what are you going to do about it? And the fact of the matter is, with the testing, tracing, and isolation trinity that we have in place right now, the expectation is we can spot it, surround it, isolate it, and drive it back into the ground. Those are assets we literally did not have at our disposal, other than some contact tracing at the local and county level. We did not have when this crisis started back when we first formed the commission that you still chair on February 2nd. Those were assets we did not have. We now have them. And we hope that that is a huge boost in confidence for folks to be able to get back out there and engage in society and economy. Before I get switching gears again, before I get to the overnight numbers, I want to give a brief update on New Jersey's response rate to the 2020 census. As we've noted weekly, the census is absolutely critical to ensuring that New Jersey receives its fair share of federal funding from Washington for a whole host of programs, from education and transportation to social services and COVID-19 relief. And we were completely dramatically undercounted 10 years ago. We cannot let that happen again. Having a complete and accurate count is vital for our future. Everyone has a civic duty to be counted. New Jersey continues to exceed the national response rate, and that's the good news. And 63.8% of you have already taken the time to go to 2020census.gov to be counted, and I thank you. But that means that nearly 1/3 of New Jersey households still need to be counted. Our census team at the Department of State is continuing its community-based information efforts in advance of the Census Bureau's initiation of door-to-door canvassing of those households which do not respond online in advance. In other words, if you get counted online today, you won't get a knock on the door in the weeks ahead. And we need more households, especially in Atlantic County, Essex County, and Hudson County, to be counted. And I want to give a shout out again to a point I've made on a number of occasions. In Cape May County, we know the response rate is being skewed because a lot of the homes which haven't yet responded are summer homes. And these property owners have likely already responded from their primary homes. So if you own a second home in Cape May, bless you, we thank you for that. But if you're planning on getting down there this weekend, before you do, go to 2020census.gov and register that home as a seasonal home. Then we'll have a better idea of how many year-round Cape May residents have responded to the census. Let's make sure, folks, we have an accurate count. The census only happens, as I mentioned, once every 10 years. And if we are undercounted again, as we were, as I mentioned, in 2010, we will lose out not just for the next year, but for the next decade. Let's make sure we don't miss out on the ability to craft a better future for our state. So with all of that to the side, let's turn to the overnight numbers. Yesterday, we received another 539 positive test results for a cumulative total of 172,356. The daily spot positivity rate was 2.95% for tests recorded on June 28. The rate of transmission was 0.87. Again, RT, rate of transmission, as you see in the daily spot positivity rate, give us our best picture of how COVID-19 continues to spread, and alongside new hospitalizations are the most important non-hospital metrics we look at when making decisions for when we can enter the next stages along our road back. If you stay here for a second, I would just say this. We have said, Ed has said it, Judy said it, I've said it, Tina Tan has said it. Just because you get a little bit more one day to the next or a little reduction one day to the next, that's not a trend. But it is worth noting. We have more daily positives today. The spot positivity is up slightly. The rate of transmission is up slightly, and that's something that we're going to keep a close eye on. Looking to our hospitals, the total number of residents hospitalized for COVID-19 yesterday was 1,027. The number of patients requiring intensive or critical care was 216. The number of ventilators in use was 170. Now, all three of those numbers are down from Tuesday. So let's also keep that in mind. There were 51 patients who are known COVID positive admitted to our hospitals, while 83 live patients were discharged. Here are how these overall, or these daily numbers rather, feed into the overall trends. But even though we have lots of positive data to see, we know we still have challenges ahead. We need to improve our standing among all states. We need to keep pushing ourselves down on these rankings. Today we are reporting with the heaviest of hearts an additional 27 confirmed COVID-19 deaths, and that total is now 13,251 confirmed fatalities from our New Jersey family. The number of probable deaths that Ed went through the other day remains unchanged at 1,854. As we do every day, let's remember three more of the New Jerseyans who we lost. We'll start in North Bergen, a great community in Hudson County. And that was the home of Mary Klesch. You can see Mary there. She was born in Vineland in Cumberland County, and her early life eventually took her to Hazleton, Pennsylvania, where she met the young man who would be her husband for the past 55 years, Joseph. The couple moved first to Pennsauken before eventually settling in North Bergen. Mary was a bookkeeper and administrative assistant at the corporate offices of the Western Union Telegraph Company in both Philadelphia and then in New York City. But she will be better remembered as a loving mother and homemaker, a woman who cared for animals, who was not only smart, but could make people laugh, and the one person who always remembered everyone's birthdays and anniversaries. She was also a dedicated and active member of Trinity Lutheran Church in Fairview. Mary leaves her husband, Joseph, who I mentioned, and their son, Kevin, and I had the great honor of speaking with both of them yesterday, bless them both, and Kevin's wife, Amber, and their son, Mary's grandson, Ian. Mary also leaves behind her sister, Joyce. Mary was 85 years old. May God bless and watch over you and your family. Next, we recall Gaspar Madrazo of Hillsborough in Somerset County. He was a veteran, a member of the United States Navy from 1978 through 1981, and he earned an Expeditionary Medal for his service. After his military service concluded, Gaspar found his next calling in law, starting as a patrol officer, eventually being promoted to detective, and again later to criminal investigator before retiring in 2006. Gaspar made the most of his retirement, spending time with his children and doing as much hunting, fishing, and camping as he possibly could. He will be remembered for his warmth and willingness to lend a hand to whoever needed it. Gaspar leaves behind his wife of 23 years, Anne, who grew up in Da Nang in Vietnam, and whose family is still in Da Nang, and their three young daughters, Vi, Gia, and Tiffany, and they are 21, 19, and 16, respectively. He is also survived by his older sister, Nancy, brother, Artie, and sister-in-law, Maggie, and 4 nieces and nephews. And Gaspar, for that extraordinary life he lived, was only 60 years old. We thank Gaspar for his service to our nation and to his community, and may God watch over his soul and his family. Finally, we remember Milicio Morales of Gloucester City. A native of Mexico, Milicio came to the United States 22 years ago at the age of 39. for the same reason that so many others have come here, to find better opportunities to provide for his family and to live out his American dream. Malicio was a hard worker and found his calling in the restaurant business, working in Westmont Bagel in Haddon Township, Seasons 52, and other establishments. He is survived by his wife of 42 years, Maria Isabella, and their 6 children, Elizabeth, Alfredo, Daisy, Leslie, Eric, and Kenya. He also leaves behind his younger siblings, Julian, Alejandro, with whom I had the great honor of speaking yesterday, Roberto, and Nicholas. He came here for a better life and found it, and COVID-19 took him away. And his story, by the way, before we leave this, is extraordinary. I asked his brother how his wife, Maria Isabella, was doing, and he said, and this is the life that too many families right now are forced to live, and it's not who we are as a nation. And it pained me deeply. I asked him how his wife was doing, and he said, his brother said, not well. She hadn't seen him in 23 years. And I thought for a minute, well, maybe they weren't together anymore. They were together. He moved to New Jersey to make money to educate his 6 kids. But he was neither ever able to get back to Mexico, and his wife and kids were never able to come to see him in New Jersey. That is not the America who we are. That is not the American values that are inscribed at the base of the Statue of Liberty. We are the immigrant nation, and that is an extraordinary tragedy. So with that, may God bless Mary, Gaspar, and Malicio and their families. For each of the past 90 days, our flags have been at half-staff for every New Jerseyan we have lost to COVID-19. As a sign of respect to them and of solidarity with the families, friends, and communities they leave behind and have left a little bit emptier. Tomorrow, as we begin our commemorations of our nation's birth, and as a sign of rebirth for our state, as we keep moving down our road back, our flags will return to full staff. But even as we do this, we must be mindful of the fact that more residents are going to be lost to this pandemic. This is not a moment of closure. This is not a moment of triumph. This is an acknowledgement that the time is right. We still don't know the final number or when this virus will stop taking away members of our extraordinary New Jersey family, but we do know this: regardless of our flag's positions on our flagpole, we are fighting this virus together, all 9 million of us, and you've been extraordinary. We will keep fighting until every indicator we track reads 0, and we will dedicate our efforts to every life that has been lost and sadly will be lost. In addition to the order returning our flags to full staff, today I'm also signing 2 other executive orders. The first order raises the limit, and we've signaled this, on crowd size for outdoor gatherings to 500 from its current 250, and that is effective tomorrow. We first signaled this eventuality back on June 9th, and we are comfortable at this time to keep to the timetable we set. So on Monday, when outdoor graduation ceremonies are slated to begin and games to be played, schools will be able to accommodate them. First Amendment protected activities such as political or religious gatherings will continue to have no limits outdoors, and our limits on all indoor gatherings are 25% of capacity, but with a maximum of 100 people. That remains unchanged. Additionally and separately, I have extended the public health emergency in our state for an additional 30 days. These declarations, unless extended, expire after 30 days. What today's action means is that we will have the authority to remain vigilant and prepared to act should there be a new outbreak, please God, no, of COVID-19. And we continue to work vigilantly to protect against exactly that happening. But we can't do this all by ourselves. You've been extraordinary, and we continue to need all 9 million of you to continue working right alongside of us. So as you get out this weekend, have an enjoyable time, but use common sense and remember that we are all responsible for beating this virus. Keep your social distances, wear a face covering, wash your hands frequently with soap and water. We haven't said this in a while, Judy, for at least 20 seconds, or use hand sanitizer with at least 60% alcohol if you're not near a sink or running water. And please be safe. Pat, I know we'll talk to this in a minute. Jared is here. Safety and security of each of our 9 million member family is paramount. If you're going to be at an outdoor bar or an outdoor restaurant, where I was again last night and had a really exceptional meal with family or friends, remember that we cannot let our guards down. Don't crowd around bars and keep your face covering on unless you are eating or drinking. And if you feel uncomfortable at an establishment because of overcrowding, leave. We cannot have an overcrowded bar turn into a COVID-19 tinderbox. We have to do this. We have to keep up with the practices that have gotten us this far in the past 3.5 months. We are, in fact, right now a model for the nation on how to responsibly restart. Let's keep it that way. As the woman on my right, who needs no introduction, would say, stay safe and stay healthy. Let's have a good weekend. And with that, may I turn the program over to the guy on my left side, the extraordinary Chief Executive Officer of the Economic Development Authority, Tim Sullivan.
Well, thank you, Governor. It's great to be here again, and great to be here with you, Colonel and Commissioner. I just wanted to provide a quick update, as the Governor described, on the economic relief efforts that have been underway since this pandemic broke out in March. The Governor's directed us and given us strong encouragement to be leaning into supporting our smallest businesses that were the least prepared and the least well capitalized heading into this crisis, and we've been working around the clock to deliver on that. Since the packages of aid have been released, we've supported nearly 7,000 businesses, 6,700 businesses as we sit here right now, through our variety of our programs, more than $25 million of funding deployed and out the door. We expect to, in the next couple of weeks, have that 7,000 number go up by about another 10 or maybe 12,000 as we continue to roll through the Phase 2 grant program, which I'm also happy to provide an update on. The Governor mentioned June 9th, which I was here that day as well to describe the application process. Under Phase 2 of our grant program, we've now awarded about 3,300 grants for a little more than $11 million of that $45 million that was allocated. You can see that on the slide here, 11.9 million, in fact. We focused really aggressively on making sure that these grants were made available for businesses that are historically left out of small business programs, minority-owned firms, women-owned firms, businesses that are located in high poverty, high unemployment, low-income census tracts. Of the 3,300 or so that have been approved already, more than 22% are minority-owned, more than 25% are women-owned. Of the applicants that we expect to be able to fund, about 38% are located in Opportunity Zone eligible census tracts. So obviously more work to be done, more to go here, but through the initial phase here of the 11.9 that we've gotten out the door in the last couple weeks, really good, I think, progress towards a more equitable and fair recovery. Just one PSA on this: 3 counties are partnering with us to add additional funding beyond the money that the Governor allocated for the entire state. So Essex, Ocean, and Passaic counties each contributed $10 million to support businesses in their counties that we're essentially administering on their behalf. Applications for those 3 counties are still open through next week, through July 8th. So if you are a small business under 25 employees located in Essex, Ocean, or Passaic, those programs are not oversubscribed, and you should fill out an application if you need funding at cv.business.nj.gov. 2 other quick announcements. One of the things we've heard loud and clear through the Restart and Recovery Advisory Council that I've got the honor of co-chairing with Zacchaeus Smith-Ellis and Jose Lozano and the commission that the Governor convened is that small businesses need technical assistance and resources, particularly around e-commerce, to support their reopening. These are your sort of prototypical mom and pop operations that maybe never got around to building a website or never figured out how to do electronic scheduling for their workers or do web booking for appointments at a barbershop or a nail salon, and that was okay pre-COVID, but now in an era of limited capacity and more need to rely on technology, we're going to be launching a program to provide direct support to those businesses. They'll help you build a website, help you set up your online shop, e-commerce platform, help you figure out a delivery technology platform. And so we'll have some more details on that in the next week or 2, but we're going to basically launch a pilot program, kind of work out the kinks and see what works, and then scale that up and hope to support thousands of businesses get the technical assistance they need. Last thing I'll mention, both chambers Congress passed an extension of the PPP program that the SBA is running. There's a little bit more than $100 billion with a B of funding left in that program. I don't know that it's been signed yet, but it passed both chambers of Congress. New Jersey businesses have received a little more than $21 billion of.
All right, everybody, we are going to transition, take you to a live event right now, back out to Chicago, where they are talking, Chicago police talking about 4th of July, really staffing for the police and really talking about this holiday during the pandemic.
This is one of several visits myself and members of the command staff will make throughout the 4th of July weekend. This includes roll calls as well as several community events we all will be attending over the weekend. Officers will seize more guns and take down criminal networks. CPD will serve the community, showing humility, our humanity, and respect. I'll take questions. Sure. I've been repeatedly saying that we'll have an additional 1,200 officers each day, starting yesterday, Friday, Saturday, and Sunday. So we'll have an additional 1,200 officers each day over the 4th of July weekend. Those officers would be deployed around our hotspots where we've had obviously recent violence over the last 2 weekends, but also historical violence based on last 4th of July, including Lakeshore, Michigan Avenue, and all of our violent crime hotspots throughout our city.
The flooding of officers that's been done in the past, how is this going to be different this year from things that you've done in the past? Is there a greater push for this community interaction as you mentioned? What's going to be different?
One of the things that I'm very cognizant of is the good things we've done in the past. So we'll be repeating the good things we've done in the past that yield positive outcomes. But in addition to what we've done in the past that worked, we're adding another layer of deployment using our SDSC rooms. That's our technology that's connected to all of our cameras. And we recently added an additional SDSC room in our 1st district that will be monitoring several other areas that before the last couple of weeks we weren't able to monitor. And we will deploy our resources real time based on that technology. That is a new feature. Another layer of this deployment will be, we've drilled down our deployment areas down to the beat. And we've taken a strong stance on the long swaths of geography that have had recent violence, focusing on not just gang, guns, and drugs, but the criminal networks that have been driving violence these last 2 weekends, really fighting over the drug trade and drug turf amongst each other, including gang conflicts. That's a different feature, the way we drill down to the beat level and have those beats with dedicated officers who will be there throughout the night into the early mornings.
And you said earlier this week that you were going to be scooping up young people off the corners. Have you changed the approach on that because of the outcry and criticism that?
Sure. So I didn't say that. And there was just one reporter that took that, and then the other reporters repeated it without vetting what I actually said.
So can you clarify?
For the third time, I don't mind clarifying for the third time, and I've said this in my recent comments today, and no disrespect to you at all. I hope you don't take it personal. But what I did say is that these young people on the corners are being used by criminal network masterminds, these mid-level and upper-level drug dealers who use these young people, and that we don't, I repeat, don't want to go after these young people. Someone missed the don't in this story. Instead, we want to aggressively go after the masterminds behind the drug trade, the mid-level and upper-level criminals who put these young people out on these corners to sell drugs for little or no compensation. These kids are just basically being manipulated because they're poor by these masterminds. And so we have said repeatedly, and we don't mind saying it over and over again until it sinks in, we are going after aggressively the mid-level and upper-level criminal networks that use young people on these drug corners.
There's been a lot of community activists trying to make sure that this weekend, preventing and stopping the gun violence. What do you want the public to know as they're out and about this weekend?
One of the things that's really important, the mayor and I have been emphasizing, it's an all hands on deck. The police cannot do it alone, and we embrace community activists coming on board, helping us tamp down the violence. We think it's really important for all of our communities in this city to be on board with ensuring if they see something suspicious, report it early. Don't wait till things get violent to start calling and letting us know as police to be engaged on particular neighborhoods so that we can keep it from becoming violent. I will emphasize this on this question. The best ways to reduce violence is to prevent it from happening in the first place. And that means engaging our young people to make better decisions, to steer clear of the drug corners, to steer clear of gang activities so that they won't become victims of the violence we've seen the last couple of weekends. Any other questions?
And just with the...
You don't mind, you've asked 5.
Is there anyone else here?
You haven't given them a chance, so let me give them a chance to ask. Anyone else? And if they don't have one, I'll come back to you. Anyone else have a question?
Somebody can talk in Spanish?
Yes, definitely. Thank you. You want it now? You want it now?
After this question.
Sure.
I just had one additional question about
Sure.
COVID-19 and the message that you want to send to residents about being safe in this amid the pandemic.
Sure. As you know, we're following the guidance of Dr. Arwady. Wear your mask, social distance. Please wash your hands on a regular basis. And as much as you can, don't congregate in large crowds. You know, the beaches are closed, but we understand people want to get out and about in the parks, but we're just asking repetitively so that we can save lives. Wear masks, wash your hands, and don't congregate in large crowds.
Will you be targeting large gatherings?
We will be targeting criminal networks that are the pipelines to violence in this city over this 4th of July weekend.
Thank you very much.
Thank you very much. I appreciate it. Did we want it in Spanish? Yeah. Right behind you.
Sergeant Vega will do that.
Great.
Okay, that was the update there in Chicago, everyone. Let's go back out to New Jersey. Just showing you some fireworks there from previous years that we will not be seeing this year. Welcome back, everyone, here to Fox 10 Extra. Just a little moments left here with you. This is from last year at Tempe Town Lake, the fireworks celebration for 4th of July. Obviously, we will not see it this year at Tempe Town Lake, and so many communities across the country will not be seeing their annual fireworks celebration because of the pandemic that is continuing to sweep our country. And here in Arizona, cases continuing to surge. We saw today's numbers at 4,400 cases in a day, and it looks like by Monday we'll have over 100,000 cases in Arizona. Here's a live look right now at the White House. President Trump will be leaving in about an hour from the White House. He'll be heading to Mount Rushmore, South Dakota, where he will be taking in a fireworks celebration out there with the First Lady. We'll have it for you on coronavirusnow.com in its entirety. It's supposed to happen around 5 o'clock Arizona time. You're not going to want to miss that, as it will be a big celebration out there. That's going to do it for us today here on Fox 10 Extra, but continue to join us live on coronavirusnow.com. You get the News Now experience that continues with live updates as they happen, with news updates around the country as well. So you can see the live look at New York City, much different this 4th of July than what we've seen in previous years. Not too much going on during this pandemic that sweeps our country. Be safe and have a great day, everyone, here in Arizona. The News Now experiences continues on coronavirusnow.com.
All right, everybody, good afternoon. Thank you so much for watching News Now. For most people, it's already the holiday weekend. For some people, it's Friday, and for other people like me, it's Monday. That's right, Pilar Arias here, going to say hello. And happy Independence Day weekend, happy 4th of July weekend. Fixing my hair, you know me, you guys can probably hear it. It's been so long since I've been on the stream that, you know, I got to make sure that the hair and makeup's right. Hey guys, I hope you all are doing well. I do have my red, it's kind of hard to see, white and blue on for the Independence Day weekend. I was not voted most spirited in high school for no reason. So I hope you all are having a great day, great holiday so far. Here's a live look at New York, the Manhattan skyline. It's absolutely positively gorgeous. I'm having a couple little set issues here, so I'm going to try to fix it really quickly. And then I got some updates from across the country to go for you, both coronavirus related and the holiday related, to make sure that we keep you up to speed with everything that's going on. Meanwhile, though, I am going to show you our South Mountain Tower cam. Here's a live look, and I think I may have fixed the set issues I was having. Just double checking here really quickly. Nope, I may need to reboot the set, everyone, but if I need to do that, I'll give you a heads up before that happens. Sometimes it goes to black, sometimes it goes to color bars, but I will definitely try to get this fixed for you. Again, I hope you all are having a great day. Happy Friday to those who are working today. All right, everyone, I think I got the whole set up and running. So if you give me a few moments, I will get some updates from across the country going for you in just a second. All right, you all asked for it, and I do need a few minutes prior to being able to get an update from across the country ready to go for you. Somebody reminded me that it is bear cam season. It is the summer, so I'm going to be taking you out to Katmai National Park. The National Park Service, thanks to explore.org, bringing us this live feed of the bears trying to feast on some salmon. I know a lot of you are enjoying Bear Cam, but don't forget we are also on coronavirusnow.com as well as on YouTube. So they are feasting on salmon, catching salmon. I nearly forgot that it was the season for this. And you want to know what's funny is I was actually looking into possibly traveling to Alaska soon. I would love to be able to get up there. And when I was searching for Katmai National Park, I found that you actually need to fly to the park. You cannot drive there, which I thought was interesting. So it's super cool that they provide us this live bear cam so that we can be there without the trek to get there, right? So many beautiful spots in Alaska. All right, everybody, I am going to show you a House Small Business Committee hearing here next. It's talking about during the economic disaster caused by the COVID-19 pandemic, many small firms were left vulnerable to severe global supply chain disruptions. As the U.S. economy recovers, it's important to take steps to ensure greater supply chain resiliency in the face of future disasters. So, members from the House Small Business Committee hearing from small business owners and experts about steps the federal government can take to ensure more resiliency and focus on ways to correct the vulnerabilities of small firms and utilize their strengths moving forward. So again, that's coming up here in just seconds on News Now and on coronavirusnow.com.
and practice will continue to apply during hybrid proceedings. All members are reminded that they are expected to adhere to these standing rules, including decorum. With that said, the technology we are utilizing today requires us to make some small modifications to ensure that members can fully participate in these proceedings. During the covered period as designated by the Speaker, the committee will operate in accordance with House Resolution 965 and the subsequent guidance from the Rules Committee in a manner that respects the rights of all members to participate. House regulations require members to be visible through a video connection throughout the proceeding. So please keep your cameras on. Also, if you have to participate in another proceeding, please exit this one and log back in later. In the event a member encounters technical issues that prevent them from being recognized for their questioning, I will move to the next available member of the same party, and I will recognize that member at the next appropriate time slot, provided they have returned to the proceeding. Should a member's time be interrupted by technical issues, I will recognize that member at the next appropriate spot for the remainder of their time once their issue has been resolved. In the event a witness loses connectivity during the testimony or questioning, I will preserve their time as staff address the technical issue. I may need to recess the proceedings to provide time for the witness to reconnect. And finally, remember to remain muted until you are recognized to minimize background noise. In accordance with the rules established under House Resolution 965, staff has been advised to mute participants only in the event there is an inadvertent background noise. Should a member wish to be recognized, they must unmute themselves and seek recognition at the appropriate time. For those members here in the room today, we will also be following the health and safety guidelines issued by the attending physician. That includes social distancing and especially the use of masks. I urge members and staff to wear masks at all times while in the hearing room, and I thank you in advance for your commitment to the safety, to a safe environment for all of us here today. Again, good morning, and thank you all for being here. I'd especially like to thank the witnesses for taking time out of their busy schedule to be with us this morning. I want to also thank the Small Business Committee staff for their extremely diligent work during this unique time. It's no secret that small businesses are reeling from the ongoing coronavirus pandemic, which brought entire sectors of the U.S. economy to a standstill. Unemployment is at its highest level since the 1930s. Many businesses have been forced to shut their doors to comply with stay-at-home orders. Businesses and essential services that have been able to remain open face shortages for high-demand products, higher costs for production materials, and an inability to get finished goods to market. The COVID-19 pandemic has exposed many weaknesses in our supply chains, both global and domestic, affecting virtually every industry. Most notably, we have seen hospitals, states, and local governments scramble to ensure the integrity and continued flow of desperately needed personal protective equipment, PPE, and medical devices such as ventilators. Too many times, our communities, healthcare systems, and businesses were competing with each other, bidding up prices and creating supply dislocations across the country. As well, severe COVID outbreaks at food processing facilities meant consumers also experienced the heavy costs of the pandemic on our food supply chain. Small firms can be particularly vulnerable to disruption in supply chains. Many spent years refining just-in-time supply systems, maintaining only a few days or a few weeks of inventory. Many others have limited control of their supply chain and depend on lower-priced suppliers from overseas to support razor-thin margins here at home. An over-reliance on foreign countries for manufacturing components was already an issue before the pandemic hit. As the health crisis spread, Americans realized that too much of our medical supply and personal protective equipment sourcing was in China and other countries hit by COVID. As these countries nationalized their manufacturing capacities, shipments to the United States started to dry up. Initially, the crisis was with PPE, then other finished products, but quickly moved to raw materials and components U.S. manufacturers depend upon to produce their goods for market. These supply disruptions affected businesses large and small in every state. However, as they so often do, American small business across a variety of industries have demonstrated incredible resiliency, resourcefulness, and ingenious flexibility, shifting product lines, moving to more e-commerce, and utilizing alternative supplies and modified distribution chains. Some shifted to making PPE and hand sanitizer in a matter of days. Others came up with new and innovative ways to source their products, while others still discovered new delivery channels and entirely new markets. We will hear inspiring stories of this adaptability today. So why are we here? Small businesses are the heart and soul of our local communities. They represent more than 40% of our national GDP and more than half our country's jobs. Today's hearing will focus on how we can help sustain our nation's small businesses and explore potential solutions to establish more resilient supply chains through this crisis and into the future. Improving our nation's supply chain resiliency will require an all-hands-on-deck approach, as both domestic and global supply chains are vastly interconnected, yet can vary significantly from industry to industry, product to product. We must also recognize that trade is an essential part of supporting small business in a modern economy. 95% of the world's population reside outside the United States, and exporting provides small businesses with literally billions of new customers. However, it is important that we prioritize making things here at home to protect our national security and public health. Doing so will also create jobs and ultimately help us build a stronger economy and a better future for all of us. Second, to enhance our economy's resiliency, we can do better utilizing the distinct strengths and greater adaptability of small companies. In many ways, smaller firms are more nimble than larger ones and can quickly shift their manufacturing, distribution, and sales capacities to meet increased demands for certain goods. Third, much of the disruptions we are experiencing currently were both predictable and preventable. We need to establish better lines of communication and develop better coordination so that we can anticipate shortages, identify additional and alternative sources, and get critical goods and products where they are needed in the most timely, efficient, and cost-effective way. And finally, we need to help small companies be able to diversify, reinforce, and scale their supply chains to better deal with unforeseen surges. I look forward to hearing from all of our witnesses today about their experiences and their ideas for charting a path so we avoid future crises. Hopefully, this hearing can help us establish best practices for our small firms and some principles for our federal government as the economy recovers. Thank you to everyone for being here today. I now recognize the ranking member, Mr. Hearn, for his opening statement. Mr. Hearn, I think you may still be on mute.
Yeah, we had, thank you, a little issue
now
here with our tech. All right, thank you. I'd like to thank my colleague for sitting in the chair today and leading our committee. And, you know, there's no question that this Black Swan event has sent a shockwave through the world and forcing supply chain leaders to rethink current operating models, questioning their organization's emergency preparedness and dependencies on primary sources. Industries of all kinds, from medical to agricultural to automotive, retail, and manufacturing, and more have been discriminately harmed by cascading effects of the novel coronavirus. In the medical industry, the pandemic created an international shortage of personal protection equipment necessary to protect healthcare workers and heal patients. The flow of life-saving pharmaceuticals in the United States has also choked and disrupted in the supply chains across the nation. However, small businesses were able to quickly fill the gaps in supply chain, pivoting from their operations to quickly produce critical medical supplies, potentially saving countless lives. COVID-19 also rattled the agricultural food service industry, disrupting all parts of supply chain from farmers to processing plants and distributors, with significant uncertainty still on the horizon. However, many farmers are rising to the challenges of the moment, adapting to the way Americans now shop and eat by experimenting with direct customer sales and deliveries. Additionally, the President's Executive Order 13917 takes one step towards keeping food supply chains intact. In the manufacturing sector, businesses face several logistical hurdles trying to regulate their accounts payable and receivables, having to reassess market demand and adjust output. Tremendous hurdles exist in trying to manage the workforce, move inventory from one place to another, and keep customer relationships intact during the trying times. As we've seen in a number of other industries, small and local businesses have stepped into the breach, filling the void where traditional suppliers and distributors held. Unfortunately, for every small business success story comes out of this pandemic, we also see mom and pop shops shutting down. Long and employment lines in the country and other small businesses are in many ways vulnerable to the rippling effects of the coronavirus. Where a big company might have a contingency plan and a larger network built into their supply chain, many small businesses operate on a more linear path, leaving them at a greater risk when disruptions occur. Even though the overall picture may seem bleak, the silver silver lining is this power to reshape the supply chain are considered. Over time, adapt. Companies look at diversity, may consider developing relationships with the local and small businesses to fit in anywhere along their supply chain. My hope today is that we can learn more about what we can do to help small businesses affected by the COVID-19 outbreak and how we can leverage the power of small businesses to fortify our national supply chain. With that, Mr. Chairman, I yield back.
Thank you, Mr. Hearn. I'd now like to take a moment to explain how this hearing will proceed. Each witness will have 5 minutes to provide a statement, and each committee member will have 5 minutes for questions. Please ensure that your microphone is on when you begin speaking, and then that you return to mute when you are finished. With that, I'd like to introduce our witnesses. Our first witness is Dr. Eswar Prasad. Dr. Prasad is the Tulani Senior Professor of Trade Policy at Cornell University. He is also a senior fellow at the Brookings Institution. He was previously chief of the Financial Studies Division in the International Monetary Fund's Research Department, and before that, he was head of the IMF's China Division. Thank you, Dr. Prasad, for being here today. Our second witness is Christine Fagnani. Ms. Fagnani is the co-owner and acting vice president of sales and marketing for Lynn Medical. She has held this position for the past 18 years. Prior to working at Lynn Medical, Christine worked for Johnson & Johnson for 16 years in their pharmaceutical division. Christine is also active with the Health Industry and Distribution Association, the leading trade association representing medical distributors. Thank you, Ms. Fagnani, for being here as well. Our third witness is David Billstrom. Mr. Billstrom leads Kitsbow Consulting Apparel in Old Fort, North Carolina. Along a 39-year career that includes Intel Corporation and Walt Disney, he founded an internet search engine company, helped build the Clover Coffee Company acquired by Starbucks, and 2 years ago became the leader of Kitsbow, a cycling apparel company that recently moved from California to North Carolina. Thank you, Mr. Billstrom, for being here today as well. I now would like to yield to our ranking member, Mr. Hearn, to introduce our final witness.
Thank you, Mr. Chairman. I'd like to welcome our final witness, who is from my district, Ms. Sheila Lawson. Good morning, Sheila. Ms. Lawson is the Chief Operations Officer for R.L. Hudson & Company, located in Broken Arrow, Oklahoma. R.L. Hudson & Company was founded in 1980, and founder Rick Hudson was at the tip of the spear recognizing the coming trend of Asian manufacturing, where he began establishing relationships abroad. Soon, the small company that started out as a distributor of rubber O-ring sales became a booming success story with the capability to research, design, and test unique and patentable rubber compounds. In 2017, the company launched a new in-house capability and continues to expand its succeeding competitive industrial landscape. Ms. Lawson brings with her a deep well of experience, having lived in the supply chain and operations world for 30 years. She has been with R.L. Hudson for the past 14 years, serving as COO for the past 2. She is currently in her 3rd term as president of the Association for Operations Management, previously known as the American Production and Inventory Control Society, where she has also been on the board of directors since 2004. Ms. Lawson is a thoughtful and intelligent leader, continuously striving to stay informed as the landscape in her profession evolves. Thank you for your participation today. I look forward to hearing your testimony. Mr. Chairman, I yield back.
Thank you, Mr. Hearn. We'll now recognize our witnesses. Dr. Prasad, you're recognized for 5 minutes.
Small businesses are indeed the bulwark of the American economy. And in this very trying time when the COVID-19 pandemic has ravaged the entire American economy, small businesses have taken the brunt of the burden. They have smaller cash buffers and smaller other sorts of buffers to deal with a shock of this sort. But a far less recognized factor that is affecting small businesses is, of course, the disruption of supply chains. So I commend the committee for holding this hearing, and thank you, Chairman Kim and Ranking Member Hearn, for allowing me to share my views with the focus especially on global supply chains, which many of my distinguished fellow panelists will also be speaking about. Now, global supply chains have been a boon for small businesses in many ways. One of the reasons these supply chains have proliferated is that, thanks largely to U.S. leadership over many decades, both tariff and non-tariff barriers to trade have fallen around the world, and transportation costs have declined. Small businesses have taken full advantage of these supply chain possibilities around the world, and this has allowed them to reduce costs, increase efficiencies, and even expand into broader aspects of business that they might not have been able to do in other circumstances. Because for small businesses, the option of vertical integration, that is basically trying to integrate all parts of a production process within one firm, is not really a viable option. So I think the vitality of small businesses in the US does owe its in part to the integration of supply chains. Now, supply chains are subject to disruption for a variety of reasons. One reason, of course, is health and natural disasters, such as the COVID-19 pandemic that we're experiencing right now. But there are other factors as well. Trade relationships are very important in terms of maintaining the viability of these supply chains, and trade tensions among the major economies, for instance, the US-China trade relationship, or even the North American trade relationships, which are both very important for small business supply chains, have certainly had their fair share of tensions in recent years. Geopolitical tensions in other parts of the world, and weaknesses in other countries, which are very important export markets for small businesses, in addition to being part of supply chains, also create vulnerabilities. So what can small businesses do to increase the resiliency of their supply chains? One potential strategy, of course, is onshoring. That certainly reduces vulnerability to global supply chains, but it also takes away many of the advantages of global supply chains that small businesses have benefited from. So it's not clear that that is the optimal strategy. Another possible strategy is diversification. That is not relying just on one source of suppliers, but trying to diversify across countries, across suppliers. Now, this has both advantages and costs. Certainly, having a more diversified supply chain is going to create more resiliency, more redundancy, but it comes at a cost, especially in terms of efficiency. And for small businesses, cost is clearly a very important consideration. Small businesses can, of course, also increase the resiliency of the supply chains through using technology that can improve their logistics and other parts of their management. So there are many strategies that small businesses can employ, but government has a crucial role to play as well. So what can the government do? In the short term, it's very clear. Small businesses are hurting, as we will hear from my fellow panelists, and the sort of assistance the government has provided so far, both through the Treasury's Paycheck Protection Program and also the Main Street Lending Program of the Federal Reserve, have been very important, and it's crucial that this assistance be continued, and more importantly, that congressional oversight, including by your committee, make sure that this assistance does reach these firms and reaches them in a timely manner. In addition, the government can also play a useful role in terms of tamping down the uncertainty that is created by trade tensions around the world. Certainly, there is a case to be made that effective negotiations by the U.S. Would help to level the playing field, that would help small businesses, but uncertainty in trading relationships and trade frictions certainly don't help. Providing more assistance through the Export-Import Bank for exporting firms can certainly help as well. And America's support for the multinational institutions, such as the International Monetary Fund and the World Bank, which in turn can help other countries that are export markets of the U.S., is a crucial factor as well. So between small businesses themselves and the government, I think this very difficult patch can be gone through, and it is my hope that working together, governments, the federal government, local governments, and small businesses themselves can maintain the resiliency that they have shown in many times in the past and continue to remain very important bulwarks of the U.S. economy, especially as we start, as I hope we will, getting into the economic recovery. Thank you.
Thank you, Dr. Prasad. I'd now like to turn to Ms. Fagnani. You are recognized for 5 minutes.
Yes, good morning. Thank you, Chairwoman Velasquez, Chairman Kim, Ranking Member Shabbat, Ranking Member Hearn, and distinguished members of the committee for the opportunity to testify today. My name is Chris Fagnani, and I'm the owner of Lynn Medical. Established in 1966, my company is a second-generation, family-owned medical products distributor. We have 30 employees, and we're located in the suburb of Detroit, Michigan. We represent over 100 medical manufacturers, and we distribute nationally to hospitals, doctors' offices, and clinics. For this hearing, it's important to note a significant part of our customer base is also small businesses, practices owned by the physicians themselves. I also have the pleasure of appearing before you today as the board chair of the Health Industry Distributors Association. HIDA is the industry association that represents 100 distributor companies operating 500 distribution centers across the country, providing services to virtually
Hi, everyone.
every
It's
provider
Alex.
in the country. Small business is a significant part of our industry, as 73% of HIDA members are small businesses. COVID-19 created several challenges and also opportunities for Lynn Medical, both as a small business and as a distributor in the healthcare market. The main challenge we had to deal with was the significant product shortage and disruptions to the healthcare supply chain. Representing quality product is a pillar of our organization. As demand was in many cases 3 times the capacity from our traditional manufacturer partners, we found ourselves having to vet new sources, something we were not used to doing, as we had a very solid stream of manufacturer partners. We were also used to operating in a very black and white world. Products were either FDA approved and we distributed them, or they were not FDA approved and we did not distribute them. We now had to include understanding the FDA's guidance on products approved under emergency use authorization and timely awareness of the shifting guidance from the FDA. As a small business, we do not have a legal department or a regulatory department or a very large purchasing department whose role it is to navigate through these complex issues. We found this a critical task we had to take on, but very important that we navigate and very difficult to navigate through. I have 2 examples of how shifting EAU guidance affected Lynn Medical. The first is KN95 masks. KN95 masks were allowed under EAU due to the shortage of N95 masks in the United States. Guidance on what factories were approved to provide the KN95 masks and labeling on the packages, the guidance from the FDA has shifted throughout this pandemic. We had product that had left China. When it left China, it was on the approved list and it was labeled properly. Hours later, when it reached the United States, the guidance had shifted. Our product was still allowable and approved, but the labeling on the box was not. So the product had to be flown back to China. The boxes needed to be relabeled and then flown back to the United States. The product was already sold. We had already prepaid for the product. Our customers were faced with a 6-week delay in receiving product that was very important to them. Another example that highlights the challenges is the COVID-19 antibody test. We had shipped product that was allowable as the manufacturer had filed for an EAU, and the EAU was pending based on a March 16, 2020 FDA guidance document that deemed product allowable while EAU approval was pending. However, a subsequent FDA guidance on May 4th stated it was not allowable due to ship the product until the EAU was formally granted. It was very difficult to obtain clear answers from regulatory agencies and very difficult to explain to medical facilities why allowable product was now not allowable. There were significant hardships in searching for clear documentation to ensure we were compliant. Currently, we're very concerned about payables from our healthcare customers. Many facilities closed or reduced operations while at the same time had large expenditures to procure PPE that was not budgeted for. Their cash flows are not at normal levels, and they are asking for delayed payment plans. And with a shortage in product, we're being asked for prepayment of product. My company did apply and received approval for the Paycheck Protection Program. It was an easy and painless process for us, and I want to thank you for including this program in the CARES Act. This assistance is critical to Lynn Medical's financial health. It allowed us to stay whole and maintain our commitment to both our employees and our customers. While the regulatory environment was confusing, we utilized the flexibility and agility small business has to become adept at vetting new suppliers and becoming a resource for our customers. We found our biggest success in dealing with other small businesses domestically. We partnered with small manufacturing businesses whose primary product was deemed non-essential but wanted to keep their employees working and also assist in the COVID-19 response. 2 examples, we partnered with a family-owned business in Michigan that was primarily a cut and sew shop for the automotive industry. They made seat coverings and armrests for cars. We collaborated with them so they could transition to isolation gowns and fill a critical need in the COVID-19 response. We also partnered with a drum-making company in New Jersey who retooled to make face shields. We found in the small business community innovation, a willingness to shift priorities and take risks to keep their businesses relevant and employees working. I would like to thank the committee for its leadership on small business issues and the policies Congress has included in previous stimulus packages. As the committee considers future opportunities to support small
Ms.
business, I would like
Bangani,
to
your
offer
time is
two
expired.
arguments.
If I can ask you just to wrap up.
All right, thank you.
I'm sorry. Thank you very much. We'll now turn to Mr. Billstrom. You are recognized for 5 minutes.
Good morning, Chairman Kim and Ranking Member Hearn and all of the members. Thank you for having me here today. It's an honor to testify alongside these thoughtful and passionate witnesses. I'm speaking to you this morning from North Carolina about a journey a bicycle clothing company took to respond to a national crisis and what we learned. It's an incredible story and one we never could have imagined. Our story is also remarkable because we're not an old school established apparel company in the South. In fact, we just got here. After 7 years in California, we moved to Old Fort, North Carolina in October to create modern, made-to-order clothing factory. Only one of our employees relocated from California, so nearly everyone at Kitspo is a local. And for us, the COVID arrived in February. I say this with some irony because we knew the situation in China was real in February because of our supply chain. You see, we make premium clothes, very expensive, designed very carefully. We use the latest technical fabrics, and every detail is considered. We use snaps, not buttons, for example, and the best snaps in the world are made in Japan. So when our Asian suppliers of fabrics and snaps wouldn't return emails and phone calls in February, we knew it was real. So we took immediate precautions, established social distancing, we cleaned doorknobs, we stopped sharing tools, and we even canceled events. By mid-March, we were considering layoffs or furloughs. But on the same day, our founder in California showed us how we could start making PPE. We elected to keep everyone and do our part to help first responders and medical. Now, the full story of how we launched into PPE would take more time than we have today, but suffice to say that on the first day, we showed the world that we were making PPE. The orders came pouring in. In fact, at the end of that first day, we had orders for more than 25,000 units. It's the biggest shift in customer demand I've seen in 40 years in business, and it happened in one day. We also knew that our community needed what we could do, so we made the pivot. We're now on day 104 of making PPE, and we've shipped nearly 90,000 units in those 100 days from a cold start. We still can't make enough, and it would be months before we could sell to the public. All of our output was reserved for first responders and medical professionals. Now, there's several reasons why a small business like ours can make this pivot. First of all, we have a modern, flexible factory. We can reconfigure the sewing machines and equipment in a few hours. We do this all the time. Second, we have an awesome product team. These leaders are experts in locating suppliers, designing products, and then moving them immediately into production. Third, we had the support of other businesses in the region, supplies and suggestions. We helped each other making PPE, just as you heard a few moments ago from Lynn Medical. Fourth, and most importantly, we knew where our products would be going. I had connections in the public safety community, and we had a distribution partner. It's one thing to make PPE for the good of your community. It's another thing to get paid for it so the business can survive and so that you can pay your employees. Our distribution partner is a private foundation in our region called the Dogwood Health Trust. Dogwood is focused on the health and the wellness of 18 counties in the far western portion of North Carolina where Kitspo is located. The team at Dogwood heard about what we were doing and made contact literally on that first day. They apparently recognized our capabilities and commitment and immediately made an order, paying for it in advance to help our cash flow. They would in turn share our PPE with those who needed it. Now I want to take you back in time. This is March 21. North Carolina had its first confirmed case just 2 days earlier, and California had issued the stay-at-home order just the day before. So this was early and it was strategic. Dogwood CEO Anthony Chang shared with me that their concern was lack of enough PPE for the region should we experience a surge. His hope was that Kitspo would become one of several local manufacturers of PPE. It was time to act, so we did. And together we created a local supply of PPE, and for bonus points, eventually most of our supply chain was in the U.S. Now, as the other people testifying here today already know, a manufacturing operation has two big knobs you can turn if you want to crank up the volume: the labor force and the raw materials. Word went out that we were looking for help, and within 2 days we doubled the number of employees to over 50. We had turned up that knob, so we went for the raw material. Our product design team hit the phones and the internet. They worked 10 hours a day for weeks to source material. It's hard to describe the frustration after you've turned your entire workforce to making PPE, only to find out that all the elastic in the United States has been purchased in the last 4 days. We were competing with hundreds of other businesses. Now, after 2 months of work by our product team and many disappointments, we now source almost 100% of the raw materials for our PPE here in the United States. It was a very heavy lift for our small business, just as you heard about Lynn Medical. Our team came in every day for months, despite orders to shelter in place, which frankly would have been the smart thing to do. In closing, we have a couple of requests for your consideration. First, we cannot overstate how appreciative we are of the FDA and their efforts to make it easy for small businesses to sell face shields. An emergency use authorization on April 13th allows Kitspo to tell buyers that our shields are FDA authorized, that black and white that you just heard about. This is an absolute requirement for any buyer in a large organization because their internal policies require PPE to be FDA approved. Second, now we need the same thing for fabric masks. We're busy making thousands a week, but very few large organizations are allowed to buy them because of lack of FDA guidance or an emergency use authorization. Third, we agree with HIDA that a streamlined information source for small businesses would be a huge help. Small businesses rarely have even one full-time administrative person able to address federal requirements of compliance.
Mr. Billstrom,
thanks for the opportunity to speak today.
Thank you very much, Mr. Billstrom. We'll now turn to Ms. Lawson. You're recognized for 5 minutes. Ms. Lawson, I think you may still be on mute.
Sorry for that. Good morning, Congressman Hearn and other congressman members. I'm honored to be speaking with you today. Over Oral Hudson's 40-year history, we have made the progression from distributor to custom molded part manufacturer by beginning in-house plastic injection molding in 2017. The link between that chasm was superior supply chain management and engineering design support, which is still heavily relied upon today by our OEM customers. Our primary products are molded rubber and plastic parts, extruded and formed hoses, shock and vibration, isolation products, and sealing devices. Industry served our medium heavy-duty trucks, agriculture, medical, power sports, recreational marine, plumbing, and others. As an essential manufacturing company, it's been important for us to think safety first for our team members. Our leadership team took quick actions to augment our safety culture, including hospital-grade cleaners, PPE, remote work, and meeting options. While we did have a few momentary concerns, we were thrilled to say we were all healthy. External supply versus demand has been a key challenge. Importing from 14 countries over 400 containers and 92 million units annually, and exporting to 20 countries, 380 customers and 78 million units annually across the globe brought a list of challenges from the very onset of the COVID-19 pandemic. As the Chinese New Year was being extended, customer forecasts indicated inventories would be consumed soon if we did not respond with swift and creative action. Through strong relationships with our external partners and many conference calls, we were able to secure inventory availability details along with more challenging tasks of finding space on vessels, sometimes trucking to new ports in order to book faster boats, which allowed 2 additional weeks for production. 40% of production during March and April moved in this mode, adding 50% to our transit costs. All the while, customers were asking for daily meetings to ensure product availability. The COVID-19 reached the balance of the world just as the expedited containers began arriving to Oral Hudson. With the U.S. implementing stay-at-home orders and with many customers halting production, we needed to find a place to store the inbound inventory. We have had 18 containers lining our parking lot with an additional 30 moved to an off-site storage. Both come with challenges and increased costs. Predicting future customer consumption required new tools as customers had no way of predicting how they would be impacted. Our inventory dollars grew by 30%. Today, our in-transit inventory has been controlled and reduced by 50% on average. Needless to say, this has placed a strain on our manufacturing partners. The events resulted in payables being greater than receivables for a short time, which was a first during my 14 years with the company. As customers reopened their doors, we were forced to change company policies to not allow for ship dates on orders to be canceled or pushed out. Our company prides itself on flexibility, so this change has been challenging for both our team and the customer. We have allowed this policy to continue, however, should the customer factory be non-operational. Our key customers provided a mountain of support by accepting earlier ship dates to make up for lost consumption in April. We are thankful for the true partnerships and support they have provided. Internal workforce versus demand has proven to have its own set of challenges. Late raw material arrival and Q1 forecast seeming to remain strong. Our manufacturing teams went to quick action to ensure product availability. As demand decreased due to the stay-at-home orders and factory closures, we kept our teams in production by building stock for products that are higher in volume but with zero firm orders. With machine utilization in our injection molding dipping to 30% in April and finished goods filling the warehouse, we did move to a 4-day work week during May for all team members. We were thankful that the PPP loan allowed us to avoid layoffs and furloughing our team members. In addition, although our work hours were reduced in May, we were able to pay employees for that full 40 hours of work. During flexible supply chain, due to our flexible supply chain, Arnold Hudson has been able to gain 10 new customers during the pandemic. While we have responded very well, we would like to point out that we had begun a process of diversification long before this event. Using in-house manufacturing as an example, we've been taking more production in-house. We have a new strategy to diversify our global production even more, and while it's not yet fully implemented, this crisis reveals the wisdom of the strategy. We still appreciate our internal partners and realize our international partners and realize we need them for certain components, which only frees up our expertise for items where we can excel at manufacturing domestically. Just as our society is trying to learn how to better celebrate diversity and the blessings it can bring, we believe diversity to be a principle that works well for business, even supply chains. Making America stronger as a manufacturing leader will require diverse partnership with factories worldwide. Thank you very much.
Thank you, Ms. Lawson. And again, I want to thank all of our witnesses for joining us and sharing their experiences. I will begin now with the questioning and recognize myself for 5 minutes. So what we heard, and I'll start with something Ms. Lawson said in her comments, the idea that customers are asking for daily meetings because there's so much uncertainty. This pandemic and the uncertainty in our supply chain has created extra costs, more uncertainty, higher risks, and certainly more frustration. As we heard from Mr. Billstrom, the level of frustration trying to figure this out in a very difficult world. And Mr. Billstrom, I'm going to quote from your submitted testimony, which I thought was fascinating, the full story. I wish we had time to hear it all. But on page 25, you say, Kitspo was competing with dozens, hundreds of other manufacturers for the same key material, plastic, elastic, HEPA filter media, etc., all of which was obviously critical and essential supplies in a worldwide disaster. This could have been recognized and the appropriate materials secured by a central authority. I want to explore that idea. I've been pushing for a centralized supply chain czar because this is so critical. We see it for our small businesses in their need to get everything from raw materials and supplies to manufacture their goods, one leading to another as small businesses rely on each other, which we've heard from the witnesses, but also the fact that as we compete with each other, prices are going up and it's making it very difficult for small companies. In particular, we've seen this with the PPE, the personal protective equipment, gloves, masks, gowns, et cetera. So I'd like to start with Dr. Prasad. When you're looking at essential goods like PPE, medical devices, the food supply, et cetera, where do you see the federal government has fallen short in the early months of this pandemic in the spring, and what can we be doing to make sure that we don't fall short in the months ahead of us? Dr. Prasad, you're still muted.
Sorry, Mr. Chairman. Your question is a very pertinent one, and as I think my fellow panelists have indicated, regulatory certainty is certainly one of the most critical aspects that small businesses seem to be contending with. Certainly, there are facts changing on the ground by.
I think we lost the signal again, Dr. Prasad. You may be muted.
Sorry, I think I was emphasizing the issue of regulatory certainty to make the point that the experiences of my fellow panelists suggest that while the FDA and other regulatory agencies have been flexible, which is certainly very welcome, the lack of certainty is really challenging for them. And that, I think, needs to be a critical element that the government can help with, in addition to providing more such programs.
Great. Thank you, Dr. Prasad. And let me turn to Mr. Billstrom, because as I quoted you, how would you see a centralized authority for supply chain possibly making a difference in the work you were trying to do, as you touched on, getting the raw materials and ultimately getting finished product to your customers?
You know, I hate to say this, but I don't know. That's not my area of expertise, so I can explain the need, which is as scarce materials that are essential and can't be replaced any other way are identified, we need some way of organizing it, but I don't have a specific proposal on it.
No, and I appreciate you not wading in where you didn't feel confident. One of the things I think, and just from my experience in business, is that to the extent we can have a centralized authority who understands where there are opportunities, as you touched on in your company, Kitspo did a pivot, and then you mentioned in your testimony a pivot within a pivot in a very short period of time. Helping coordinate that in the centralized authority, understanding what's happening, the needs across the nation, the resources across the nation, and trying to match those, I think, is a good opportunity. But I've used my time. I'll now turn to my colleague, Mr. Hearn, to ask his questions.
Thank you, Mr. Schneider. I really appreciate it. Again, thanks for all the testimony that we just heard regarding supply chain. Ms. Lawson, you know, I've had an opportunity to tour your manufacturing, and can you tell us more about how doing in-house productions is fair compared to working with outside manufacturing partners or outsourcing?
Sure. As we insource, we had our own set of challenges as we began to pulling in from outside. We found that, you know, they had secondary operations, and we needed to learn to produce pulling that ejected parts out of the machine without those secondary operations, and we were able to control that because the quality of the product much better because as it came out, there were no additional trimming operations and such, which can create gouges and leak paths and those type of things. So controlling that has been great. However, we do believe that there are sectors where we will need to set the most useful location for the means of production, because there are some items that are better suited and to be produced elsewhere, so that it frees our expertise for items that we can excel manufacturing domestically. So we see it both ways. We do, and our customers do appreciate the additional control as we bring product in-house.
I've got a series of questions. One question I'm going to ask for all of you, and I'll start with you. It's really, there's been a lot talked about across multiple industries, pharmaceuticals, and others, that relate to bringing things in from Asia, and more specifically China and Taiwan and places like that. What do you see as being a pioneer with the Asian community in importing and exporting to them as well? What do you see changing right now among the perception of the American people, even if we talk Buy American? How practical is that to bring what some would like 100% of all sourcing back to the United States, or certainly to North America?
R.L. Hudson, we have more than 5,000 part numbers, which we procure abroad and in the Asian factories. And to bring all of those back, the dollar for tooling, even if you're moving the tools, in some cases you can build new ones for the same cost as the other ones. There's testing. Everyone wants to have product that has good quality, which requires testing. So the costs associated with that would really be invaluable for us, new products and where it makes sense to move them for critical parts, we support that and believe that insourcing parts will be great. But there is a place for products to be left where they are. And we do see concern from our manufacturing partners that we've worked with, and they want, as businessmen themselves and women, they want to provide good quality service to us. So it is a bit of a strain on the relationship, and we want to make sure that we're able to provide product as promised to customers throughout the U.S.
Thank you. Professor Prasad, just from a policy standpoint, when you're looking at what you're seeing, the movement across the United States because of the pandemic, this acceleration of bringing back manufacturing from specifically China back to North America. Yesterday was the first day of the USMCA deal. How do you see that opportunity, that confluence of opportunity from China to now USMCA with free trade, lower labor costs in Mexico, how that would soften the blow of price increases or product price increases that might affect the willingness to buy?
Certainly the onshoring and also the regionalization of supply chains as opposed to using global supply chains is going to have some positive benefits in the short run in terms of employment in the U.S. and in the North American continent. But I think for small businesses, there are some real constraints imposed by that, because the very linear supply chains they had set in place, many of which going through Asia, as was the case for Hudson Manufacturing, has led to enormous gains in efficiency, and frankly, it's allowed them to create certain product structures that might not be possible if you had much more onshored or regionalized supply chains. So I think it's going to be a trade-off for every small business. There are huge benefits to be gained from much broader supply chains, especially if you think about the sort of diversification that the lady from Hudson Manufacturing talked about. And that has to be offset against the fact that there are going to be job gains, certainly, if you have more onshoring. But from a longer-term perspective, I think the broader diversification of the supply chain is certainly going to be better for small businesses.
Thank you. Mr. Chairman, I yield back.
Thank you, Mr. Hearn. And I would now like to recognize the gentleman from Ohio, the ranking member of the Small Business Committee, Steve Shabbat.
Thank you very much, Mr. Chairman, and I understand that my connection may have some challenges here, so hopefully you can hear me okay. If not, let me know. I'll start with Ms. Lawson, if I can. I want to thank all the witnesses for being with us today. You alluded to this in your testimony, but could you describe in a little greater detail some of the more significant trade-offs that your company had to navigate in order to keep your supply chain intact? And do you think these trade-offs could result in any long-term damages or challenges or disadvantages for your company?
Sure. Some of the biggest challenges we are going to face as we go forward is that we have really strained our manufacturing partners. One of the keys to our success is making sure that we're an important customer to our partners. So we want to make sure that we're in that top 1, 2, 3 on their customer list. So we are a big percentage of their business. So we have some manufacturing partners who are only manufacturing 2 or maybe 3 days a week at this time. So as business begins to increase, we're going to face challenges for those products that must come from them, because everything that we purchase is a one-to-one relationship between the customer. There is nothing that we can sell to another customer, nor can it be produced by anyone else without additional tooling being built. So we're going to need to support these factories as they begin bringing up their production, maybe in some cases rehiring on their own, and building back up their timelines to be able to manufacture. So it's going to be a big challenge. I also said in my statement, we're looking to diversify, and we've already began through that process. We went through 101 different manufacturing companies We've narrowed it down to almost 30, and due to the pandemic, we're a little bit strained opening up new factories, as we cannot put boots on the ground to make sure that we do those full scope audits to ensure the qualities are in place that our products require.
Okay. Thank you very much. And I'll stick with Ms. Lawson at this point. What would you say was your greatest asset in weathering the disruptions in your and COVID-19? And what would you say was your challenge?
Okay, I would say that we have built very strong relationships, and we communicate very well with our supply chain, all the way from the supply chain being our factories and also being our customers. So communication has been key, and being very open with what we're being faced with. So we've had conference calls after conference calls, 10, 11 o'clock at night, followed by 7 a.m. conference calls with other countries in the morning. But it's very important that we're communicating and that everyone knows what is the situation. And that includes our freight forwarding teams. On the other side, the biggest challenge has really for us been where will we place this inventory, and our payables have also, I forgot which one of my colleagues talked about payables, but it is a strain because we've seen some customers close their doors throughout this process, and that's concerning with our payables. And for the first time, we had our receivables less than our payables, and it was a strain and a concern. But I'm very thankful that our team members who have had long-term stability with our customers with our factories have been able to move from one side of our business to the other. So we've been fluid and being able to keep our head count where it needs to be and manage our expenses accordingly.
Thank you. Thank you very much. Mr. Chairman, on my screen, the time clock is frozen, so I have no idea how much time I have left. Could somebody educate me on that?
You have 30 seconds.
Okay. All right. Well, at this point, probably not having sufficient time to really get into the, another question, have the answer to be fair to my colleagues. I'll yield back in a second, but I just once again want to thank all the witnesses for their testimony today. I think it's been very helpful. Supply chain is absolutely critical, and during these times, a clear challenge, and it was helpful to hear how you all are dealing with it and recommendations that we can work as we're moving forward for potential legislation or other things that we're involved in. So thank you very much. Appreciate it. And I yield back.
Thank you, Mr. Shabbat, and we will have a chance to go to a second round of questions if you want to stay on. But the gentleman's time has expired and yields back. I'd now like to recognize the gentleman from Minnesota, Mr. Stauber. Mr. Stauber is the ranking member of the Subcommittee on Contracting and Infrastructure. He's now recognized for 5 minutes.
Thank you very much, Mr. Chair, and thanks for the witnesses for being here. Since the beginning of the COVID-19 crisis, we have seen over 70 countries impose some sort of export restrictions on an array of different products, including medical supplies, pharmaceuticals, and food products. Can any of the witnesses tell me what would happen if tomorrow the Communist country of China chose to implement an export ban on active pharmaceutical ingredients, medicines, and critical minerals that
All right, everybody, we're getting something live right now. I want to listen in. As soon as I figure out exactly what it is, I will tell you, but it looks like we might have a police chief speaking, so let's listen in.
The country to know that by city charter, I can only place officers on administrative leave without pay if they're charged with a felony. So that is why they were placed with pay. I know that everyone, this story came out on Monday night. I had our legal advisor reach out to Shanine McLean's lawyer and told her that I would like to sit down and make sure that she has all the information. No one has the right to see these pictures before she sees these pictures. This is her son. This is her son being mocked, along with her attorney at 9 a.m. And she was able to see these photos before the world sees them. and that's the right thing to do, and that is why I haven't come out with anything sooner. The case was completed Monday night, late Monday night, at about 8 o'clock. I ordered a mandatory Chiefs Review Board to be held first thing Tuesday morning. As soon as the Chiefs Review Board met, they gave me their recommendation, which was termination. And I immediately ordered those officers in for what's called their pre-disciplinary hearing with the Chief of Police. This is part of the due process that is given to these officers. At their pre-disciplinary hearing, they are told that they have 3 days to send me anything that they would like me to consider in addition to their statements that I read in the investigation. None of them sent me any additional information. I want to make that clear. There were 4 officers to start with that were involved in this and found to be in violation of conduct unbecoming was the directive they were found in violation of. One officer, as you all are aware, resigned Tuesday morning, and I want to tell him I appreciate you doing the right thing. I appreciate you realizing what you have done and what a despicable act and what you have brought upon this nation, upon this family, and you have embarrassed law enforcement yet again. After the preliminary hearing, it's by city charter that I must wait. I have no other remedy but to wait 72 hours before their final disciplinary hearing. So those officers had requested an IRB, which I denied. An IRB is an investigative review board, which is merely a recommendation that is given to the Chief of Police. Nothing was going to change my mind on termination. Therefore, I denied their right to an investigative review board, and I am legally able to do so. I met with these officers today at 11:30, 11:45, and 12 o'clock, 72 hours since Tuesday when they had their pre-disciplinary hearing with me, and I terminated the remaining 3. They are no longer able to wear this badge or represent this agency. I would like now, I know a lot of you have received this in the press packet, and I can tell you all this is very disturbing, these photos, and I want to go ahead and put this so that the camera can zoom in on the first photo, and then I will show the other photo. So the officer in the middle of this photo is Jared Jones. He is the one that resigned on Tuesday. The other 2 are Kyle Dietrich and Erica Marrero. Is that sufficient time? Tilt it forward, sure. Just let me know when you're ready. Okay.
Which is the one that resigned?
The one in the middle with a ball cap. Is that good, sir? Okay. This photo is 1,000 times worse than the first of the smiling at the memorial. This photo, they are actually reenacting. Is this a good down? Yeah, they're actually reenacting a carotid control hold. Let me know when you're ready, sir. Good. Okay. It's reprehensible, and that's why they no longer work here. I would like to give you some information about those officers. Kyle Dietrich, which is depicted in the photo. He has been on the Aurora Police Department for 3 years, since 2016. Jared Jones, depicted in the photo, he has been on 3 years, also 2016, and he is the one that resigned. Erica Marrero, depicted in the photo, has been employed for 2 years and was hired in 2018. The last officer that I fired received this photo and replied with an inappropriate comment of "ha ha." There was absolutely nothing funny about this. That officer is Jason Rosenblatt. He has been on for 3 years. He is not being involved because of him being in the incident of the photo. He is being fired for his lack and utter inability to do the right thing here. and to say ha-ha when he was engaged in the incident with Elijah McClain is absolutely unacceptable. Once again, I would like to apologize to the agencies across the nation, because as we know, misconduct in any police department reverberates across the nation. So I want to apologize to my colleagues. I also want to remind everyone that the only reason this came to light to me was because of an honorable Aurora police officer who was disgusted by what he saw, and he reported it to a sergeant. That sergeant immediately called me and said, "Ma'am, we have a problem, and I need to bring him in to be interviewed by Internal Affairs." So there are good officers, and I want to say to those out there that are working here today that I appreciate you. We will get through this, but hold your heads high, because we know that there are cops that have integrity, they understand duty, and they understand honor. These four don't get it. And if any officer in this police department disagrees and thinks that this was acceptable, I will gladly accept your resignation today. Again, I want to apologize to the McClain family, and I will open it up for questions.
Chief, what about Nathan Woodyard and Randy Rodima? They are other people that were involved in the original incident. Some may look at this and say, why are you firing people who took a photograph of the incident instead of the actual people who were involved?
So I was not the chief of police during the original incident. I can only deal with this incident, and I'm not saying that that is being investigated by 4 other agencies now, the FBI, the DOJ, the independent investigation that the city called for, as well as the governor asking Attorney General Phil Weiser to look into this case. So I respectfully am not going to comment any further on that. I don't want to interfere with any of this, any of those investigations. I'm looking forward to what comes out of those, and so we can move forward as a community.
The Police Association today said that this was a rush of judgment. And can you explain either why you disagree or agree with that?
So the question was that the Aurora Police Association said that I had rushed to judgment on this. It is my prerogative, and the public outcry and demand for justice for Elijah, and just the absolute, they don't deserve to wear a badge anymore. And I accelerated it, and I was able to do that legally, and I felt it was the right thing for this community.
Are you instituting any sort of new reforms inside the police department? There are obviously some that came from the statewide bill. All these other departments are looking at different things they can do internally. In terms of this case, there's multiple. There's the arrest incident, but then there's also these photos. I mean, what are you doing internally moving forward?
So we're going to be looking at any directive changes that we can have that something like this happens in the future, that we can immediately address it. So I have to look at legalities of that to make sure that I can put a directive in if someone receives a photo like this, that they're mandated to let me know and turn it in.
Chief, I know you have heard from a lot of people in this community, and whether it's these 2 photos or the death of an unarmed black man who had committed no crime, to failing to investigate one of your own when he was found passed out drunk in a police car, a lot of people believe that the culture of the Aurora Police Department is broken and poisoned. How do you respond to that?
I can say that we've made a lot of mistakes, and that we have addressed those mistakes, and I am continuing to address those mistakes with transparency and also holding officers accountable. So I believe that the termination of these 3 officers shows you that, as well as other officers that I have recently terminated. And the culture has been reset, and they know that this will not be tolerated.
Chief, beyond internally, externally, what steps are you taking now, or will you take to repair the image of the police department within the community?
That's going to take things like this, holding people accountable, being honest and transparent about it, making sure that the families are brought into the situation prior to ever leaking to the media, and so that they aren't surprised by things that have happened. Training and talking about why this isn't acceptable. I shouldn't have to teach this. There's no training that should teach human decency. And so we've changed directives regarding suspicious persons calls, which was what the call that officers responded to during the Elijah incident. And I'm hoping that with changing directives and looking at our policies and procedures, I'm looking very much forward to working with the community task force that has community members on it to come in and look at our things that we're doing, make suggestions, and be a part of how we move forward. And hopefully with that, we can regain the trust of this community, but it's going to take time, and I'm not sitting here thinking this is going to do it here today. I know that people are angry and people are grieving. Yes?
There's a memorandum in here for Nathan Woodward for unbecoming behavior. Do you know why this is not sustained and why it's in here in the first place? Did he receive the photo?
So Nathan Woodyard did receive the photo. He immediately deleted it, did not forward it or make any comments of that. So there is no directive. Like I said before, when we talk about changes, there is no directive that says an officer has to report something like that. I can tell you, I've spoken with Officer Woodyard. He is devastated by this and disgusted.
Can you clarify how widely this was shared? Is it just 5 people, or just explain how many people saw this photograph?
So the 3 obviously that took it, and it was forwarded to Nathan Woodyard and Rosenblatt. So 5 total. And we checked phones to make sure that it didn't go beyond that.
And so the unnamed officer here how is that person connected?
So a female officer, they thought she may have been on it was a group text that this photo came through on, and she was completely exonerated. She did not receive the photo.
The Aurora Police Association, I know you already addressed their comments, but they're
Sure.
accusing you of violating the officer's due process rights and confiscating and going through their phone. Can you respond to that?
I absolutely can. So in the internal affairs investigation, every officer that was interviewed gave their phones voluntarily, but we followed it up with an order at their request. So I didn't violate any due process laws. The APA has attorneys, and so do I.
You're in a building right now that has boarded up windows right behind you. How
Yes.
should the community respond when they see these photos?
I'm sure they're angry, and I'm sure they would want them to be fired, and I've done that today. I can't take it back, and I wish I could.
The officer that resigned, is he able to get his post-certification? Does it stay?
So the officer that, just because he resigned, the file will show that he was going to be terminated as well, and that will be shared under the new law with the post certification. So he will no longer be able to be an officer here in the state of Colorado.
The officers had just been responding to an incident. Is there any body camera video of this where they were taking the photo afterwards?
No, ma'am, this was something they did on their own.
Did any of them, I know you said they didn't give you anything in writing, did any of them say anything to you about were they apologetic? Did they explain why they did this?
Yes, they did. And their explanation, I don't buy it, is that they were trying to cheer up a friend by sending that photo. And how anybody could think that was going to make anybody happy is beyond me. Mr. Rosenblatt felt that he would respond, ha-ha, and I can tell you that Mr. Woodyard was extremely disturbed and is still very much having a hard time dealing with this entire situation.
And which friend were they trying to cheer up? Was it Rosenblatt or
Woodyard.
So I might have missed the timeline. Can you take me back? This happened
Sure.
8 months ago?
So the photo was taken, Elijah, the incident with Elijah was August 24th of 2019. The photo was taken October 20th of 2019 outside of the location where there was a memorial set up for Elijah. 8 days ago is when an officer of the Aurora Police Department came forward and let us know that this was out there.
So what happened between that 8 months? There's an 8-month gap there. What happened? Why did it take so long?
It was no one brought it forward to me or any of my executive staff.
So the person that brought it forward to you, did they wait 7 months?
They found out about it, I believe. I'd have to check the file, and the file will be released to the family as well, just so you're aware. I believe he found out about it in March. He struggled on how to move forward, knowing he talked to his wife, and he knew that deep in his heart he had to do something because he was hoping they were going to bring it forward, and no one ever did.
did Randy Rodimus receive the photo?
He did not.
Can you clarify, like that there were a bunch of officers involved, like that had showed up to the scene after the 3 officers arrested him? Were the officers in the photo involved in the initial incident, or?
No, they were not. And I will double check on that, but I don't believe they responded to that call at all. Any other questions? All right, I thank you for your time. And again, Ms. McLean, we talked this morning, and I apologize again. Thank you very much.
All right, everybody, that was an update from Aurora, Colorado. I'm not quite sure exactly. She's probably just updating the media as for additional information or possibly the photo release that they need there. I do want to let you know what I know so far about this case. Of course, the system is still acting funny on me, everyone. Mike Page said he went through the show fine, but for me, it's acting weird. Okay, so I want to update you the latest from Fox News. This is an article from yesterday. Federal authorities actually said back on Tuesday that an ongoing review into the death of a black man who died after being put into a chokehold by police began last year to see if a civil rights investigation was warranted. Multiple Aurora, Colorado police officers have been placed on paid leave amid an investigation into the August 2019 death of Elijah McClain. In a joint statement, the Colorado U.S. Attorney's Office, the Justice Department Civil Rights Division, and the FBI said a review began last year. The DOJ said it normally does not comment on investigations, but that, quote, there are specific cases in which doing so is warranted if such information is in the best interest of the public and public safety, and that recent attention on the death of Elijah McClain warrants such disclosure, end quote. It announced that Aurora officials were cooperating with the inquiry. This is a continued quote. We are from a statement, actually. We are also aware of recent media reports about Aurora police officers being placed on administrative leave pending an internal investigation into a photograph in which those officers appeared, the statement said. We are gathering further information about that incident to determine whether a federal civil rights investigation is warranted. We will have no further comments until both of those reviews are completed. The officers were placed on leave after photos emerged on Monday showing them near the site where McClain died. That's according to Aurora Interim Police Chief Vanessa Wilson. That's who we just heard from there. McClain was stopped by 3 white police officers on August 24th, again, obviously last year because we're not in August yet, after reports of a suspicious person walking down a street wearing a mask. That was according to Officer Matthew Longshore, an Aurora police spokesman. Police body camera video appeared to show an officer telling him, quote, stop right there, stop, I have a right to stop you because you're being suspicious, end quote. At one point, the officer tells McClain to relax or, quote, I'm going to have to change this situation, end quote. Police claim he refused to stop walking and fought back when the officer tried taking him into custody. He was placed in a chokehold and later died after suffering a cardiac arrest and was taken off life support. A forensic pathologist could not determine what exactly led to his death, but said physical exertion during the confrontation likely contributed. The 3 officers who stopped McClain did not face any criminal charges after an investigation by the district attorney, but Governor Jared Polis directed Colorado Attorney General Phil Weiser last week to reopen the investigation and possibly prosecute them. The case gaining renewed attention after the death of George Floyd, who died in Minneapolis police custody. Video footage of the incident showed an officer holding his knee on Floyd's neck for nearly 9 minutes. Aurora police were roundly criticized over the weekend for wearing riot gear and using pepper spray on protesters during a rally over McClain's death. So that's the latest I've been able to find from Fox News for you there on the Elijah McClain case. I'm going to take you out to New York City now. I'm being told there's an Occupy protest happening. Again, you're watching News Now. Thanks for being here. I'm working, everybody, on getting you audio here from New York City. I reached out to my appropriate contact, and hopefully it'll be coming out here any second. But again, this is an Occupy protest happening live in New York City. Mike Pace is going to be rejoining you all in just a few minutes here, and I will see you all later this afternoon carrying the News Now stream into later this evening. Again, I hope you all are having a great afternoon or evening, depending on where you're watching us from, and a great holiday weekend for those of you already celebrating Independence Day.
Hi, everyone. It's Alex Savage from KTVU, Fox 2 News here in the San Francisco Bay Area. And really just in a matter of a few weeks, a lot of school-age children all across the country will potentially be returning to their classrooms, their physical school buildings here, despite the ongoing coronavirus pandemic. Districts all over putting plans in place to get kids back in class. And joining us now to talk more about how this is all going to play out is Dr. Hansa Bhargava, who is a pediatrician and the senior medical director with WebMD. Dr. Bhargava, really good to have you on here to talk about what I know is such an important topic for so many parents here. You talk to a lot of parents. What are the biggest concerns that parents have about how this is all going to look when their kids do return to school?
Well, first of all, thanks for having me here. Yeah, I've been hearing a lot, Alex, about parents' concerns about this, and they are concerned about their kids getting the infection, bringing it home, whether the teachers could be exposed or whether teachers could expose the kids. There are a lot of concerns, especially with the rising numbers of COVID in certain parts of the country.
Okay, so I know that different school districts, and we've heard a lot of school districts here in the Bay Area, rolling out their safety plans to put kids back onto campus, but do it in as safe a way as possible. Some of the keys are obviously going to be trying to have as many students as possible wear masks and trying to have students be as spaced out as you possibly can be, given the fact that you're going to have hundreds of kids back on a school campus. What is it going to look like, and what are the key safety measures that you think need to be in place for reopening schools in a safe way?
Yeah. Well, first of all, I did want to say the American Academy of Pediatrics came out with a statement recently, a couple of days ago, about the need for children to go back to school. And I, as a pediatrician and as a parent, strongly support that. And that is because the kids actually need to learn. And what they found with online school is that it just didn't work. I mean, kids are not learning for, various reasons. They may not have the computer, or if they had it, the parent needed to work, or, they just were distracted, or, it was really hard for the schools to deliver the education. So kids are behind, and we can't have American children get further and further behind in their education. So that's one of the big reasons. A couple of other reasons is, mental health. Kids, who aren't socializing or in other groups of kids, or even with the teachers in a structured environment, don't have the ability to socialize. And so we're seeing anxiety and depression as well, Alex. And, the third reason I think you probably know is as a parent, as I do, when you're a parent and you're working, even if you have the privilege of working from home, you don't necessarily have the capacity to also take on teaching when the kids are online. So that's just for people who can work from home. But imagine the parents who actually have to go to work or have essential jobs where they have to be there and live paycheck to paycheck. So for all of those reasons, it really makes sense for the kids to go back to school.
One of the things, and I don't know if you've heard this, but one of the plans that's sort of on the table, it sounds like for some school districts, is to offer an array of options for parents, and it's sort of dependent on the students. So maybe some students are going to come and be back in the classroom 3, 4, maybe even 5 days out of the week. Other students, maybe not as much, sort of depending. And then, of course, you could have the alternating days. How important is it, you think, and you just referred to, again, some of the students whose parents have to be at work, and those students really need to be in that school setting. So you sort of have an array of needs here. And how do you think that school districts are going to balance all of that?
And that's a great question. And I think it's a very difficult task. Look, it's really difficult. A lot of the schools are suffering from not getting enough resources, or they might not, they have different parents' needs to serve, as you're outlining. But I think the schools have been working really hard. And, I myself as a parent got surveys on what I wanted. I know other parents who did as well. Some schools are offering both options, so parents are comfortable. I think the bottom line is that there needs to be a physical option where kids show up in a structured setting. And so I think that most parents, and I would advocate, and I am sending my kids back to school as well, that parents should try to go there. And a couple of the concerns that we talked about earlier, Alex, was that parents are concerned about infection. I just want to point to a couple of studies actually that I was really relieved to read about. And that is like, there's small studies, one's out of Geneva, Switzerland, and the other is from out of China. But essentially the one out of Geneva, Switzerland showed that in fact, when kids went to school in Switzerland, the households that got infected, less than 8% were due to the child bringing home the infection. So what does that mean? That means over 90% of those households did not get infected from the child who went to school. And that gives me some confidence. I know it's a small study and we need more research, but that's great in that that's one of our biggest fears, that is this child going to bring home an infection? Is this child going to, and the answer is that kids don't necessarily spread the infection, and when they get it, it's very, very mild. So if that alleviates some concerns, then that would be great for the kids to go and get the benefits when they're not as much as at risk as you and I.
Yeah, and we've certainly heard that across the board, kids have not been impacted in the same way by coronavirus. Obviously, kids tend to not get as seriously ill as adults if they do contract the virus. But does the research show that they're less likely to transmit it to other kids or adults?
Yeah, and that's the good news. Like these initial small studies, and we'll have more studies, of course, are showing that they're less likely to transmit it, as opposed to what we thought before a few months ago, where we thought that they're going to be asymptomatic and they will spread it. The other area I would point to is also that the CDC reported on, and there was an article recently about childcare centers that remained open for essential healthcare workers.
Right.
And this was over March, April, May in New York. Did you hear about that one, Alex?
I didn't know, but I know that many of them had obviously had stayed open for folks who had to be at work. Yeah. No, I didn't hear what were the results?
Yeah, and so those centers actually were really smart. They did all the precautions, which basically they talked about airplane arms for the 4 and 5-year-olds. They told them to be airplane arms away from other children. They did pods where they had a small group of kids with one teacher, and they only stayed with that one teacher. And of course, hand washing and masks. And what they found was, again, very little risk of infection, very little spread of infection. So that should give us some confidence as parents as well.
Yeah, I think that's probably going to put a lot of parents a little bit more at ease. All right, so you talked about the airplane arms, and that's interesting because it sort of leads me into my next question, which is, it seems like such an incredible challenge to ask, especially the kids on the younger end of the spectrum. The elementary school age kids, asking them to distance from each other and asking them to wear masks. This seems like it's going to be tough to do. How important is it for parents to sort of reinforce that training and create those good habits before we send our kids back into the school setting?
I totally agree that it's hard, but it's not impossible. So here's what I'm doing for myself. And that is, in the lead up to school time, in the next few weeks or the next month and a half, wherever you are in the country, I would suggest that you start the habits now, because parents actually have control over summertime, right? You can teach kids things over the summer that you don't during the school year. So the rules that I have in my house are, you open the front door, the mask goes on. So masks on, and then when you come in, hands washed. The first thing you do is you go to the bathroom and wash your hands. So, if we could just do those two simple things, and then of course, like, kids basically will learn what parents do. Yeah. So if we do go to the grocery store, we do, go to a small group of people and a barbecue, we stay 6 feet away, and we need to demonstrate that as parents to the children, so that by the time school starts, that's ingrained in their heads. It takes 3 weeks to make a habit. If we have 3 weeks to do it, let's do it.
Yeah, well, that means for a lot of folks, might need to start right now if you haven't been reinforcing the habits, those good habits already. Because yeah, I mean, summer's gonna summer's gonna be over here pretty soon. I'm already looking at our calendar here at our house, and it's gonna be over soon. Kids they're gonna be back, back on campus, but it doesn't sound like they're gonna be. It's not gonna be necessarily school as normal as it was before. What sort of activities do you think are going to be out?
There's definitely going to be restrictions. It's COVID life. So of course there will be probably imposition of masks, and that's really important. The studies are pointing to that more than ever, that we need to be wearing masks, and they do make a difference. The pods are really important, where there's only small groups and assigned to each teacher. There could be hybrid. Some schools are doing hybrid days where they're asking certain grades to come in on Monday, Wednesday, Friday, and other grades to come in on Tuesday, Thursday. And of course, there's going to be hand sanitizers and hopefully a push toward, washing your hands a lot and physical distancing. So it's not going to look like before, and activities will be restricted. I mean,
yeah. What about
activities
like sports and band? I'm just trying to think of some of the things that you normally would see on a school campus.
I think that I would, if I was to give advice, I would probably stick more to solo sports. So, you can run and physically distance. You could potentially play tennis and physically distance. I wouldn't suggest basketball just yet, because that's an indoor sport with a lot of clustering. So, this is not a guideline. These are just my thoughts.
Sure.
In terms of social distancing. But yes, I do think
but students should be prepared for the fact that, maybe some of these sports are probably going to be limited in some way. And maybe not the same extracurricular activities that you normally would have, unfortunately.
Yeah.
But the important thing is getting them back into that classroom setting, because the other issue here, and I know we've talked about it many times during the pandemic, is that there were so many students, it really came to the forefront, but there were so many students who just lacked access to computers, access to internet, and they were not getting the same level of education as some of their peers during this pandemic, in the online learning model.
Completely agree. Internet is expensive. People may not have devices. So that's the digital divide, what the pediatricians often talk about. And then unfortunately, some kids are also dependent on school meals, and you can't have children hungry. So those are additional benefits in addition to the learning and the socialization for all kids.
All right, so let's wrap up here and talk, a little bit about kind of the what ifs. I mean, it's not the scenario you want to think about, but obviously you can't control everything, and you can't completely stop the spread of this virus. So you are likely to have outbreaks potentially related to a school campus somewhere. How should school districts respond to those? And how ready do you think families should be to kind of pivot from the in-person learning to the online learning once again? We're going to kind of have to be flexible, right?
Absolutely. We need to adapt. This is not normal times. And if there are outbreaks in the school, which could potentially happen, even though we're hopeful that it won't happen, I think the schools may be forced to do online learning for a while. Also, as parents, we need to take responsibility as well. We've talked about this too, that, if your child is sick, don't send them to school. If they have a fever, they don't need to go to school. And that's a rule even before COVID happened, but now especially since COVID-19's happened. So that's really important. And the third way for parents to prepare, and we've talked about this too, Alex, is we've got to get those vaccinations. What we don't want is an additional crisis on top of COVID-19. And that's really going to handicap our nation. So we need to go out there and get our vaccinations. We don't want measles outbreaks on top of COVID infections.
Yeah, it's such a good point. And as you say, it's the responsibility of every family to make sure that you're not sending a kid to school who is sick. I mean, we've all done it in the past. You sort of fudge things a little bit, and oh well, he's got a little bit of a cough. He or she has a little bit of a cough. I'm gonna send them to school anyway. This is not the time to mess around with anything. So if you have a sick kid, keep them at home, right?
Yeah, this is about the we. I mean, united we stand, divided we fall. We need to be united and be a community and take our individual responsibility, but also care about the society. So we absolutely have to do that.
All right, but bottom line, Dr. Bhargava, is that you are in favor of
Bottom
getting
line,
kids back into classrooms.
yeah, the bottom line is school is great for kids, for learning, for mental health, and even for the family, right, where the parents have to work. But also, I will add what we talked about before, and that is let's prepare in the summer. Masks on when they go outside, hands washed when they come back in, and get those vaccinations.
There you go. And teach the good habits now. All right, good. Well, we as parents, I will speak for parents, we are excited / anxious about students returning to class. But as you say, it is definitely important for them to improve the level of learning that's happening. I appreciate you coming on and appreciate your insight on this really important topic that I know is on the minds of so many parents all over. Dr. Hansa Bhargava, pediatrician, senior medical director at WebMD. Always appreciate you taking the time, and we'll talk to you next time. And I will let the audience know that we have more information that's up at our website, and that is coronavirusnow.com. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area, and I'll talk to you next time. Hi, everyone. It's Alex Savage from KTVU Fox 2 News here in the San Francisco Bay Area. And really just in a matter of a few weeks, a lot of school-age children all across the country will potentially be returning to their classrooms, their physical school buildings here, despite the ongoing coronavirus pandemic. Districts all over putting plans in place to get kids back in class. And joining us now to talk more about how this is all going to play out is Dr. Hansa Bhargava, who is a pediatrician and the senior medical director with WebMD. Dr. Bhargava, really good to have you on here to talk about what I know is such an important topic for so many parents here. You talk to a lot of parents. What are the biggest concerns that parents have about how this is all going to look when their kids do return to school?
Well, first of all, thanks for having me here. Yeah, I've been hearing a lot, Alex, about parents' concerns about this, and they are concerned about their kids getting the infection, bringing it home, whether the teachers could be exposed or whether teachers
of color have been affected disproportionately, both by the virus and its economic impacts. The Centers for Disease Control reports that as of June, Black and Latinx Americans are 4 to 5 times more likely than whites to be hospitalized for COVID-19. And half of all Black adults are not working. During the 2008 foreclosure crisis, we saw a similarly disproportionate impact on communities of color. This was followed by an unequal recovery where white households gained the wealth they lost. Black and brown households are still trying to catch up. We cannot endure another unequal crisis or unequal recovery. Your agencies and Congress must do all that we can to ensure that history does not repeat itself. So, I want to thank both of you for your efforts thus far and for the ways that you have worked with me and my members of this committee, including taking my many calls to strengthen the implementation of the CARES Act. Secretary Mnuchin, you have used your authority to provide community development financial institutions, that is, our CDFIs, and minority depository institutions, our MDIs, greater access to the Paycheck Protection Program, including by setting aside $10 billion for them to lend to ensure more loans go to small minority-owned businesses. Chairman Powell, you have worked with us to reduce the minimum loan size at the Main Street Lending Facility from $1 million to $250,000 and to extend the length of the loans. You've also broadened the eligibility of the municipal liquidity facility to increase access to a greater number of cities and towns. The CARES Act has provided important relief to struggling families and communities. But as the pandemic has strengthened, so must our efforts. And so, with that, I now recognize the ranking member of the committee, The gentleman from North Carolina, Mr. McHenry, for 4 minutes.
Well, thank you. Thank you all for being before the committee and behind these salad guards that we've arranged for you. Good to see your smiling faces behind your masks. But I'm grateful that we're able to assemble. This is certainly a large undertaking for the second largest committee in Congress. And I do want to commend Chairwoman for those efforts so that we can actually have this hybrid hearing. I think it shows that Congress and our government are still working, even if we have to do so using technology. Thank you all for your response and your active response since this crisis began. So I want to say, first of all, I believe the Fed and Treasury's decisive actions prevented the worst of the economic catastrophe. But there's still much work to be done. It's important to remember this is not a crisis that was caused by irresponsible choices by any specific industry or corporation. What we've seen is the impact of a voluntary shutdown of our economy and an effort to save lives. The Bipartisan CARES Act directed both the Treasury Department and the Federal Reserve to stand up responsible programs that would have been unthinkable even months ago, and to do so quickly, and you have done so rather quickly. Now that many of these programs are up and running, we must be forward-thinking to seek solutions to return us to the roaring economy that we experienced right before the global health crisis. That means we need to understand the nature of what we've done and what we need to do going forward. We know the pandemic has touched nearly every aspect of our economy and every family. Facilities discussed today need to be similarly far-reaching and responsive to economic conditions, not political ones. And I know there are a number of programs that have been desired by policymakers to be company-specific or something like that. That's not the appropriate response nor commensurate with the law. Moreover, members are going to have a lot of questions about fiscal policy, which I think Secretary Mnuchin is best fitted to, and monetary policy, which Chairman Powell is best suited to. And I think the understanding of that is important for us as policymakers to experience at the beginning of this hearing, rather than to hear you defer to one another. Our role in Congress is to assess the effectiveness of existing programs, determine the goals for additional relief programs, and identify the appropriate entity to provide that relief. That's our role. Of course, we need to access the key programmatic data. And so I want to commend Secretary Mnuchin for coming forward with the type of oversight material in a massive, unprecedented way, with the type of loan level data that we requested in Congress, and to provide that in a transparent way. The thousands of pages of documents that you and your team have assembled for just this committee alone is staggering in such a short period of time. So I hope my colleagues will use this data appropriately so that we can assess these programs and make sure they're working. And so I do want to commend you, Secretary Mnuchin, for the delivery of the PPP program so effectively and so quickly. It wasn't perfect, of course, but it saved millions of jobs. And Chairman Powell, I want to commend you. You've made your word good in terms of action, and that builds confidence in the institution of the Federal Reserve, that your words actually are as good as action by the Federal Reserve. So thank you for following through on your word and your commitment. So I think there's positive news in terms of the assessment for this initial response. And I want to thank you for being here at the first quarterly oversight hearing under the CARES Act. Madam Chair, on a personal note, I would like to welcome back our friend and colleague, the ranking member of the Oversight Subcommittee, Andy Barr, from his family concerns he's been attending to. So thank you, Andy. We welcome you back.
Thank you. Thank you very much. I now recognize the chair of the subcommittee on oversight and investigations, Mr. Green, for 1 minute.
Thank you, Madam Chair. Thank everyone. It is an honor to serve under your leadership, Madam Chair. The 2019 Home Mortgage Disclosure Act HMDA data were released last week and demonstrate that unequal access to credit on the basis of race and ethnicity remains the norm in America today. This is something that we can do something about. But there's a problem. Many of the people who have the authority and who are in positions to make a difference refuse to even acknowledge that the problem exists. I have the evidence. I have pictures from prior hearings. The one to my right asks, do you believe that discrimination in lending exists? One person has his hand up. He is with the NAACP. He is African American. The 4 Anglo persons on this panel refuse to raise their hands. These are the problems that we have to contend with. I yield back the balance of my time.
Thank you, Mr. Green. I now recognize the subcommittee's ranking member, Mr. Barr, for 1 minute.
Madam Chairwoman, before I deliver my opening statement, I rise to a question of personal privilege.
Personal privilege.
Yes.
Requested.
I didn't hear it. Without objection, certainly.
Thank you, Madam Chairwoman. As you know, 2 weeks ago, I lost my wife unexpectedly to a heart condition, and I want to express my sincere appreciation to you, Madam Chairwoman, Ranking Member McHenry, and to all of my colleagues on this committee on both sides of the aisle for the outpouring of prayers and expressions of sympathy for Carol and her greatest legacy, our 2 daughters. Your friendship and kindness during this difficult time for me and my family means so much, and I thank all of you.
Thank you very much, Mr. Barr. And now you may take 1 minute, if you'd like,
Thank you.
on the subject that's before us today.
Thank you. And thank you, Secretary Mnuchin and Chairman Powell, for appearing before the committee today and for your continued efforts to ameliorate the effects of the government-imposed shutdown of the economy arising out of the pandemic. Congress acted decisively through the passage of the CARES Act and other legislation to mitigate the damage to the economy, keep people employed and businesses strong to ensure that the economy can emerge on the other side in a position for long-term growth. Congress directed the Fed and Treasury to play a critical role in the response, and throughout the process, you both have been decisive and aggressive in using the tools at your disposal and have been incredibly responsive to congressional concerns. You've made appropriate adjustments, including several.
You're muted and they can't see you right now.
Each of you personally, and there are elements of Treasury's and the Fed's responses to the pandemic that could still be improved or adjusted to honor congressional intent. I look forward to talking to you about those today, including and especially in commercial real estate. Look forward to discussing that today. And again, thank you, both of you, for being here today. I yield back.
Thank you, Mr. Barr. I want to welcome today's witnesses. First, we have Stephen T. Mnuchin, Secretary of the Treasury. He has served in this current position since 2017. Mr. Mnuchin has testified before the committee on previous occasions, and I believe he does not need any further introduction. Next, we have Jerome Powell, Chair of the Federal Reserve Bank System. Mr. Powell has served on the Board of Governors since 2012 and its chair since 2017. Mr. Powell has testified before the committee, and I believe he does not need any further introduction. So without objection, your written statements will be made part of the record. Each of you will have 5 minutes to summarize your testimony. When you have 1 minute remaining, a yellow light will appear. At that time, I would ask you to wrap up your testimony so we can be respectful of the committee members' time. Secretary Mnuchin, you are now recognized for 5 minutes to present your oral testimony.
Thank you very much. And Mr. Barr, let me express my condolences for your loss. Chairwoman Waters, Ranking Member McHenry, and members of the committee, I'm pleased to join you today to discuss how the Treasury Department and the Federal Reserve are working together to provide liquidity to the credit markets, business, households, as well as state and municipal governments. We remain committed to making sure that every American gets back to work as quickly as possible. America's economy continues to recover from the challenges posed by the COVID-19 pandemic. The jobs report for the month of May vastly exceeded expectations with a record gain of 2.5 million jobs after experts had predicted nearly 8 million loss. While the unemployment rate is still historically high, we are seeing additional signs that conditions will improve significantly in the third and fourth quarters of this year. The Blue Chip report is forecasting our GDP will grow by 17% annualized in the third quarter and by 9% in the fourth quarter. The U.S. Chamber of Commerce reported this month that 79% of small businesses are at least partially open, and half of the remaining businesses are opening very soon. Retail sales rose in May by 18%, more than double the expectation. Investors in business have historically high cash positions, the highest level since 1992, indicating that private capital is ready to return as communities reopen. We are in a strong position to recover because the administration, working with Congress on a bipartisan basis to pass legislation and provide liquidity to markets in record time. In particular, the PPP is keeping tens of millions of employees connected to their jobs. Economic impact payments are also helping millions of families and workers through these challenging months. We are monitoring economic conditions closely. Certain industries, such as construction, are recovering quickly, while others, such as retail and travel, are facing longer impacts and may require additional relief. We look forward to continued conversations with you to address these critical economic issues. Treasury has been hard at work implementing CARES Act's program. The PPP, we've approved over 4.8 million small business loans for $519 billion. Economic impact payments, we distributed nearly 160 million payments in record time. Programs to support aviation and other eligible business, we have approved and dispersed over 27 billion to over 500 airlines and other aviation business, preserving hundreds of thousands of jobs. We're in the process of documenting loans to business and critical national security for approximately $25 billion. The Coronavirus Relief Fund, from this fund, we've distributed $150 billion across states and local governments, nearly half of all in additional money to tribal governments. The CARES Act also granted Treasury the authority to provide $454 billion to support Federal Reserve lending facilities under Section 13.3. Since March 17th, using funds available, I have approved a number of Federal Reserve programs. The Commercial Paper Program, the Primary Dealer Program, the Money Market Mutual Program, the TALF, the Primary Market Corporate Credit Facility, the Secondary Facility, the Main Street Facility, the Municipal Facility, and the PPP Lending Facility. We have committed approximately $200 billion, and to support these, the announcements of these programs have helped unlock markets and promote much-needed access to liquidity. We have over $250 billion remaining to create or expand programs as needed. While we're beginning to have conversations about supplemental relief legislation, we look forward to working with Congress on a bipartisan basis in July on any other further legislation that will be necessary. Treasury has already been entrusted with a tremendous amount of funding to inject into the economy. We are closely monitoring these results and seeing conditions improve. We would anticipate that any additional relief would be targeted to certain industries that have been especially hard hit by the pandemic, with a focus on jobs and putting all Americans back to work who have lost their jobs through no fault of their own. The Treasury Department is implementing the CARES Act with transparency and accountability. We are providing information to the government-wide reporting on USA spending and updates to Congress. We're also cooperating with the Congressional Oversight Committee, GAO, and others. We are pleased that the Federal Reserve has announced plans to boost loan information on its website regarding its facilities. Chair Powell and I have had very productive initial meetings with 4 members of the Oversight Committee, and we look forward to continuing to work with them. Thank you very much.
Thank you. Chair Powell, you are now recognized for 5 minutes to present your oral testimony.
Chairwoman Waters, Ranking Member McHenry, and other members of the committee, thank you for the opportunity to testify today to discuss the extraordinary challenges our nation is facing and the steps we're taking to address them. We meet as the pandemic continues to cause tremendous hardship, taking lives and livelihoods both at home and around the world. This is a global public health crisis, and we remain grateful to our healthcare professionals for delivering the most important response and to our essential workers who help us meet our daily needs. These dedicated people put themselves at risk day after day in service to others and to our country. Beginning in March, the virus and the forceful measures taken to control its spread induced a sharp decline in economic activity and a surge in job losses. As the economy reopens, incoming data are beginning to reflect a resumption of economic activity. Many businesses are opening their doors, hiring is picking up, and spending is increasing. The economy has entered an important new phase and done so sooner than expected. While this bounce back in economic activity is welcome, it also presents new challenges, notably the need to keep the virus in check. While recent economic data offers some positive signs, we're keeping in mind that more than 20 million Americans have lost their jobs and that the pain has not been evenly spread. The rise in joblessness has been especially severe for lower wage workers, for women, and for African Americans and Hispanics. This reversal of economic fortune has caused a level of pain that's hard to capture in words as lives are upended amid great uncertainty about the future. The path forward for the economy remains extraordinarily uncertain and will depend in large part on our success in containing the virus. A full recovery is unlikely to occur until people are confident that it's safe to engage in a broad range of activities. The path forward will also depend on policy actions taken at all levels of government to provide relief and support the recovery for as long as needed. The Federal Reserve is strongly committed to using our tools to do whatever we can for as long as it takes to provide some relief and stability to ensure that the recovery will be as strong as possible and to limit lasting damage to the economy. After lowering the federal funds rate to essentially zero, our actions so far fall into four categories: stabilizing Treasury and agency MBS markets, money market and liquidity and funding measures, direct efforts to support the flow of credit in the economy, and targeted regulatory measures to support those efforts. So far, we've created 11 facilities under Section 13.3 of the Federal Reserve Act to support liquidity, funding, and the flow of credit to households and businesses and state and local governments. Without access to credit, families could be forced to cut back on necessities or even lose their homes. Businesses could be forced to downsize or close, resulting in further losses of jobs and incomes and worsening the downturn. Our emergency lending facilities have all been undertaken with the approval of the Treasury Secretary, and many are supported by funding from the CARES Act. Their status and effects are discussed in greater length in my written statement, which I've provided to the committee. The Fed will continue to use these powers forcefully, proactively, and aggressively until we're confident that the nation is solidly on the road to recovery. When the time comes, after the crisis is past, we will put these emergency tools back in the toolbox. I would stress that these are lending powers, not spending powers. I will also note that we design our facilities to work for broad ranges of businesses and municipalities. We do not target particular firms or industries. Elected officials have the power to tax and spend and to make decisions about where to direct such targeted relief. The CARES Act and other legislation provide direct help to people, businesses, and communities. This direct support is making a critical difference, not just in helping families and businesses in a time of need, but also in limiting long-lasting damage to our economy. Public faith in our operations depends on transparency. At the Fed, we're committed to that transparency, particularly in deploying our emergency powers. Thank you. I'll look forward to our questions.
Thank you very much, Chairman Powell. I now recognize myself for 5 minutes for questions. As I mentioned in my opening, the pandemic is strengthening, and so too must our response. 2 weeks ago, Chair Powell, when I asked you about the need for more congressional action to protect our communities, you said, and I quote, "There are something like 25 million people who are still dislodged from their job in full or in part due to the pandemic. I would think it would be a concern if Congress were to pull back from the support that it's providing too quickly," end quote. Unfortunately, tomorrow this is exactly what will happen if the Senate does not pass the HEROES Act. Tomorrow the PPP program stops taking new loan applications. The PPP should be extended immediately so that the remaining $135 billion in funding can support small businesses. Also happening tomorrow, millions of families will be unable to pay their rent and mortgages. In June, 1/3 of renters couldn't pay rent. 4.2 million homeowners are currently in forbearance because they're unable to pay their mortgages, and evictions have already started in many states where local eviction moratoria have expired. While the moratorium should be extended, it is not conscionable to simply delay an eviction and foreclosure crisis. Congress and the administration must provide support to struggling low-income families to cover their rent and utility payments. So, Chairman Powell, millions of families are at risk of being stripped of their home. Do you think Congress should provide financial assistance to ensure people stay in their homes?
Thank you, Madam Chairwoman. So I try to keep my fiscal comments at a very high level, and that comment you referred to was referring to the unemployment insurance that expires at the end of July. And I think for the specifics of what you need to be doing, I think we have the Treasury Secretary here, and I would defer to the Treasury Secretary on fiscal matters here.
Okay, so you put it off on Mr. Mnuchin. So while you have made some changes to broaden the municipal liquidity facility, many jurisdictions like the territories are still locked out. When we last spoke, you mentioned that it was difficult, but perhaps there was a way that Guam may be eligible. Did you find a way to take a serious look at that and determine whether or not something could happen?
Yes, we are taking a serious look at that. So the territories themselves are not investment grade rated, and they weren't before the pandemic set in, and that's the minimum standard for access to the municipal liquidity facility. Of course, businesses in the territories would be eligible for the Main Street facility. Some of the revenue-based facilities that that Guam has are investment grade rated, but below the minimum, and we're actually reviewing our credit standards in the municipal liquidity facility at the moment to determine if there's a way to adjust the facility in a way that would make eligible some creditworthy issuers without sort of violating the spirit or letter of Section 13.3.
Thank you. Secretary Mnuchin, with critical unemployment support expiring next month and today marking the last day that Treasury and SBA claim that new PPP loans can be approved, does the administration support extending these programs as proposed in the HEROES Act?
Well, we do support additional legislation, and we look forward to working with the House and the Senate on that. As it relates to the PPP, I've already had conversations with the SBA committee in the Senate about repurposing that $135 billion and think that should be done, and look forward to working with both the House and the Senate so that we can pass legislation by the end of July.
Thank you very much. I now yield to
Maybe not.
No. The gentleman from North Carolina, Mr. McHenry, is now recognized for 5 minutes.
Well, thank you. Thank you for your testimony. Secretary Mnuchin, I think there's wide agreement that your engagement in the PPP program made things largely better, right? The Treasury expertise in making sure that SBA could deliver on this really seminal program of the CARES Act. It's proven out because you got 4.5 million small businesses that have benefited from it. The average loan size is quite modest in the context for our economy, but the effect is pretty wide scale. So what would you say regarding the additional funds that are purposed for PPP? What should be our focus as policymakers on repurposing that $134 billion? How can we best do that? Is it the 7A program? Is that expedited loan programs? How do you see this fitting in, given the actions of Main Street and the other facilities you've stood up through the Fed?
Well, thank you, and I appreciate your comments. I think at the time when we passed the last CARES Act, the economy was in very difficult shape, and we needed to get money quickly. And as I'd said before, programs that took 3 or 4 months were not the focus. I think that there appears to be bipartisan support in the Senate to repurpose the $130 billion for PPP, extending it to businesses that are most hard hit, that have a requirement that their revenues have dropped significantly, things like restaurants and hotels and others, where it is critical to get people back to work.
Okay, and so that seems like a reasonable step in the right direction. Chairman Powell, the reputation you've garnered this year in particular is that your actions have been predictable, and that you signal what you're going to do and you follow through on it. Transparent, in that you lay out the metrics for action, you therefore follow those metrics. Incredible. One example is that at announcement, you said that you're going to support corporate bonds. And by saying that you're going to support corporate bonds, the market acted as if the Fed already had the program up and running, to the point where once you were up and running, people ask why you followed through on that program. Now, I think that's important to note. That transparency, that guidance, that communication has been effective in this opening stage in setting up these responses. So along those lines, the Fed took what I would call strong medicine in terms of action on the stress tests to restrict dividends and buybacks and restraints on these large financial institutions. I would call that quite strong medicine. I think what we want to understand are the metrics that the Fed is going to use in order to make these judgments and assessments sort of in this next phase over the next couple of months for these large financials.
So I think you have to start with the sort of two major facts here. One is that the banking system is very strong, has been a source of strength. The banks have been taking on a wave of deposits. They've been engaging in forbearance. They've been making loans. So they're a source of strength in this situation, unlike the last crisis where they were a source of weakness. It's also a fact that things are highly uncertain. And so to preserve that strength, what we've done is we've stopped all share repurchases and we've stopped increases in dividends. So we're preserving the level of capital in the system. So to address the uncertainty and looking forward, we did run these three sensitivity analyses, and they were really to assess the overall strength of the system in the face of these downside cases. We found that the majority of firms were still adequately capitalized, sufficiently capitalized in all of those scenarios. Notwithstanding that, what we did was that we said for the first time in the history of these tests, we said that we're going to ask the banks to resubmit their capital plans. We're going to distribute scenarios, and we're going to look at the results again as we learn more about the path of the crisis. And in terms of the precise metrics we're going to be looking at, we'll be providing more clarity about that going forward.
But based off that uncertainty, you want to you're asserting as a regulator that you will actively review this to ensure that we don't have a financial crisis as a result of this health crisis.
Yes, we're going to keep monitoring this. We're learning so much every quarter, and the path of the economy is highly uncertain. And in our system, dividends are declared every quarter. We've already stopped the overwhelming majority of distributions, so we think that's the right place to be.
Thank you. Thanks for your leadership and effectiveness, and thank you as well, Secretary Mnuchin, for your effectiveness and leadership. Yield back.
When we're sitting. Thank you. I now recognize the gentlewoman from New York, Ms. Maloney, for 5 minutes.
Thank you and welcome. Secretary Mnuchin, I'd like to ask you about a very troubling oversight issue. As you know, I'm the chair now of the Oversight Committee, and I take these matters very seriously, and I hope that you do too. In the CARES Act, we created the Pandemic Response Accountability Committee, or PRAC, which is a committee of independent inspectors generals that is charged with overseeing all of the money spent in the CARES Act and identifying waste, fraud, and abuse. Last month, the General Counsel's Office in Treasury issued a legal opinion that questions PRAC's authority to oversee trillions of dollars of CARES Act spending. To put it bluntly, this legal analysis is so bad that it borders on bad faith. The opinion claims that no evidence that Congress did not intend for the PRAC to have oversight authority over anything in the first half of the CARES Act, including the PPP program and any of the Fed's lending facilities or the $150 billion in funding for states and local governments. So I would say, Secretary Mnuchin, that this interpretation is wrong, that it is just plain wrong. Senator Gary Peters and I proposed and authored this section of the law, the PRAC Act, and I was heavily involved in negotiating those provisions in the CARES Act. And I'm telling you that Congress's intent was for the PRAC to oversee all of the spending in the CARES Act, not just one half of the CARES Act, but all of it. That was our intent, and that was what the bill said explicitly The interpretation from your general counsel's office is already causing problems because it's hindering the PRAC's ability to monitor how the states are spending their CARES Act money. So now, Secretary Mnuchin, I would say that we have worked very productively together and in good faith negotiations on the beneficial ownership bill and other bills before Congress. So I hope that you'll take my concerns about this erroneous legal opinion seriously. And so this is what I would like to ask today. I'd like you to commit to interpreting this section of the CARES Act as Congress intended, with the PRAC's oversight authorities applying to all of the CARES Act spending. I think this is a small step, but a very important one that you can take to show that you're serious about the oversight of the trillions of dollars in the CARES Act.
Well, thank you, and I appreciate your comments, and I assure you we are very much committed to working with the oversight committees on transparency. Now, as it relates to this, I can assure you it was not bad faith. I'm happy to have our office follow up with you. It has to do with a technical issue of recipients reporting. As it relates to the issue of monitoring state spending, I'm more than happy to put the PRAC in touch with our Inspector General, who has primary oversight, and make sure that whatever information specifically the PRAC wants on the states that we accommodate.
Well, I would say that that's not what I'm asking. What I'm asking is, will you commit to interpreting the PRAC's oversight authorities as applying to all of the CARES Act spending? That was our intent. I wrote that section of the law. That was what Congress wanted. There's no problem with the interpretation. It's very clear and explicit. Will you commit to allowing the oversight that was in the bill?
Well, I appreciate you wrote that portion. I would also say I appreciate I had very direct discussions with people in the Senate about various different oversight. That's why we agreed to a new oversight committee with full transparency. We agreed to provide information that was not required under 13.3. So we have full transparency. And again, I'm happy to follow up with you on the specific concerns as to which different entities should receive what information. I think it's important that there is not bureaucratic overlap. But again, let me emphasize, if the PRAC needs certain information, we will try to do what we can to accommodate it.
Well, I'm very disappointed with that answer, and I guess we'll have to pursue a legislative solution. It was very clear that the intent of Congress is that PRAC would have oversight of all of the CARES spending. I yield back. And I'm out of town. Out of time.
Gentlewoman from Missouri, Ms. Wagner. The gentlewoman from Missouri, Ms. Wagner, is now recognized for 5 minutes.
Thank you, Madam Chairwoman. And thank you for joining us today, Secretary Mnuchin and Chairman Powell. I want to commend you both from the outset here for your leadership during this unprecedented time. Both the United States Department of Treasury and the Federal Reserve System have shown their ability to both effectively and rapidly respond to the economic crisis caused by COVID-19 by providing trillions of dollars to stabilize our economy. Chairman Powell and Secretary Mnuchin, lender registration for the Main Street lending program went live on June 15th, I believe. Do either of you know how many lenders have registered so far? And do you know the average size of the lenders participating? If not, when do you think this information might be made available? I'll toss it to either.
Sure. So in the range of 300 banks, and it may be higher than that, that number is a few days old, have entered the registration process. It takes a few days, so I can't tell you exactly how many, but that's how many will come out of the pipeline.
Average size of lenders?
Don't know. The size ranges from the large to the very small, and the very small are particularly well represented, but it does range across the full spectrum.
And you will be providing this information to us on a regular basis?
We're working with the borrowers to figure out the right way to connect lenders and borrowers and lenders so they can get in touch with each other. So we're working with the lenders to put something together that will make that happen in the most efficient way.
Thank you, Chairman Powell. In your efforts to create broad-based programs, do you think that the Main Street facility will need to expand any further to meet the needs of our businesses?
Let me say as you've seen, the Secretary and I work very closely on this, and we've been very willing to learn from experience and learn from what we're hearing from different parts of the economy. So
we certainly did with the PPP program, so I would hope that we would approach this the same way.
We will. I mean, as you know, we're in the relatively early stages of opening up a nonprofit Main Street facility, and I think we'll be watching as regular Main Street fully comes online and continuing to look to see whether there are ways we can improve it.
Thank you. Chairman Powell, last week's release of the Federal Reserve's CCAR outcome and, more importantly, the results of their COVID-19 sensitivity analysis underscores the resilience, I think, of the banking system. While we can all agree that the level of uncertainty in the economy continues to be high given the progression of the COVID-19 pandemic, I believe the Federal Reserve subjected CCAR filers to extraordinary assumptions regarding.
We've heard the name, I lost you. We've heard the name of the McLean family lifted up. I want to be intentional in naming that this baby was a Mosley too. I know his family runs deep in this community, and I know some of y'all are here too. Take a moment and send your love and your warmth to the McLeans and the Mosleys and to the people who've lost their baby. Sit with whatever God you believe in and pray that we don't have to know your baby's name. When we talk about what justice looks like, and I see this on these signs, she's told you she doesn't owe us anything. She does not owe us anything. We owe her. We owe her. So when she tells us to come out at 3 o'clock on a holiday afternoon, we come out. And if she tells us to come out tomorrow, we come out. And if she tells us that she wants these killers in a cage, then that's what you lobby for, okay? But it's so important that as we lobby for justice for her baby, for the Mosley's baby, for the McLean's baby, for Elijah McClain, say his name, y'all. Say his name. Just saw a journalist say it. You snuck. You didn't mean to, but I saw it. That baby, that name as we lift it up, think really and be intentional in thinking about what justice for him looks like. We need to recognize those pictures were taken in October. It's not about a couple bad apples, y'all, right? Because bad apples come from rotten trees. We didn't need all of those cops to be good cops. We needed one of them to be a good cop. We didn't need all of them to do the right thing. We needed one of them to do the right thing in August or October or March. The idea that one resigned because he got caught in a photo, that's somehow shameful on a next level sort of way. They stood by and they let this happen, and all of that goes, when I say be intentional about what justice looks like, you cannot reform your way out of this, okay? We cannot reform our way out of this. People who tell you they want criminal justice reform in this system right now, they want kinder, gentler policing. No, we want no policing, okay? There is no such thing as a good cop if this can happen on this ground again and again. I keep seeing your sign, and it hurts. Before I pass this to my brother T-Rob, I want to implore you, invite you to consider, when we're thinking about what justice looks like, it means changing laws. It means passing bills that outlaw things like chokeholds and shooting folks in the back. But it means dismantling all of their shit. All of it has to go. All of it has to go, okay? That means you defund. That means you turn out. That means we take back our streets. We're going to do it tonight. We take back our seats. I see elected officials out here who aren't going to speak up because they know that this is the time for them to be here and listen. We love you and we thank you and we see you. We see you. But the city council needs to look like us, right? We don't need more black cops, but we do need more black elected officials. And we need black elected officials who represent our best interest, because all my skin folk ain't my kinfolk, okay? So be very clear about this. As we lobby for justice and we overturn these racist laws and we take people out of positions of power, if what it takes for that woman to do the right thing is to see this man Rosenblatt chuckling over killing the baby, then she doesn't deserve that job either, right? Me and the police union, we don't have nothing in common. But one thing we have in common is she's not the woman for that job, okay? So just be intentional and claim it. You feel me? It just is hurtful. I want to also remind you that we're going to be back here tonight, and I hope you'll talk about that a bit, because please understand, right? I would never.
All right, everybody, we have an update from Mountainside Fitness, one of the gyms that has not only refused to close down, but is also suing the state, Arizona Governor Doug Ducey. So let's listen in right here on the News Now stream.
I see that you put a stool here for me. Is that saying something about the height issues that I have or whatever? I don't know. I don't think so, because there's a good chance I'm going to move and fall. So here we go. Again, another height joke. Just here we go. Here we go, Grace. I'm gonna test. July 3rd. Can you guys hear that? With the official government holiday for the 4th of July. It's eerily quiet in here, so I don't want to delay this, but I do want to say, first of all, thank you for coming today. I think that maybe everybody thought this was going to be a slow news day. I can tell you I certainly hoped for that myself. But up until about 2 hours ago, I was truly hoping that I'd never be in this position again. A position that was kind of thrust upon us as a company, us as a community, both personally and as a business, on Monday. So I thought, through the revelations of finally today at around noon, that I would bring everybody up to date on a little history on how we got here to this moment right now. Not only here in Arizona, but what it looks like for the United States and what has gotten the attention of the world. On March 18th, as the virus took off, we were mandated to close down like so many businesses in Arizona. Like everybody, without understanding what was happening with the virus, we certainly complied. Originally, we were told we were going to be closed for 2 weeks, which ended up being 2 months. We had no idea what the future held, what the virus was in store for us, or if business would ever come back. 12 days later, we came to the realization that we were going to have to furlough 1,310 employees. As a company that has just under 1,500 employees, we also learned at the same time that we did not qualify for any government assistance to be able to move forward during the time that we were mandated to close. We did not like that. We were disappointed, but we still complied. As the understanding of the virus grew, so did the lack of understanding of the businesses that were deemed essential, that were allowed to stay open. Yet, we stayed closed. Yet, we complied. Yet, we tried to understand, and we waited for clarification, transparency, and understanding. I felt like as a business community, I started this company when I was 22 years old in 1991. We're the largest locally owned health club chain in the state of Arizona. We're home to 105,000 Arizonans and 1,500 employees. I felt it was our duty to not complain, but to help. Immediately while we were closed, we donated cases of wipes to Banner Hospital. That was a scary situation because we knew that there was a possibility if we opened, guess what we wouldn't have? But it was more important to help out the hospitals right away. We weren't done. I also felt we needed to help the actual Arizona Coronavirus Relief Fund, and even without any funding, with the stop of all income, we donated $100,000 to that cause. But we weren't done. We worked with Patients' Choice and opened up our now vacant parking lots to all of Arizona to come through and get drive-in antibody testing to thousands of Arizonas. At that same time, we were working with the governor's office on protocols in hopes of reopening and when. We worked and put together, and I was asked to put those forward to the office that included the WHO and the CDC guideline recommendations that we were given. And we put those in place. And then we waited. On May 12th, Governor Ducey announced that health clubs were going to be allowed to reopen. Obviously, we were extremely excited, but we were not ready to open on the 12th. I had to call 1,310 people and happily notify them they had their jobs back. We had to bring them in. We had to train them. We had to completely re-outfit the facilities because of social distancing. We took down every other treadmill. We created an app so you could design your spot in a group fitness room at 50% capacity. You knew where you were going to stand. We required protocols throughout the facilities. We added wipes and gels. We took temperatures of all employees and all children going into the child care. We were a leader in compliance, and we went and moved forward. I saw people who had been cooped up for 60 days breathe, literally breathe. I watched them relieve stress and feel healthy and significant again. and I was happy. Even though we weren't at full capacity, we were part of the solution in this pandemic, and we moved forward. On June 29th at 2:55, ironically, I was in my doctor's office getting my annual physical. I had a voicemail when I got done at 3:10. It was the governor's office saying, Tom, tune in to the press conference at 3 o'clock. I was in my car with hundreds of texts. I didn't know why. It was at that point I learned that we were being told that we had to close in 5 hours. I had no idea as to why. What was the reason? Why in 5 hours? Why at all? We hadn't done anything wrong. We hadn't violated anything. We were in the guidelines and the protocols that we all agreed on. Yet, without notice, proof, or reasoning, we were told, our industry was told, we were part of the problem. Go home again. Go tell 1,500 people they don't have a job again. Go let them be in fear again. And let's move forward. Deal with it. We were told that we were in the same boat as if you tubed down the Salt River, or if you were going to a movie theater, which wasn't open at the time. Go home. I at this point said no. Not because I don't believe that we're in a pandemic, that our numbers are rising. It's because I saw everything that was happening that we all saw at the same time. The lack of clarity as to who was open and why. The lack of clarity in the numbers. The placating to action without action. Blame. Arbitrary decisions. The belief that this will fix this. And I felt at that point it was time to make a stand. I was aware that if I was in defiance of Governor Ducey's order, I could be fined and possibly arrested. At this point, this wasn't about the coronavirus anymore. This became about everybody. It became about our governing, our leadership. It became about the business community. It became about who's next. What's the next reason for the next business to be closed? Why? Give us an answer, please. That's all we're asking. Give us some guidance. Give us some truth, please. We're people. We're all dealing with it. Just because we were open and I didn't want to close didn't mean I didn't care about the virus. Hell, we cared when we were closed a lot. We cared today. We cared yesterday. This was about our rights, and where it's gone too far and the arbitrary nature of this decision and where it came from. So let me tell you about what happened this week, because I felt like it was important from the inside for the world to understand where our politics have taken over and the true desire to fix this and deal with this pandemic left. The true care about us as citizens in this country. The ironic nature that today, as our government actually celebrates their day off for the independence that we as a country fought for, to get our freedoms, to get our rights, to get our ability to say no, to get our ability to be heard in court, to say that's enough, not anymore. We were with everybody in this. We still are with everybody in this. This is hard. This week, I've been threatened. I've had every police station citate me, almost every one of them. The uncomfortable situation that our police officers are in made more uncomfortable to have to come and cite us for this situation. For that, I feel truly sorry that they've been put in this position. That is simply also not fair. And they've been amazing to work with in this time. I watched as no other businesses have been closed, and I've watched the numbers. I guess we weren't the problem. I guess there hasn't been proof that we, as an industry, were the hot spot. Maybe Arizona, as a state, as so many other states, are dealing with the unknown as a unit, as a group. Maybe us, as a community, as a country, need to look at each other and say, it's not you, it's not you, it's us. How can we fix this together? Let's stop pointing fingers or hiding or making it look like we're doing something and damn well do it. That's what this needs. Not saying we're doing something about it and closing health clubs and tubing at the Salt River. We're not bringing in the director of the coronavirus task force and parading her around the state to have her get on a plane to say, you're doing a great job. Thanks for closing the health clubs. You're doing everything you can to fight the pandemic, and then watch her fly away. Only to watch the vice president come in the next day and do it again. Watch that the citations grew and the pressure mounted. I called the governor's office. I said to them, if we can work together in a negotiation, I can get all the fitness centers and studios in this state together. They want to. We still want to be a part of the solution, but you got to work with us. Negotiate me, let's work together now. They said, we're not going to negotiate with you until you're in compliance. And I raised my hand, I said, but I was in compliance, and you closed this down anyways. And I've sat for this last week, and I've watched no other businesses be closed down. I've watched the numbers. I've watched the lack of transparency in everything. I remember when Governor Ducey said, we're not going to walk backwards. I guess that didn't include us, or any reasons as to why, or anybody else. So I sit here today, the last, I would say, thrown in the kitchen sink was the Department of Health walking up to our Shade Club on 116th Street yesterday and taping up a notice to close immediately, or else I'd be in violation again and be subject to civil court and more fines. They immediately notified the AP. Calls started coming again, pressure mounted. I would ask everybody, what attention has been put on the rest of the virus since this week? Any other businesses, any other hot spots? Or is all the attention on my defiance? I never wanted this to be anything between Mountainside, myself, against Governor Ducey. I wanted it to be fairness and transparency for all businesses and us as a people moving forward in this. I wanted accountability from our leaders, and if that meant I'm going to be fined or could end up in jail, there's been plenty of great Americans who have been in this position before. I'm okay with that. I made that decision on Monday night. We are going to stay open until we have our day in court, which is Monday morning. If we are allowed a stay, we will move forward until our full case is heard. If the court does not allow a stay, we will comply and respect the court's decision. We will deal with being closed again. That's what I wanted to explain to everybody today, and I'm certainly available to take any questions at this point. Yes, sir.
First off, with this outbreak, how many of your employees have actually tested positive for the virus?
Very few.
Very few. We did get an email recently from someone who claims to be an employee saying that one facility there's been 10 employees that have tested positive at that facility in particular. Is that true? Is that the case?
I don't actually know that exact number. What is interesting, though, is that this is the confusing part, everybody, is we can get lost in, I never said, go look at my press conference on Tuesday. Did I say that we didn't have anybody that tested positive? I did not say that. I said we did. Guess what? Ask Home Depot. Ask the liquor store that was deemed essential when we were closed. The flower shop and the casino that's still open. Ask them how many employees, or does everybody want to look at us? We didn't say that we didn't have it. I think it's still happening right now. Let's talk about everybody having it. That question is a layup. Everybody has an employee that has the coronavirus, or else we would not be seeing the spikes that we do. Our protocols are in place. We are handling it as we said we would handle it, and we will continue to do so. We are not the cause of the coronavirus spike, period.
I understand you're not the cause of the spike. Obviously, it's widespread. But how are you making sure that it doesn't continue to spread within fitness clubs like this, especially for your employees?
Well, first of all, it's not in fitness clubs, so to speak. We are talking about an employee. If you want to talk about all employees everywhere, I'll have that conversation with you. We have the protocols in place. We communicate with that employee. We communicate with their coworkers who have worked around them. We have paid for the testing of the coworkers to ensure that they get tested. We've quarantined the employees that did have it. The understanding that is interesting. A health club doesn't have customers. We have members. We have the ability to communicate to everybody where they are in the floor, in a room, to take the temperatures for employees, wash hands, you name it. We have an ability someplace that we don't have, you don't see in the Safeways, in the Home Depots, in the flower shops, in the casinos. We could go on, and the bars.
How many of your facilities have had positive COVID cases?
I couldn't tell you exactly right now. Couldn't tell you.
Why not?
Because I don't have that answer.
Why not? You're the CEO.
We don't have all the results from every facility. A lot of facilities have reported none.
Have you notified your members at these facilities?
No.
Why not?
Because it's impossible to notify the public. I would say to you again, if we want to go down that road, I'll stop you right there. Stop. Ask Home Depot, are you notifying everybody that walks? I'm asking your question.
You called us here today.
I know that, but I'm answering your question.
Because I was at your gym here this morning, and you had 40 folks that were inside, only 2 were wearing masks. Why not?
We didn't require them to wear masks.
Why not tell your members that you guys had positive COVID cases in your gyms?
Because
their health is on the line. I talked to
well, hold on a minute. Do you want me to answer the question? You want to keep talking?
Please.
Okay. I'm asking for fairness from our officials. If we're in the spotlight because I said no, ask that same question to every business. Are you going around? I would ask you, please, come back to me in a week. As you've asked every business in this community, in this country, are you saying that, talking to every customer about every employee that had COVID? We are communicating to their coworkers. It is impossible for us to be able to do what you just asked, just like it's impossible for Safeway to do it, or Home Depot. Excuse me?
Don't you have their emails and phone numbers?
I cannot communicate to no understand that, just like I can't communicate if you walked into Home Depot and you went to the register. I have your receipt when you checked in.
You're asking the governor to do a true part of
I'm asking the governor for fairness. I asked the governor for fairness in his decision as to why we were closed. I'm not going to debate the science of what's happening now because that's not why we're here.
Do you not believe the numbers?
I didn't say that.
The restaurants, Fry's, a school down in Clean Creek, are all of these places notifying everybody that have been on the grounds?
And I didn't say, this has,
Every business in Arizona. It has been at restaurants. Did the restaurants shut down? Did they notify every customer?
this isn't about that today. And you asked me, do I believe the number? Of course. I can only believe what we're being told, just like you. That doesn't mean I don't believe the numbers because of how we're notifying members, just like Home Depot or a restaurant. It has zero to do with whether I believe it or not, or that we're not in a pandemic that isn't having action taken. That's the point. There is how many businesses still open that are subject to a decision tomorrow without proof or reasoning as to why they're closed and what they're supposed to do and what they're supposed to do. We are working within everything that we can do, just like you and you and you and everybody.
That they don't have masks.
Excuse me?
You haven't told your members that there are positive COVID cases
I'm-
among your workforce. Why not tell them, and why not?
I just answered that question.
Why
I
not
believe
tell
I.
them to wear a mask?
Does anybody else have another question?
Could you at least maybe post something on the front of your entrance? I mean, we're seeing people post things on the front of your entrance. You talked about how the health
Yes.
did that yesterday.
Yes.
So
We'll look at that.
And
We've been.
guys, that's not the law right now. There's been restaurants that have had outbreaks that do not notify their customers and don't put it on social media. That's the law in Arizona right now. You don't have to notify your customers.
We're trying our best, just like everybody else is. As we're being singled out and being trying to be vilified like this for that, it's changing the narrative of why we're here. How many businesses have been asked to close as the numbers that we all see have risen since Monday? Can anybody answer that question? How many businesses have you shown up at to ask those CEOs how many of their employees have it, and if they've notified their members or actually customers or patrons or what have you? The narrative is our freedoms and where this choice came from, the fairness in it, and what we're looking at for us as a community to fight this pandemic, us as a civilization, certainly as a business owner for the 1,500 people that were thrown out in our company alone, much less all the fitness industry. Yes, ma'am.
I just want to clarify what I think your sentiment is. You think the governor was under some sort of pressure to do something because of the rise in cases, and your industry is the one that suffered, and only your industry, but it didn't come with any actual data or background?
That's correct. I am aware that bars were asked to close down. I am all 3 days, I think, before us, and then this EO came in, or EA came in on Monday without any warning or any proof as to why in this. I'm also aware that nothing's happened since then. We were a part of the solution. We've given our energy and our time, our spirit, our money to this. We care about every Arizona. I spent 30 years caring about every Arizona's health.
What about Deborah Ewing, who has cancer and was at your gym this morning without a mask?
That's her choice.
I have no. Ask her when she went shopping or when she went to the grocery store. What other questions do we have? Yes, sir.
You said that obviously, are you expecting, if you don't close down by today until your Monday court date, are you expecting someone to come in and arrest you and arrest some of your employees? You did kind of say that you are willing to take that risk.
Yeah, I was willing to take it on Monday. That has not changed. I had asked and still ask for there to be a pause, and let's just let the court decide and not put it. I wanted this to end Monday. I wanted understanding on Monday, not for just Mountainside, but for fitness, but more importantly, for all businesses and the arbitrary nature of this decision so that we're all protected and can trust. And in the transparency of the numbers that we're all hearing and the transparency in the truth. So it doesn't look like we're kind of trying to do something and we're going to pick somebody out, whether it's a bar or a health club. It's everybody together. Yes, ma'am.
You've given examples as to how you are a leader here in the Valley, a lot of examples. Don't you think inviting, opening your doors, allowing people to come in and gather all in one spot, is it keeping people in this community safe?
Well, what I look at and go, it's not, it's funny. That's where it gets great because I understand that question. It's been asked, I think Chris Como asked me that question the other night, is if you're going to say, do I think that we should do something? Absolutely. But if you're going to single out, that's what we're talking about. I don't want to keep coming back to, do you think, do you think, do you think? Absolutely, I understand that question. What's getting lost in that question is everything. Do I think that the numbers have stopped? No. Do I think that everything, do we understand everything and that's just I would say, a straw in a whole field of hay? Absolutely. Let's look at everything. That's all I'm at. Everything, everybody, every business, and let's look at it and don't try and act like you're doing something and get touted from the feds that you are. Come and actually do something. We want to be a part to move forward, continually move forward. We were in compliance when we were asked to close. I would be surprised if anybody in my position wouldn't feel the same or wouldn't feel fear for themselves and their jobs. or their kids or their friends. I said the other night, what is the difference right now between the decision that came on Monday night and all of your jobs or all the businesses out there? It could be a clothing store, it could be a liquor store, it could be a flower shop, it could be any business out there, coffee shop. What is the difference in this? Are we going to do something, or are we going to make it look like we're going to do something and affect a lot of lives right now at the cost of that? That's where I'm here for.
So to be clear, you see this as either an all or nothing approach?
It always has to be. We're all in this. Arizona is a hot spot. Not Mountainside Fitness. Arizona is a hot spot. Go look at all the different states that are hot spot. This country is a hot spot. We all are. It takes everybody to look at this, not to just go pick one business. I wouldn't want this. I would be standing here if it was another business right alongside them for the same reasons. We all have to do this together. All of us in this. We have tried. We have shown. We are in this. We can't do anything more. And to say to me, we won't talk unless you get in compliance, I say to them, we were in compliance and you did not talk. You just closed us down. If you want to do that again, I'll pick up the phone and you can talk to the 1,500 people that we're employing and tell them the reason why. Or I'm sorry, the lack of the reason why you're being told to go home. And then sit there and communicate with them as they watch the numbers of our state continue to grow and grow. I appreciate everybody's time and energy in this. I certainly was not looking for this. We simply just wanted to stay open, wanted to understand, communicate, and work together. That has not changed. That has been communicated over and over. It will be communicated going forward. I have all my sisters and brothers in the fitness community that want to do the same thing. I have that same support with all the business community. We are a community. The Valley, Arizona, the United States. This is our country. We have our rights to communicate, to trust, to request, to demand fairness, our rights, without the pressure that we have seen today. This is real. And the virus, whether Mountainside closes tomorrow, we're all going to wake up with the same numbers that we believe or don't believe. I thank you guys for your time. I appreciate it.
All right, everyone, again, that was Mountainside Fitness CEO Tom Hatton, not backing down, not closing gyms, instead waiting for a court ruling on Monday, a stay as to whether or not the gyms can remain open. Hey, President Donald Trump is headed to Mount Rushmore. I'm trying to show you all. There you go, right here, live picture of Mount Rushmore. I have never been, but it absolutely positively looks gorgeous. Definitely a sight to see here in the United States. But anyway, it was while Mr. Hatton was speaking that President Trump and the First Lady Melania Trump departed Joint Base Andrews. I think it's called JBSA. Let me check here really quickly. Nope, just Joint Base Andrews. Again, headed to Ellsworth Air Force Base in Rapid City, South Dakota. So we've got the departure. It's not live, but I still want to show it to you right here on the News Now stream. All right, everyone, it appears there was no audio with this feed, so I'm going to try to find a different source for it, but if I can't, I will try to play something else at the same time so that we can listen to it while we watch this departure. Again, this was just moments ago. So what I'm going to do is I'm going to play a coronavirus update from our sister station, Fox 511, at the same time that we watch this departure. Again, hope you all are having a great holiday weekend. Feel free to let me know on the YouTube chat if you are already off, if you're enjoying some time with family, friends, or if you happen to be working still. A lot of us are. All right. Oh, actually, we might have a live event that just popped up that I can show you at the same time here as President Trump's departure. Viewer discretion is advised. I do see somebody without a shirt on before I take you there. I'm waiting to get some more information, but we can at least listen in while we watch this tape playback of President Donald Trump from moments ago. All right, so it appears that several groups led by Native American activists are protesting in South Dakota as President Donald Trump and First Lady Melania visit the state for the Independence Day celebration event right there at Mount Rushmore. So again, I'm trying to find a source that has the audio from this departure. It was not live. It's not live now. It came down moments ago, but still there's the beast. Gorgeous sight to see for sure. Secret Service there. President Trump and First Lady Melania Trump about to get on Air Force One headed for South Dakota. So let's get to what I was talking about, to the update from our sister station, Fox 5 in Atlanta, while we also watch the departure here.
We begin tonight with troubling numbers in Georgia in the fight against COVID-19. The state reports a record-breaking 3,472 new cases in just the last 24 hours. Good evening. I'm Russ Spencer.
And I'm Courtney Bryant. Thank you for joining us tonight. That brings the total to more than 87,700. But we want to take a look at hospitalizations tonight. Health officials say that is a key indicator in tracking the virus. The number of patients has steadily increased over the last week, and tonight there are more than 1,600 people in the hospital. That's 225 more than yesterday.
Now, Gwinnett County is still the hardest hit county in the state, reporting more than 250 new cases today. The infection rate there around 12%. And the growing problem in Gwinnett has caught the attention of the U.S. Surgeon General. Jerome Adams met with the district health director of Gwinnett, Newton, and Rockdale counties today. Part of what they're calling CRAFT, or COVID-19 Response Assistance Field Teams. Those are teams being deployed nationwide to locations experiencing a surge in cases. Now, Dr. Adams says the most important thing residents can do is to wear a face mask.
Wearing a face covering or a mask is not a restriction of your freedom. As a matter of fact, this is an instrument of freedom, because we know if we have less spread of disease in our communities, more places will be open, more places will stay open. If we don't wear face coverings, we will lose freedoms because more places will have to close.
Dr. Adams also spent time with Governor Kemp today on his tour to encourage Georgians to wear masks. The governor ended his 6-stop tour tonight after traveling across the state for 2 days. While he has not issued a mandatory face mask order, Governor Kemp is pleading with residents to do the right thing.
Meantime, the Georgia Coalition to Save Lives is calling for residents to wear masks, and they're taking it one step further. Attorneys from the group have drafted a mask ordinance for cities to adopt. They hope leaders will follow Savannah's lead and adopt mandatory
I think we will have a V-shape. If you look at what's going on, if you look at the numbers all over, I think we're going to have a very strong V-shape. And I will see you on the airplane. Thank you. I'll see you on the airplane. Thank you.
Very brief remarks there from the president, everyone, but there does appear to be audio on the stream here now, so I want to continue to listen in. Again, this is Air Force One departure from Joint Base Andrews, headed to South Dakota, and then I will continue to play our sister station, Fox 5 Atlanta's coronavirus update here in just moments. And just like that, we lost audio here to the Air Force One feed. That's all right, everyone.
Those 20 states that have mask requirements have seen a reduction of 25%. And those states that have a mask recommendation, Georgia being one, have seen an increase in infections of 84%. Masks matter.
Around the country, 5 states alone report a combined 28,000 new confirmed cases in the last 24 hours.
All right, take a look at this map. Those 5 states are highlighted, including Georgia. It's the first day that Georgia is reporting more new cases than Arizona. And you can see California has only a slightly higher number of new cases than our state. For the first time ever, Florida reported more than 10,000 cases in a single day. And in Texas, the governor has issued a mandatory mask order. All of those states, including Georgia, are now on a list. Anyone traveling to Chicago will have to self-quarantine for 2 weeks. The city joins New York, New Jersey, and Connecticut in issuing that travel advisory.
The Cobb County Board of Education voted today to delay the start of the school year until August 17th. School was originally set to restart on August 3rd. Officials say delaying the start will give students, parents, teachers, and principals time to prepare as district staff reviews updated health guidelines. All staff members will still report on their regularly scheduled date. The start date for Fulton County schools is also delayed. Now some students are demanding leaders do more to keep them safe.
Yeah, the district announced its plans to reopen next month, and as Fox 5's Brian Hill reports now, some students call the plan careless.
There are at least 2 student petitions online demanding additional safeguards on campuses, but the main thing for one Milton High School student is making masks a requirement for everyone.
I think it was very careless and not thought through well enough.
On Monday, school leaders announced only staff will be required to wear a mask on campus. Students catching the bus will also need a face covering during their ride. Rising junior Michael Rainwater created this petition in response.
So without a mandate on masks, students are more apt to not wear them. And there's going to be massive spreading, in my opinion.
Fulton's superintendent says he's following CDC recommendations. The district will teach students the importance of wearing a face covering.
I believe that we are better off influencing through the power of relationship than requiring.
The most recent numbers from the Georgia Department of Public Health shows more than 7,500 confirmed cases of COVID-19 in Fulton County, the second highest number in the state. And it ranks the highest in COVID-19 related fatalities with a total of 314 deaths.
Everything that we are communicating today is our intent as of today, but is completely dependent on what the data says.
FCS is offering both virtual and in-person learning for students. Classes will resume a week later on August 17th, giving teachers more time to prepare. Rainwater says he will likely continue with online classes.
The schools are not safe.
His petition, which includes 15 safety recommendations, has more than 530 signatures. We have a link to Rainwater's petition on fox5atlanta.com. Coming up tonight on Fox 5 News Edge at 11, I'll explain what other safety measures students can expect when they return to class next month. Brian Hill, Fox 5 News.
Brian, thanks. A former Republican presidential candidate, Herman Cain, is in an Atlanta area hospital tonight after testing positive for COVID-19. According to a statement on Cain's Twitter account, the 74-year-old found out Monday he tested positive. Just 2 days later, he was admitted to the hospital. The statement also says Cain is not on a ventilator. We have all the latest developments about COVID-19 and the pandemic on our website, fox5atlanta.com, or you can download the Fox 5 mobile app to get updates straight to your phone. More than 35,500 residents at senior living homes have tested positive for COVID-19. That's according to the latest data from the State Department of Community Health.
Nearly 500 facilities have confirmed cases, and that now includes the Atria Center in Buckhead. As Fox 5's Morse Diggs reports, the 5 people infected include staff members as well.
If COVID-19 struck your workplace, it's likely you'd be nervous. Well, staff members contacted me expressing concerns about the residents.
This week, staff and families of clients inside Atria, a senior center, received the news. There are 5 results, tests for COVID-19, that came back positive.
I'm like, what's going on? And you got all these people walking around because they be going in and, they be going in and out the residents' rooms.
That reaction from one of the Atria employees who has especially warm feelings for one of the elderly clients afflicted with the virus.
I'm so afraid because, one of the ladies that tested positive, and she's so sweet, and I know she's 90-something years old, and these residents not going to be able to fight that virus.
How many residents were you told so far had tested positive? How many?
3.
In addition, 2 of her colleagues also got the same news. When coronavirus comes into a workplace, it can put everyone on edge.
I have to come to work. I have bills. I have to take care of my household. And I'm just afraid because, today, it was just so much going on.
Management responded, "We adhere to strict protocols when interacting with and assisting these residents. Our primary concern right now is supporting our residents and staff and doing everything in our power to keep them safe." Management here told me that they have let the health officials with the government know what's going on, and there will be retests. From Buckhead, I'm Morse Diggs, Fox 5 News.
Female business owners of color have a chance to win several thousands of dollars to invest in their companies.
An organization that normally hands out business loans is now providing grants. News Edge reporter Alex Whitler spoke with the women behind the effort.
During a time like this, there are plenty of businesses in need. The woman behind the organization Count Me In is willing to hand out $10,000 and $25,000 grants to stellar female entrepreneurs. Here's a tip for anyone filling out that grant application. Make sure you answer these questions.
How are they going to get their customers to come back if they've been closed for a while? And how are they going to offer customers things they need right now?
In other words, Count Me In owner Nell Merlino wants to know the women who win several thousands of dollars to grow their businesses will give back during the pandemic.
They're required to give us their mission statement. They make a 2-minute video about what they would do with the money and how they would sort of pay it forward.
Free money always sounds too good to be true, but with 20 years of experience helping women in business, Merlino's goal is to revive, reinvent, and rally minority and women-owned businesses.
We're looking for businesses that believe that they can keep going if they had some help.
Merlino is the brain behind Count Me In, which is an organization that normally offers business loans to driven women. This year, competition owners won't have to pay that money back thanks to a grant from a company called Smart and Sexy. There are 15 $10,000 grants up for grabs and another 4 $25,000 grants available. Right now, at least 600 people have requested an application from the Count Me In Revival website, but only 10 have completed it.
To figure out how can women get more access to the capital that's out there.
Veteran Vernice Flygirl Armour has a consulting business in Atlanta. She's worked with Merlino supporting up-and-coming businesses for years. She says the Atlanta Metro has a diverse pool of entrepreneurs who could stand to win a grant.
If the odds were 1,000,000 to 1 or 1 to 1, I would still urge you to apply in the same way because somebody's going to get that money. Why not you?
If this is something you're seriously interested in, you have until July 8th to complete your application. We've listed all information about it on fox5atlanta.com. Alex Whitler, Fox 5 News.
2 civil rights organizations have filed a lawsuit against Sheriff Victor Hill and other top leadership at the Clayton County Jail.
Attorneys claim the jail has done very little to protect inmates from COVID-19. They tell News Edge reporter Claire Sims they hope a judge will step in to get some of those inmates released or transferred.
The attorneys who filed that lawsuit say what happens inside this jail doesn't just impact the people being housed here, but the entire community.
This is a jail where you have cancer survivors and other people in fragile health crammed 3 to a 2-person cell, wearing pieces of torn underpants over their faces.
Attorney Sarah Garrity with the Southern Center for Human Rights calls the response to coronavirus inside the Clayton County Jail completely unacceptable. She and ACLU of Georgia attorney Kosha Tucker have filed a federal lawsuit against Clayton County Sheriff Victor Hill and 4 others, claiming they've failed to protect the estimated 2,000 people held inside the facility.
Many of the people who are in the Clayton County Jail and in these pretrial holding facilities in county jails all over the state of Georgia are there and have not been convicted of a crime. They are presumed innocent, and many people cannot get out of custody because they don't have the amount of money that's required to buy their freedom.
They say jails pose unique risks for the spread of the virus because people share living space, toilets, showers, and other equipment. And while many jails across the state have reduced their populations in response to the coronavirus outbreak, the Clayton County facility remains at almost 100% capacity. According to the lawsuit, more than 45 people at the jail tested positive for COVID-19 as of June 11th, including 13 staff members. They also allege jail officials have told detainees to fashion towels, socks, and underwear as face masks. The lawsuit names 4 current inmates at the jail, but attorneys want a judge to order the release or transfer of anyone at the facility who is in high-risk categories for the virus.
People in jail are mothers, fathers, brothers, sisters. They are members of our community, and none of them were sentenced to die of a contagious illness while they are in custody.
Late Thursday, the sheriff's office legal advisor sent out a statement in response to the lawsuit saying there is no outbreak of COVID-19 in our facility. The media has falsely exaggerated the facts to suit their story. As the legal advisor for the Clayton County Sheriff's Office, I have reviewed the allegations in the lawsuit, and we will vigorously defend against this lawsuit in a court of law, not in the press. In Clayton County, Claire Sims, Fox 5 News.
All right, everybody, we have a mall lockdown and we have somebody who's about to start talking about it. So let's listen in live.
Units continue to arrive here as this investigation is far from over. The suspect still on release.
Turns out this is in Braintree, Massachusetts.
To be cautious, you can imagine the nerves and how frightening it is to hear that the law is going into. You can imagine the nerves when the order came to shelter employees due to a man and dog inside the Ambassador at the time. About 1,600 people. So it was very orderly when they were issued into a storage room used by design.
Yes. Alrighty, thank you. Okay. Where are these? I'll just talk and you tell me when to shut up because I won't be able to count.
All right, everybody, this reporter is speaking to her producer live here. She does not know that she's currently streaming. That's why we always say viewer discretion is advised, but we are about to get a live update on a mall lockdown out of Braintree, Massachusetts. Again, she's speaking to her producer. She's preparing to go live. We appreciate all of our sister stations for providing us these feeds. And it looks like they just switched it on us. All right, so change of plans. Here's a live look at Mount Rushmore. We are now going to take you out to our sister station, KTVU Fox 2, that did a coronavirus special for us.
Well, just tell us how has your craft jewelry business and the business itself been affected by the coronavirus the last couple of months?
It has been affected a lot. Basically, the way I normally do business came to a total halt. All stores were closed and all events ended, which is about 90-95% of our sales. So I had to switch gears and do online a lot more.
And online was how much of your sales prior?
Most months, probably like 3% more in November and December. But since everything's made abroad, it just didn't make sense for my business to really push online.
Yeah. So you've taken a bit of a hit.
Yes.
Yeah. And you used to advertise, I guess, on Instagram as well, what, once a month? That's changed a little bit, right?
Yeah. It used to mostly be just advertising for people to come to events. And now that's really the only way to get sales is advertising almost every day.
Yeah. What do you think lies ahead for the craft jewelry business?
Well, I think that it'll probably be not till 2021 that things are back to normal. There are some events that are happening in other parts of the country where people are wearing masks and being very careful, but I don't think people are risking going out to those very much because there is a risk. People are doing virtual events, but again, those are not very successful. So yeah, I think people have been hit pretty hard, and I know people who are just totally putting their business on pause, and I hope that they'll pick it up again. But yeah, it's hit pretty hard. Luckily for people are getting unemployment checks, and that's really helping. But yeah, I have known people that have had to quit.
Well, in the midst of all this, you're doing a lot of good in India for about 14, 15 women and their families. Tell us about the Didi Jewelry Project, which you kicked off years ago.
Yeah, so the Didi Jewelry Project, I started in 2012, and I work with an NGO there for helping families that are affected by HIV. I design all the pieces, and then I teach them to make them, and the money goes back to them. And yeah, they're just a really great group of women, and it's really great to work with them. And yeah.
And you made a trip back when you were younger, I guess, and was really impressed by these people, right?
Yeah, that was my first time traveling abroad with my family when I was 16. And I was just, shocked at the poverty. I'd never really seen that, but also at the huge hearts that the women I now work with and the people I saw had, even though they had so little. And that was pretty inspiring. And
what's it do for your heart to know that you're doing something so great for families back in India?
It warms my heart. It makes me feel really good to be able to do something I love, making jewelry, and share that with these women, and then in turn help them provide for themselves. And they have a sense of confidence, and they feel really good now that they have a skill and they can provide for their family. So yeah, it feels good.
And you were back there not long ago. How have they been affected by the coronavirus?
Yeah, I was back there in March, actually, right when the shutdowns happened. And they're now open again in India, but the numbers where they are in New Delhi are going up every day. So they're pretty scared to go out into the world. All of them, someone in their family or they themselves are HIV positive. So it's not, they don't want to go out and do things. So it's scary times, but they're in high spirits and everyone's healthy. So that's good. But yeah, it's scary times.
What lies ahead for you here locally, making jewelry, making a living?
I'm pushing on doing online stuff a lot more. And luckily, I have some catalogs that I work with, like Dharma Trading Company and Peruvian Connection, who they primarily sell via catalogs and online. So hopefully those things will work out. And some stores are slowly opening. So just keep on pushing through, and hopefully things will look up.
Yeah. Do you have a feeling some of your fellow jewelry makers might end up doing something else because of this? Just too much?
Yeah, I think so. It's hard to keep going, especially when you're on your own. You don't have a support system, and a lot of the other jewelry makers and the other people I meet at craft fairs, they're a one-person team, and so it's hard, even with things like, even if they're open up and getting orders, like their supplier might not have the beads they need or the stones they need. So yeah, I think some people definitely are gonna stop making jewelry, but luckily almost everyone I've talked to has been able to get unemployment checks, so that hopefully will hold them out.
Yeah. Talk about the jewelry project again, but give us kind of the nuts and bolts, how it works. What exactly? Tell us about that.
So I design all the jewelry, mostly from my office. And then I go there and I teach them to make it, and they make it all, and then they send it to me, and I ship it to stores or at events or online. And these women are women that I met through my partner, Vanita, who runs the NGO. And none of them knew how to make jewelry before I met them. And some of them are really good and amazing and fast, and others don't take to it quite as well. So there's a range of jewelry that's pretty simple to ones that are pretty complicated, because the goal is to help whoever needs help. And some of them are really talented, and some of them it's a little bit more difficult.
Mm-hmm. And what are they making?
Earrings and bracelets and necklaces. Here are some earrings. These are woven. This is a macrame bracelet. So it's not metalsmithing, but it's all bead weaving, macrame, wire wrapping, that kind of thing.
Yeah. And I can just only imagine when you go there, you must be a rock star. They must be very appreciative.
Yeah, they are. And I'm appreciative of them. You know, they work really hard, and it's really cool to see them all feel confident in making things. And some of them have started designing some pieces that they show me, and that's fun. And they've all become friends, which is really cool because they're from different backgrounds, different castes. Some of them are Muslims, some of them are Hindus, some of them are Christian. They normally wouldn't be friends. So it's really cool to see that they've become really close. And yeah, it's great.
All right, everybody, we're taking a live look at Mount Rushmore, and that's because the White House is providing us a live feed of the celebration going on right now. Again, there is music being played, the 4th of July Independence Day celebration, showing the crowd as well. This video, this stream that we're going to be showing you live, courtesy of the White House. President Donald Trump is not there yet.
Well, I swear what it means at this moment. You mean every day. Everything to me. Let me just take 1 second to introduce these fantastic musicians to you. Over here on tenor sax, please put your hands together for Technical Sergeant Ron Glenn. On alto, Senior Airman Joe Ruley. Leading the horn section over here, this is Staff Sergeant Andrew Fowler on trumpets. And my girl, oh, my sister right here, please put your hands together for A1C Sally Tepper. Laying it down on the bass, Master Sergeant Jason Crow. Keeping us honest, doing such a great job. Give it up, Staff Sergeant Tyler Kennemer.
Ladies and gentlemen, Gib Young portraying Teddy Roosevelt, our 26th president.
I am delighted to be here with you folks tonight. Retired presidents such as myself are always glad to see an audience. We like the attention. I am delighted to be here in the Black Hills, the beautiful Black Hills of Dakota, and to share this time with you. The good people of the National Park Service have asked me to join the program and say a few words to you folks today. Well, that's impossible to say a few words. I'm a politician by heart and by profession. I can't say just a few words. No politician can. Extend your hand to me and I'm going to shake it. Hold your baby up to me and I'm going to kiss it. Show me a soapbox, I'm going to stand on it and give you a speech. However, I'm not running for re-election this year, and so my speech shall be short and easy on the ear. This is a beautiful flag, is it not? I have always, as you have felt that way from my earliest remembrances of it. I do not believe there is a more beautiful sight anywhere than to see that flag flying against a clear blue sky in the breeze. It's a marvelous flag of history and hope for the world. I glory in the 13 stars and, or rather 13 stripes of our 13 colonies. I'm proud of the stars that represent the states of our republic. I think the blue field, to me, is symbolic of boundless hope and optimism. I've always loved this particular flag and what it has meant to the country. In November of 1889, North Dakota and South Dakota came into the Union on the very same day. North Dakota's the senior by a couple of hours. Later that month, Washington and Montana came into the Union, added their stars to the flag. You might find it interesting to note that all four of those states came in under the administration of President Benjamin Harrison of Indiana, who was the grandson of William Henry Harrison of Virginia, and who, as president, Mr. Benjamin Harrison, gave me my first job on the national level. I've always felt that, well, American history kind of rolls over on itself. Now, Oklahoma was the only state that came into the Union during my administration. November of 1907, the Indian Territory and the Oklahoma Territory merged together to come in as the 46th state. Now, some members of my own Republican Party wanted to have two states instead of one. They felt that, well, we might get, and probably would get, more Republicans in Congress. However, I said no. The business of the government of the United States isn't to manipulate things so one party has power over the other. Our framers, those men who created our Constitution, did a pretty good job on their own, and by golly, I think we'll stay with them and what they have done. My successor, William Howard Taft, saw New Mexico and then Arizona come into the Union, add their stars to the flag, and thus filled up the continental United States. Since then, I'm told that Alaska and Hawaii have joined the Union. And aside, the city of Fairbanks, Alaska was named after Charles Fairbanks of Indiana, who was my vice president. By the way, you can use any of this for any trivia contest you get in at home. There were 45 stars on the flag on July 1st, 1898. That's the day that I led the 1st United States Volunteer Cavalry up San Juan Hill. You may know that unit more as the Rough Riders, Roosevelt's Rough Riders, which was kind of unfair to Colonel Leonard Wood, who was the original colonel of the regiment, but it was pretty good for Theodore Roosevelt to have him called that. The newspapers, they like to sell papers, and so by writing about the exploits of the regiment they gave the name to, they thought they'd sell more papers. If you read those papers, you would get the idea from time to time that it was the 1st United States Volunteer Cavalry that won the Battle of San Juan Hill. Not only that, won the campaign in Cuba. Well, this is not really correct. We did a good job. I had the honor to lead those fine fellows from mainly New Mexico, Arizona, and Oklahoma up that hill, but right along with us went the other 5 regiments of the Cavalry Brigade, the 1st, the 3rd, the 6th United States Regular Cavalry, the 9th and 10th U.S. Cavalry. You may know those fellows as the Buffalo Soldiers. When we went up the hill, I was leading men from all walks of lives, all classes of people, from everywhere across the United States, and I gloried in the fact that they were all American soldiers. And they went up the hill step by step together. If you had asked one of them which regiment planted their flag on the top of San Juan Hill first, well, they'd say, all of them would say their regiment did. And that's great. That shows the esprit de corps, the elan that the American soldier often shows before any foe of these United States. I was proud as punch to lead these all-American men up that hill that day. And when I say lead, I mean just that. American officers don't say, go up that hill and I'll follow later. No, no. American officers say, follow me. And off they go. And they should, because it is no other way to put it. It is born within us, this act of leadership. We Americans seem to be born with an ability to lead the world. We have an innate sense that when a crisis happens or trouble happens, if there's Americans around, we're going to step in to do something. Let's don't sit around. Let's get the job done. There are things to be done. By golly, follow me. Well, in all my life, I never felt that I had any spatial ability than any other American man ever had, except perhaps in the way of leadership. I always wanted to be a leader, never a follower. I always wanted to be an original, never a copy. And so the theme, as you may guess, is leadership. Now, in any government body, be it a nation, a state, a county, city, there are communities, and these communities give strength and value to the whole body. The stronger the community, the stronger the state, nation, county, whatever. And we have to have community. We all live in community. None of us lives by ourselves. We have to survive within a community. Now, I don't want to hear any of you out there say that, oh, I live 40 miles from the nearest town. I live 10 miles from my nearest neighbor. I don't want to be any closer than that. I'll get by perfectly well on my own. Well, that's nonsense and poppycock. We are all body into a community. We all need those things sometimes, somehow, somewhere that a community provides. The more healthy the community, the better it is for the individual. It may be medical, it may be educational, it may be spiritual, it may be agriculture. But we do need what comes as being a member of the body. Now, if your house catches fire, I cannot believe that anyone out there would say, well, I can put it out myself as a one-man bucket brigade better than I could that if many hands in a community come and help me do it. If there's a blizzard and the elderly, the infirm, the young are snowed in, you have to agree It is better off for those people if there are others in the community willing to come and check on their well-being. Try to build a bridge over a small river. It's a hard thing to do. And within the communities, there are sub-communities. Your churches are communities. Your businesses are communities. Your school system is a community. It is always better to stay within a community. Now, when things do tend to get better, when people are willing to cooperate, there's a willingness to give of time and labor, sometimes money, for the benefit of the whole community. We all benefit from that. We are all better off by, going along and seeing that the community grows and thrives. Now, within that community, we're talking now about volunteers. It is a rich community that has people who will volunteer on a regular basis. But even those volunteers, whether there's 10 or 100 of them, they need a leader. They need someone to say, here's the problem, let's get to it. So we're looking for that ability which every American has. We want to see something get done, and we want to do it as quick as possible. It's in our nature. Now, along that lines, there's a couple of points that I need to share with you. At some time, if it hasn't already happened, it will happen. Someone in your community will come to you and say, we need you to take this post of leadership in this project we're doing. Already happened. It will happen. Someone in your community will come to you and say, we need you to take this post of leadership in this project we're doing. Can you be a president, vice president, secretary, treasurer, chairman? And you're going to demur and say, no, that's not for me. I'm not really a leader. And then they'll come back and they'll say, oh, it's an easy job. There's nothing to it. We just need somebody to put in that position. Don't worry about doing anything. Just say you'll accept the post. Well, if that's the case, turn it down. Don't take it. Refuse it. There's no satisfaction to be gained from achievement on a post like that. If the definition is the job is so easy that even you can do it, you don't want that job. A leader demands, I shouldn't say demands, I should say asks, that the task be worthy of them, that there's some effort in it, that, it's not just something to snap your fingers over, it's something to think about and put together. A leader wants success for the community, not for himself, not self-aggrandizement. A leader wants to deserve the success that they make. A leader wants to work hard at work worth doing. And so we can all be leaders. You may not think you can, but you can. There's only two things that you need to be a leader of any sort. One, you need vision. You have to have an idea of where you're going. What does the goal look like at the beginning? What will the goal look like in the end? What will the road look like? Will the road curve? Will it be straight? Will there be an obstacle? And if there is, how shall I handle it? What shall I do? Do I quit and walk away? Or do I back up and then come at it again? And I'm telling you right now, that's the American spirit. That's the American nature. We back up and go at it again. We do not let things defeat us. The other thing you need, quite honestly, is courage. The courage to believe in your project. The courage to believe in yourself, the courage to be able to tell people what it is that you set as a goal, the courage to invite them to come along. This is where I'm going. My destination is the moon. Come and join me. Make them excited about it, but believe in yourself, because in most cases, you will know more about the project, the goal, than anybody else. And if you feel you don't have all the facts you need to drive on to the goal, well, get busy and learn them. Get off your tail and get to work on it. Don't sit around and wait for somebody to come and rescue you. Get action. Now, one last thing. Do not worry about being criticized. You will be. In the long history of mankind, there's been no great leader who has not been severely criticized. Even these four individuals that are sculpted behind me. Criticism is a part of life, so don't worry about it. There's not been one project in any community anywhere that upon its proposal has not been criticized. There's a fine library in Rapid City. There's two very good high schools in Rapid City. When they were first proposed, I will guarantee you that critics came out of the woodwork to tell them why they shouldn't and couldn't be done. Oh, we don't need to spend money on a library. Nobody reads anymore. Oh, a new school? You've got to be kidding me. My great-grandfather went to the log school down the road, and my great-grandson could go there and get the same education. They're critics. They don't have an alternative. They just feel it's their duty to get in the way of progress. They're naysayers, muckrakers. They're grumps of all sorts. They do not let life go on because they feel happy when they get in the way of the good works of others. Now, there will always be critics. You have to remember that. For every endeavor, there will always be critics. But it is not the critic who counts, not the man who points out where the strong man stumbled or where the doer of deeds could have done better. The credit belongs to the man who is actually in the arena, whose face is marred by the dirt and the sweat and the blood, who strives valiantly and errs and comes short again and again, for there is no effort without error and shortcoming. But he actually strives to do the deed, for he knows the great enthusiasms, the great devotions, and he spends himself in a worthy cause. Achievement. And at the worst, if he fails while daring greatly, so that his place shall never be with those cold and timid souls who know neither victory nor defeat. I am telling you right now, as I leave the stage, be a leader, be a volunteer, but live life to its fullest. God bless America, and may he always continues to God bless this country. Thank you.
I am delighted to have this opportunity to be with you today. I must say, when I was leaving the executive residence, my secretary came up to me and he said, "Mr. President, you realize that Secretary of War Stanton thinks you're a blame fool for going out there just now." I said, "Well, hey, if Stanton thinks I'm a fool, I reckon I must be one. He knows more about those things than I do." But I am delighted to be here. I must say, my friends, in the midst of unprecedented political difficulties, we do have cause this day to give thanks to the Almighty, who has instilled in us the will, the determination, and the fortitude to carry on in the midst of an unprecedented civil war. My friends, I believe that we of this Congress, I am delighted to be here. I must say, my friends, in the midst of unprecedented political difficulties, we do have cause this day to give thanks to the Almighty, who has instilled in us the will, the determination, and the fortitude to carry on in the midst of an unprecedented civil war. My friends, I believe that we of this Congress, this administration, this generation, are going to be remembered in spite of ourselves. There's no personal significance or insignificance that is going to spare any one or other of us. War is a terrible thing. Any crisis, whether got up by designing politicians or a real crisis, can change the entire temper of our time. But war stirs up passion. Sincerity is questioned. Hot blood grows even hotter and is now spilling. All confidence dies. Suspicion reigns. Even the best war is a terrible thing. And I think this particular war of ours is one of the most terrible. It has destroyed businesses in many families. It has disturbed business in every single, not families, in every city. And it disturbed businesses in almost every city. It has separated families. It has destroyed property. It has created a national debt of unprecedented proportions. It has brought mourning to nearly every home until it could literally be said that the heavens are hung in black. Now, my friends, it's with feelings of great diffidence that I meet with you today. I realize that in times like the present, one should not utter anything for which he is not willing to be responsible in time and eternity. And I have no misapprehension that I have been invited here without regard to politics or party. I do not understand that I am standing before you because of any personal qualities of my own, but simply because I represent the majesty of this great nation at this time. My friends, I think it's true, and I can say this without any mock modesty, that I am probably the humblest individual to have ever been elevated to the office of the presidency. But that being said, I think I have been imbued with a more difficult dilemma than any president that me. No one ever expected.
All right, everyone, the people providing us this feed, they're having a little bit of weather because it's called rain fade every time we lose it like this. So I'm trying to find another way to get this to you. It's courtesy of the White House. I'm trying to see if they are possibly live on Facebook. It doesn't appear that they are. They do have their own YouTube page, though. Essentially, I'm trying to find another way to get it for you because it looks like they're experiencing some weather and the signal is not getting to us, but it's a celebration at Mount Rushmore. And I'm not seeing them live on YouTube either. And the last thing they posted on Twitter was the departure of Air Force One from Joint Base Andrews. So hopefully I'll be able to get another source to bring it to you right here, because I know there's hundreds of you watching wanting to see the event ahead of President Donald Trump Again, when and if I get that, I will bring it to you right here on the News Now stream. I'm checking to make sure that it's not there anymore, and it is not. So again, what I'm going to do, I'm going to take you out to the United Nations, well, courtesy of the United Nations. It turns out that the World Health Organization, better known as WHO, provided a pretty lengthy update yesterday on the coronavirus. It's called COVID-19 Update Research and Development. So we're going to watch that until I get another live feed from Mount Rushmore. But again, today is the observance of Independence Day because the holiday falls tomorrow on a weekend. So again, taking you out to the WHO coronavirus update from yesterday, thanks to the United Nations. And then when I get another live picture from Mount Rushmore, I will take you back there.
All journalists and our speakers, I'm Fadela Shaib, WHO Media Officer in Geneva. Sorry for the delay. We are here today in Geneva to brief you about the main outcomes of a two-day forum on global research and innovation on COVID-19 that has just concluded. The subject of our press conference is of great importance: update on COVID-19 research and development, the science, the health tools, and course of the pandemic. Our main speaker is Dr. Soumya Swaminathan. She is the chief scientist at WHO. We have also a panel of WHO experts ready to answer specific questions. We have Dr. Maria von Kerkhove, technical lead on the COVID-19 pandemic, Dr. Anna Maria Henao Respreto, co-lead research and development, Blueprint, WHO, Marie-Pierre Preziosi, co-lead at the research and development Blueprint, Vasi Morti, in the same department, Benedetta Allegranzi, she's technical lead infection prevention and control, and Dr. Janet Diaz, clinical care at WHO, and Peter Ben Mbarek, he's a food safety and zoonosis expert. Journalists can join us through Zoom and follow this press conference on our social media channels and platforms. Today's press conference will be in English only.
Without resources.
No simultaneous interpretation. Our apologies for that. Without further
All right, I have another live feed from Mount Rushmore. So let's take you back there, everybody. What do you say?
That we have the best form of government the world ever knew. Be justly proud. It has given us a degree of liberty far exceeding that of any other nation on the earth. Now, if we were to turn back 6 of history in those days, we would find a race of men then living, whom we claim as our fathers and grandfathers, great-grandfathers, and prosperity. You know, they were iron men. They fought for the principle that they were contending for. Their all was staked upon it. Their destinies were inseparably linked with it. They were a fortress of strength. They were the very pillars of the Temple of Liberty. But my friends, what invaders and foes could never do, the silent artillery of time has done. They've all died. And now that they have crumbled away, that temple must also fall unless we, their descendants, supply those places with other pillars. They had a task to perform, and nobly they performed it, to uprear on these hills and valleys a political edifice of civil and religious liberty, equal rights. But there remains a task for us as well, to transmit these multiplied blessings, unprofaned by the foot of invaders, undecayed by the lapse of time, untorn by even the subtlest of tyrannies or political usurpation. My friends, I think gratitude to our fathers, a love for our species in general, a sense of duty to our own posterity ought to instill in us a moral imperative to faithfully execute our task. But how? How should we perform it? At what point might we expect the approach of danger? Why even suppose any danger to our institutions? Have we not been able to perpetuate them thus far? Well, first of all, to conclude that no danger may ever arise would in itself be extremely dangerous. And my friends, there are now. There will hereafter continue to be many causes very dangerous in their tendency, which have not even existed heretofore, and which merit our attention. So, at what point do we, in fact, expect the approach of danger? My answer is, if it ever reaches, it will first spring up amongst us. The duty of self-preservation rests solely with us, the American people. Oh, my friends, I think we have an ever-growing interest in maintaining the free institutions of this country. I am exceedingly anxious that this union, our Constitution, the very liberties of this people will be perpetuated in accordance with the original idea for which that struggle was made. Now, we know that when that struggle was made in the American Revolutionary War, some terrible sacrifices were made by the men engaged in it. I remember when I was a boy, I got hold of a little book, probably such a one as none of you have ever even laid eyes upon. It was called Parson Weems' Life of General George Washington. And I remember reading in that book of the danger that those people incurred simply by assembling as we are today when they framed and adopted the Declaration of Independence and the terrible struggles they endured in order to secure that independence. And I remember thinking, and I was just a boy, there must have been something more than common that those men struggled for. Something more than just national independence. Because by what they then did, it has followed that the degree of prosperity and liberty which we now enjoy has come to us. And so, my friends, ought we not to inquire what it is that has given us so much liberty and prosperity? Because to lose that would be to lose it all. It's not our frowning battlements, our bristling seacoasts. It is not the guns of our war steamers. It is not the strength of our gallant and disciplined military. All of those elements can be turned against any people without making the people themselves any weaker for the struggle. My friends, our reliance is in the love of liberty, which God, the love of liberty, which God Almighty has planted in our bosoms. In our defense is in the Spirit, which prizes that liberty, heritages of all men, every race and every instilled by God Almighty.
I'm trying to keep this event on for you all, but we keep losing the signal. I'll try to be patient for just a little bit because I know a lot of you are here to watch this in particular, but again, we keep losing this live signal here.
But for it, we wouldn't know the difference between right and wrong. And you see, that's the real issue. That is the issue that will continue in this country long after these poor tongues will be silenced forever. It will remain this great eternal struggle between the two principles of right and wrong. Throughout the world, those are the two principles that have stood face to face ever since the beginning of time, and will ever continue to struggle. Every little shifting of the political scene or the actors thereon only clears away all the intervening trash, compacts, consolidates the opposing forces, and brings them more and more distinctly face to face. So, my friends, they say, and it has been said in this world's history hitherto, that might makes right. But I believe it is for us and for our time to reverse that maxim and to say that right makes might. The Lord is always on the side of the right. And anxiety that in this nation shall be found on the Lord's side. Yes. It is for Abraham Lincoln, 16th President of these United States. I recommend to all the people that you unite with me as the Chief Magistrate. Loyal, abiding citizens, and reverently humble ourselves in the dust, and from thence to offer up fervent prayers to the God of nations, in whose hands are the destinies of everyone. We must implore his compassion and forgiveness. We must implore him not to destroy us as a people or suffer us to be destroyed by the hostility or connivance of other nations or by obstinate adherence to our own human counsel. We must implore him to lead this nation through the paths of repentance, to enlighten the mind of this nation to know and to do his will, humbly believing that our place here on earth should be maintained as a united people among the family of nations. My friends, if we do not do right, I believe that he will let us go our own way to ruin. But if we do right, I believe he will lead us safely out of this wilderness. I will admit that our Republican robe has become soiled and trailed in the dust. Let us repurify it. Let us turn and wash it white in the full conviction that the fear of the Lord is the beginning of wisdom.
Not gonna lie, that's the most people I've seen in Times Square in New York City in quite some time. They are in their reopening stages, so a lot more people out and about. I want to acknowledge the person that said, thanks for the effort. We continue to lose the feed out of Mount Rushmore. Unfortunately, I've got 2 ways to get the feed from South Dakota, and neither one are working at the moment. I am trying. I am staying on top of it. My name is Pilar Arias. Thank you to the 546 of you watching on YouTube and for all of you watching on coronavirusnow.com. But again, unfortunately, I don't have control over this stability of these live feeds coming in, unfortunately. So when and if we get Mount Rushmore back, I will take you there. But meanwhile, I do want to show you the update from the World Health Organization, WHO for short, in regards to the coronavirus from yesterday.
Further ado, I will give the floor to Dr. Swaminathan. Soumya, you have the floor.
Thank you very much, Fadela, and good morning, good afternoon, good evening, greetings to the journalists who are online. And it's a pleasure for me to provide a very brief overview of what happened over the last 2 days. Many of you may remember that in February, WHO convened the first Global Research and Innovation Forum that brought together over 400 scientists and researchers from all over the world. At that time, we had just learned about this new virus, the SARS-CoV-2, and the idea was that we need to get together to really discuss what are the major research priorities, what do we need to learn about this virus and how it's impacting us. This resulted in a research roadmap that was released at the end of February, and that I think has shaped the global research agenda to a large extent. It also resulted in the creation of 9 working groups, and we'll run through the topics around which the working groups were created. Each of these working groups was coordinated by a WHO staff member, but basically consisted of experts from around the world, and some of the working groups have more than 100 people, some are a little smaller, but experts from all around the world, voluntarily joined these working groups, and over the last few months have been working on their own areas of expertise and topics. Today it seems incredible that it's just 6 months ago that we actually learned about this cluster of cases of pneumonia originating in Wuhan. And none of us could have, I think, imagined
I worked my
when
way
we
up.
woke up on the
I
1st of
danced with
January
36
that 6
hoops
months
now.
along, this is where we're going to be grappling with this pandemic.
As I started to learn obstacle, and then you build your story as you go. The designs that I make represent the four-legged, the winged, the rooted, and all the two-legged. We as a nation are going through a tough time right now, but together, through our songs, our dances, through our prayers, we can heal as one. And I'm very honored to say that as a two-time world champion hoop dancer, not only did I go down to the world championship and compete against all men, but I beat them even in a dress. I am also a proud representation of a mother, a proud mother of 5 beautiful children. My son is a month old, and each and every one of my children, have grown up seeing and understanding who we are and where we come from. We are standing right here in our sacred Paha Sapa, the Black Hills. And for myself, it's an honor to connect with our Mother Earth. You have the Ate Makpia, which is the Father Sky, and the Unchi Maka, the Mother Earth. They come together to form this beautiful balance, this creation of life for us to live in. And what better way to come back and give thanks and recognize, and also to be able to honor those that are not with us, that have fought and went through that struggle for us to have our freedom today. So this dance is going to be dedicated to those that have sacrificed their lives for us to be here. Even through a pandemic, we come together and we are here to pray for one another. And I share this hoop dance with you today. So you will see these designs like an eagle, a butterfly, a flower. That is a representation of not only the Lakota, Dakota, Nakota, but also of this female aspect of what we call the hoop dance.
All right, everyone, really quickly, just popping in here, Pilar Arias. A lot of you are wondering, hey, what's going on? We've been losing this live signal from Mount Rushmore from time to time, so we've been having to go to different things and come back to it. But again, we are watching the Independence Day celebration at Mount Rushmore that President Donald Trump will be speaking at later this evening.
Ladies and gentlemen, thank you for attending tonight's event. Please remain seated for the departure of the official party.
Ladies and gentlemen, please welcome Daryl Red Cloud.
Armed Services. Today, it's a pleasure for me to be standing here in front of you all today to bring awareness to the indigenous people of this land. I come up here to share a little bit of our history about the Black Hills, on how the Black Hills are very sacred to our people. In our language, we say, Maka lelakan, Wakayan. This land is sacred. Our origin stories, our creation stories, exist within here, come from here, the Black Hills. Our people, the Lakota, Dakota, Nakota, Ocheti, Shakoi. Our people, our origin, our culture existed within here, the Black Hills. The Black Hills are central to our lives. This mountain here was known amongst our people as Itacha Shakpe. 6 Chiefs was the name of this mountain. It was a sacred burial site to our people. Our history goes and exists here for thousands and thousands of years. Amongst our people, how we educate on how to walk in harmony upon Mother Earth, on how to acknowledge all of creation and our existence within. Our elderly, our people, share our stories of life through orally, through story, song, and dance. This is how we teach our people how to exist upon Mother Earth in harmony. As we tell our stories, we start to sing our songs, the grandfathers, the grandmothers, the songs of our people represent all of creation and how we need to be together on this road of life. origin story. We say we came from great spirit or spirit's realm into this spiritual realm through a place called Wind Cave. We call it Onie Wakan. From there, everything came out. They say at that time, mankind's skin was the same color. We say life began in this country. From here, everything went in different directions. Animals of different kinds, mankind went in different directions. And this land broke apart after Mother Nature, after a great race that was done around the Black Hills. From there, the pieces of land that drifted out into the oceans and came to rest where they rest today. Because of mankind, animals and plants alike, they existed in those environments and adapted accordingly. Our people say that life began here. There was a story, or there is a theory that say we might have came across the land bridge up north. But if that's the case, then the story I told you, mankind could have went across that way too. Our people existed here within the Black Hills. It is central to our existence. It is very sacred to our people. Our people, not only our people, but other indigenous tribes, other indigenous people, they have utilized the Black Hills sometime or another throughout time, such as the Comanche, the Kiowa, the Plains Apache, the Mandan, Hidatsa, Arikara, Cheyenne, Arapaho, Crow. Different tribes utilize the Black Hills as a sacred site. But when gold was found in these Black Hills, everything changed for our people. A lot of things don't sound too good when you tell the truth of what really happened to our people. Today, I want to share these things with you. I want to share the stories of our people. Our people are really still here in this country. Our people, our warriors join all the different armed forces and protect this land. But it seems like at times we're the forgotten people. We need to be recognized for all the land that has been taken away from our people. And we all know that history. We are still here, and we are never going to go away. The Black Hills are not for sale, and they will never be for sale. This is Lakota land. Our old ones told it like this. They said, keep it this way. Keep this land beautiful just the way it is, so that it may stay this way for the future generations to come. The unborn, the ones that are crawling upon Mother Earth, the ones that are soon to walk, they deserve a fresh drink of water. They deserve a breath of fresh air. And they deserve to see this beauty, just like we do today. Keep it this way, and it will be here for a long, long time to come. We need to come together just like the circles of life. No matter where we come from, no matter what race we are, we need to have respect for one another. We all come from different directions in life, but we come into the center of the circle as one, the way it should be, the way it was meant to be. My name is Wamli Shio Ahi.
Ladies and gentlemen, Sequoia Cross White.
Aho matakiapi, all my relations. First and foremost, all praises and glory go to the Most High. Sequoia Crosswhite Ema Chapelo. I'm a enrolled member of the Cheyenne River Sioux tribe. Itancha Wamdi o Kichize ki mitun kashila. Naha mak pia luzaha mitun kashila. I am a descendant of two chiefs, Chief War Eagle and Chief Swift Cloud. I'm also a proud grandson of a grandfather who flew a P-47 96 times in World War II. I'm also proud of son of a very hard-working construction worker that keeps going every day. And I thought I'd take this time in this moment to share a little Lakota philosophy with language and with music. And I have three words in particular that I wanted to share with you guys. The first one that I have for you is the word for peace in Lakota. And the way we say peace in Lakota is wo Lakota. And the composition that I thought to play for tonight for that word was a song that I made called Ikchewi Chasha Chea, means a common man's cry. Because in tears we have happiness, we have sadness, but we also have peacefulness. So here's Ikchewi Chasha Chea, a common man's cry. And the next word I wanted to share with you in Lakota is a word that we all need. As human beings, we all need this. Babies need this to grow, and we are all babies inside, and that is love. And the word for love in Lakota is tahila. And the best way I could bring love together is two becoming one. So this next composition, I'm gonna play two flutes at the same time for one song, one message, the message of love, tahila. And for our last few tunes here, just express the understanding of what the name of our tribe is for my brother and sister who performed just here earlier. The understanding and the meaning of Lakota is the gathering of friends and allies. And when we act as friends and allies, then we bring peace, and we have wo Lakota. Another word that we have in our language, and we use it before we enter our ceremonies, and we say this at the end of our prayers. And we say, mitakuye oyase, meaning no matter what color our skin is, our hair color, our eye color, we are all related. And so we must judge each other not by those aspects, but by character, because character counts. So seeing that I have a little bit of time, I'd like to kick out a song for what we call love and bringing together, and then to also to honor the ones that have lost lives in this tragic times that we've been getting through, and we're making it through, right? We're getting through this. But we've had some loss across the board, across the world, and I thought that I would give a memorial and an honor song for that. And also to have this in the word in Lakota we have for unity, which is wajila, unity. And this is for all those out there in honor of them who have lost someone this last year. Wopila tonke chichapalo. Mitakuye oyase. We're all one related, one people, one nation. Stand strong. Let's all get together. Thank you so much. All praises and glory to the Most High.
Ladies and gentlemen, please take your seats as the program will begin momentarily.
evening, depending on where you are watching the Fox News Now stream from. My name is Pilar Arias, and take a look at this shot that we have of Air Force One landing in South Dakota. The president headed for Mount Rushmore, that big Independence Day celebration. He's not alone. First Lady Melania Trump is with him. He's going to be giving a speech ahead of the fireworks show. It's all expected to kick off at 7 o'clock Arizona time, 10 p.m. Eastern, and you're going to be able to watch it all right here. Hey, we have 2 live streams going on here now. We've got the original one that Mike Pace launched earlier today with all the day's news and updates, coronavirus news, protest news, and the like. And now we have the Mount Rushmore event stream going as well. I do want to let you know, as you can imagine, with such brilliant photography here, they've got a lot of people working behind the scenes. This live feed is currently being brought to us by the White House, courtesy of the White House. I mean, we see Air Force One all the time on the ground, but look at that plane right now flying in the sky. Those are some pretty cool aerial shots, right? And I've only been to Sioux Falls, South Dakota. I haven't seen much of the rest of the state, but look, you're getting to see all the scenery as well. Absolutely, positively gorgeous. Again, we're probably about an hour and a half away from the president being at the podium if everything goes off as planned. Happy Independence Day weekend, everyone. Happy 4th of July. Many people celebrating the holiday today, observing it today, and that's because it falls on a weekend. Very rare that we get a holiday falling on the weekend that gets to be observed on either a Friday or a Monday. So it's one of those rare occasions. 2020 just keeps bringing the surprises and the unusualness. Am I right? Again, my name is Pilar Arias. Thank you so much for choosing us to watch this. I hope you are with family, friends, loved ones, safely enjoying and celebrating the holiday. Remember, if you do choose to light off fireworks, do it safely. We don't want to see any injuries. Again, we are watching this Mount Rushmore Independence Day event, courtesy of the White House. Thanks for being here, everyone.
Into those eyes and see an ounce of pain.
Ladies and gentlemen, the 147th Army Band, South Dakota National Guard.
Ladies and gentlemen, we are the 147th Army Band of the South Dakota Army National Guard. Please welcome our commander, Chief Warrant Officer 5, Terry Beckler, as the band performs America the Beautiful. I was born on the 4th of July, 1776, and the Declaration of Independence is my birth certificate. The bloodlines of the world run in my veins because I offered freedom to the oppressed. I am many things and many people. I am the nation. I am 295 million souls and the ghosts of millions who have lived and died for me. I am Nathan Hale and Paul Revere. I stood at Lexington and fired the shot heard round the world. I am Washington, Jefferson, and Patrick Henry. I am Independence Hall, the Monitor, and the Merrimack. I am Lee, Grant, and Abe Lincoln. I remember the Maine, the Alamo, Pearl Harbor, and September 11th. I am John F. Kennedy and Martin Luther King. When friends called, I answered and stayed until it was over there. I left heroic dead on Flanders Field, on the rocks of Corregidor, on the bloody hills of Korea, and the steaming jungles of Vietnam, and the shifting sands of the Persian Gulf. I was held hostage in Iran. I am the wheat fields of Nebraska and the Black Hills of South Dakota. I am the coal fields of Pennsylvania. I am the Golden Gate and the Grand Canyon. I am forest, field, mountain, and desert. I am the quiet villages and the cities that never sleep. I am the ballot dropped in the box, the roar of the crowds, and the voice of a choir in a cathedral. Yes, I am the nation, and these are the things that I am. I am conceived in liberty, and God willing, in freedom, I will spend the rest of my days. May I possess always the integrity, the courage, and the strength to keep myself unshackled, to remain a citadel of freedom and a beacon of strength for the rest of the world. This is my wish, my goal, and my prayer, because 244 years after my birth, I am the United States of America. Since 1921, the 147th Army Band has been stationed in Mitchell, South Dakota, home of the world's only corn palace. In 1911, O.H. Anderson composed a march in honor of this iconic building. In 2004, a former commander of this band, Joseph Peckus, arranged it for the concert band. To celebrate almost 100 years in Mitchell, the band will now perform the Mitchell Corn Palace March. The band now continues with a march appropriate to this site and the freedoms that we enjoy. Here is Carl King's Hosts of Freedom. Rushmore by Alfred Reed was commissioned to commemorate the 10th anniversary of the Rushmore Music Camp. First performed in 1980 on this very stage, this selection combines a little of America the Beautiful into a wonderful tribute to this site and a local camp that was started over 50 years ago. Washington, Jefferson, Lincoln, and Roosevelt, leaders of character, shapers of a nation. Each is best defined by his own words. George Washington, father of our nation, leader of the Continental Army, and the first president of these United States. In his farewell address, he spoke, "Citizens, by birth or choice of a common country, that country has a right to concentrate your affections. The name of American, which belongs to you in your national capacity, must always exalt the just pride of patriotism, more than any appellation derived from local discriminations. You have in common cause fought and triumphed together." Thomas Jefferson, third president of our country, a planter, a philosopher, and author of the Declaration of Independence. He wrote, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. That to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. Abraham Lincoln, America's 16th president, the great emancipator and protector of the Union. In his great speech, 77 years ago, our forefathers brought forth on this continent a new nation, conceived in liberty and dedicated to the proposition that all men are created equal. In his second inaugural address, Lincoln closed with malice toward none, with charity for all, with firmness in the right as God gives us to see the right, let us do all which may achieve and cherish a just and lasting peace among ourselves and with all nations. Theodore Roosevelt, 27th President of the United States, the man of the bully pulpit, the leader at San Juan Hill, spoke of his two predecessors. We of the United States have passed most of our years of national life in peace. We honor the architects of our wonderful material prosperity. The Americans who stand highest on the list of the world's worthies are Washington, who fought to found the country which he afterward governed, and Lincoln, who saved it through the blood of the best and the bravest in the land. Washington, the soldier and statesman, the man of the cool head, dauntless heart and iron will, the greatest of the good men, and the best of the great men. And Lincoln, sad, patient, kindly Lincoln, who for 4 years toiled and suffered for the people. Each man defined our spirit, each man made immortal, carved into the landscape of South Dakota, Washington, Jefferson, Lincoln, and Roosevelt. They are Rushmore. During World War II, the 147th Army Band was a part of the 147th Field Artillery and served in Australia and in New Guinea. To honor that history, the band now performs the 147th Field Artillery March by Carl King.
Good evening, everyone. Thank you so much for watching this celebration at Mount Rushmore for the 4th of July, Independence Day, right here on the Fox News Now stream. We do have two concurrent streams happening right now. I am going to say, if you are not currently watching on the stream that has more than 18,000 people watching, you're watching on the stream that has less than 500, I am going to end that stream. That's our stream from earlier today with a bunch of coronavirus and other updates from across the country. Again, if you are not watching the YouTube stream that has more than 18,000 15,000 people. Please make the switch now. We're having technical difficulties on the stream that has much fewer viewers, so I'm going to be ending that stream. But again, thank you for watching. Happy Independence Day. Happy 4th of July. Happy holiday, everyone.
The 147th Army Band also breaks down into smaller music groups to support soldiers, their families, and their local communities. Out of the group that you see before you, this band will split into a rock band, a country band, a small pop group, a top 40 group, and a brass group. Today we'd like to feature one of our groups, our country group, that goes by the name of Drive On. By using these smaller local teams, we've been able to support many more troops, both in their community